Morning, everybody. Going to open up the Appropriations Committee's public hearing for April 3rd. Is Mayor Elicker online? Not yet. Okay. Deb Poulin, you're up.
Thank you. Good morning, Senator Austin, Representative Walker, members of the Appropriations Committee. For the record, my name is Deb Poulin. I am the Chief Strategy Officer at the Community Health Center Association of Connecticut, CHC Act, and we work with the state's 17 community health centers who provide primary medical, dental, and behavioral health care to 440,000 people across our state, in every corner of the state, the big cities, rural areas, and small towns in Connecticut. We're here today to provide some comments on House Bill 7254 regarding the DSS implementation of changes resulting from the Medicaid rate study. And we want to thank you for bringing legislation forward that would actually implement rate increases. It was a good experience to have the two phases of the rate study so that we could really see what the gaps are and how Connecticut stands in comparison to other states. And we saw for health centers that the states that were chosen by DSS, health centers are underpaid by about 20%. We, as an association, added in Massachusetts and Rhode Island because we were able to get their rates. That let us know that we're actually paid about 25% less than those comparison states. We also have done a lot of work around our cost reports, which health centers are required to file with DSS every year. And so we know what the gap is between how much it costs to provide services at health centers and what they actually are paid through Medicaid rates. That gap in my written testimony, you'll see, was $80 million. We have actually been able to reduce the gap to $74 million. And part of that is due to some rate increases through DSS, but the main way that we've been able to reduce the gap between cost and rates is actually by reducing services. So we used to have a gap of about $10 million in rates for dental. That new gap is about $6.4 million. And how that happened was, unfortunately, health centers reduced their dental services last year, and more has happened over the past couple of months. And we have seen about a 23% reduction in Medicaid dental visits at health centers over the past year. So we would encourage you to move forward with rate increases. All providers need them. I'm here just specifically to ask about health centers, and we're happy to work with the committee to try to make that happen. This is an urgent situation for Husky enrollees and for other health center patients as services begin to close, and health centers are leaving vacant positions longer than otherwise would be the case. We really, really need your help to prevent this from occurring and to protect access to high quality medical care, dental care, and behavioral health care at health centers. Thank you.
Thank you. Are there any comments or questions? Seeing none, you got off easy today, Deb. Jeff Vanderplug. Jeffrey, the floor is yours, sir.
Good morning, distinguished members of Appropriations Committee. My name is Dr. Jeffrey Vanderplug. I'm the president and CEO of the Child Health and Development Institute, and we're a nonprofit located in Connecticut that focuses on advancing optimal behavioral health and well-being for children, youth, and families in Connecticut. I wanted to start today actually with a story. So imagine that the Department of Transportation needs to pave 10 miles of highway in Connecticut. And they put out a bid to prospective asphalt contractors, and that bid states that the DOT will pay the contractor to pave 6 miles of that highway, but they expect the contractor to fundraise to pay for paving the remaining 4 miles. Do you think there's a single asphalt provider in America that would take that deal? Not a chance. But this is essentially the contract that we put out in front of behavioral health providers all the time. And here's the amazing thing. They take that contract year after year. And why do they do that? Is it because they're bad business people? You're going to hear later today from people like Sabrina Trocchi, who's here already, or Alice Forster. And you'll learn very quickly that is not the case. They are not bad business people. They do it because they are completely and totally committed to the mission, which is to do whatever it takes and to do it year after year against the odds. But the scary question is, for how much longer can they take that deal? So you're going to hear a lot of great ideas. I hope that 10-mile analogy comes back into your mind. We already heard today about the DSS Commission Medicaid study. And in that study, we found that on average, Connecticut's Medicaid behavioral health rates are only 62% of the average of a group of comparison states. So let's look at how that applies to something like our urgent crisis centers, for example. A study by CHDI commissioned by DCF found that 98% of youth admitted to and served in the UCCs are discharged home instead of to the emergency room. 52% of those who are served in UCCs say that if the UCC was not available, they would have gone to the emergency department. So that's powerful data. That's return on investment. Right now, the plan is to fund UCCs with a $7.6 million appropriation in DSS budget. There's a couple of issues with that. First of all, UCCs currently receive ARPA funds totaling $13.6 million. So right off the bat, there's a $6 million gap. And of course, the other issue is that limiting funding to Medicaid for UCCs leaves out the 42% of youth who are currently seen in UCCs who are not enrolled in Medicaid. So today I'm advocating for continued grant support for the UCCs in addition to an enhanced Medicaid appropriation for UCCs. A second point I wanted to make is about the workforce. We could appropriate millions of dollars in services today. That would be great, but do we have the workforce to actually deliver that care? So I think we need to pay attention to things like a study where we found that the rate of turnover is 39% annually in the behavioral health workforce. Rates are a big part of addressing that, but we also have a comprehensive strategic workforce plan available. It's CHDI produced to take a look at other comprehensive strategies to address the workforce issue. So 3 points. I know Representative Walker loves hearing 3 points, so here they are. Number one, increase Medicaid rates to get from 62% to the peer state average of at least 100%. That's going to be critical for expanding services and addressing the workforce. Address the 39% turnover rate by further supporting the behavioral health workforce. And I didn't get into this much, but support our ability to measure and report on access, quality, and outcomes by investing in data infrastructure. Thank you.
Thank you very much. Does anybody have any comments or questions? Seeing none, you're all set. Up next is Sabrina Trokey. You were already called out in his speech, so the floor is yours.
Good morning. Sabrina Trokey, President CEO of Wheeler. Wheeler is a community-based health center and a community-based behavioral health provider. As a community health center, Wheeler offers integrated primary care behavioral health services to over 22,000 children and adults across Connecticut. Our 5 health centers are located in Hartford, New Britain, Bristol, Waterbury, and Plainville, in addition to 17 school-based health centers in Bristol and New Britain. Over 70% of our patient population at our health centers are on the state Medicaid program. As a community behavioral health provider, Wheeler offers child welfare, foster care, mobile crisis, in-home behavioral health services, early childhood, community justice, special education, and prevention and wellness programs to over 48,000 children, families, and adults across Connecticut. Those services are primarily state grant funded. I thank you for the opportunity to comment and provide support for House Bill 7254, an act concerning DSS implementation of changes. I can sit here and once again remind you that the health center rates are based from 2000 and 2001 cost reports. I can sit here and remind you that the completed DSS cost rate analysis demonstrates that health centers are on average being paid 20 to 25% less than our peer states. But the part that I really want to focus in here is Connecticut health centers. We can no longer be subsidizing the state's Medicaid program. The inadequate rates make it difficult to treat our patients, make it difficult to treat our communities. Community health centers have started to shut down services and are looking at potentially shutting down sites. We are in desperate need and need immediate relief today. I also want to provide support for State Bill 1547 and Act concerning funding for nonprofits. While I appreciate the increases that we've gotten over the last few years, they do not make up for the 10 plus years of no increases to a number of our grants. At this time, there is an increased demand for our services. We need to be able to pay our workforce appropriate wages to continue to do the critical work for the state of Connecticut and for the 48,000 plus individuals we're serving with these programs. I am requesting that you increase the funding for vital nonprofits like Wheeler in fiscal years 2026 and 2027. The state can afford to save for a rainy day. The state can afford to pay down debt, and the state can afford to fund essential services for Connecticut residents. Please support increasing funding for community nonprofits. Thank you.
Thank you. Any comments or questions? I have one question. The Senate bill that you talked about, 1547, is designed to come up with a way to indicate rate increases on a more comprehensive basis to show rate increases on a yearly basis. In this case, it's connected to state employee increases. Do you think that that would start to address the issue relative to increases for nonprofits?
Around workforce issues, my largest competitor for my behavioral health clinicians and many of my other clinical services are state agencies. We are seen as a training ground where we put in all of the work to train, to start them as interns, and then as soon as they're licensed, they know they can do very similar work and go to the state agencies and be paid much higher and get better benefits to do that work. So I think this bill would help bring some parity between the state and the nonprofit workforce issues.
Thank you. Any other comments or questions? Seeing none, you're all set.
Thank you.
Thank you. Tracy Wodash. Is Tracy online? Alice Forrester? Yes.
Here I am. Yes. Hi, good morning, Senator Austin and the members of the Appropriations Committee. Thank you so much for your unwavering attention to the mental health system delivery in Connecticut. I'm Alice Forrester. I'm the CEO of Clifford Beers Community Health Partners, a network of nonprofits focused on the well-being of children, youth, and families across Connecticut, from Norwalk to Madison, New Haven to Bethany. I'm here to testify on House Bill 7254, the Unmedicaid Rate Study, and SB 1547, Act concerning funding for nonprofits. I'm here representing Mid-Fairfield, Clifford Beers Community Care Centers, mental health agencies, both, and Youth Continuum, which does homeless and shelter for youth 16, 18 to 24. Together, we serve over 8,000 youth and children across Connecticut, and we're fully committed to our communities. Actually, between us, we share almost 225 years of service to the state of Connecticut. And frankly, we've reached the end of our rope. We have contributed greatly to the system of care for kids and families in Connecticut, but at this time, any growth based on the severely underfunded state programs costs our organizations hundreds of thousands of dollars. I'm here to say that Connecticut's inability to inadequately fund its child and family mental health services has caused us to face a growing concern: poor cash flow, difficulty meeting existing liabilities, and overall concern of making ends meet. Above all, not being able to serve our kids and families in our communities. Not having adequate funding covers the cost of the delivery of services has reached the boiling point in our organizations. For example, one of our group homes funded by DCF loses over $200,000 a year. Our outpatient clinic over multiple years has lost hundreds of thousands. These numbers are dire. We can no longer make it up through philanthropy and fundraising. With the turmoil we're all facing in Washington, I believe you still need to keep your eye on funding fairly the mental health services in Connecticut. We have models for it. In 1944, after the Great Depression and the ending of World War II, Connecticut State Division of Child Welfare and Juvenile Court agreed to pay $10 per person for diagnostic or treatment services. If that $10 was transferred into today's value dollars, it would equal $180. We get reimbursed from DCF 93. DCF outpatient grant covers maybe about $50, but only for the kids who are under 18. And what happens is we have $67 not covered by any income. The adjustment that you need to make should not be incremental or piecemeal. We implore you to increase the Medicaid rates as the study states that by 56.9 million recommended by the first part of the 24 study. In addition, nonprofits should be increased by 264 million in 26 and another increase of 8% in 27.
The workforce.
It has been too long that Connecticut has not lived up to its duty to appropriately fund the mental health services. I love what Sabrina said. The state can afford to stay for a rainy day, afford to pay the pension fund, and afford to pay what it costs for the units of service that we deliver. Thank you very much for all you do.
Thank you. Are there any comments or questions? Thank you, Alice. Up next is Dr. John Satterfield. Floor is yours, sir.
Morning, co-chairs Austin and Walker, ranking members Somers and Nuccio, distinguished members of the Appropriation Committee. Thank you for the opportunity to testify today. My name is John Satterfield. I'm a practicing anesthesiologist in Connecticut for the last 34 years and a past president of Connecticut State Society of Anesthesiologists. I applaud your efforts to address the Connecticut Medicare rates, and I respectfully request that you increase rates for Connecticut anesthesiologists this legislative session. We have not had a rate increase in Medicaid since 2006. Firstly, tying any form of reimbursement to the Medicare system is flawed for anesthesiologists, as the Medicare system is broken for us. In the process of updating the Medicare payment methodology in the 1990s, a tragic calculation error was made, and it is now well recognized that anesthesia services are woefully underpaid by Medicare. In 2007 and again in 2020, the Federal Government Accounting Office, the GAO, confirmed this fact, and that's demonstrated in this diagram. Physician specialties typically experience Medicare payment rates that are 80% of average commercial rates. The GAO found that anesthesia payment rates to anesthesiologists for Medicare in 2020 were only 27% of average commercial rates. This represents a huge underpayment by Medicare to anesthesia departments nationwide and does not begin to cover the cost of providing care. This underpayment to anesthesiologists is further compounded by Connecticut Medicaid reimbursement rates, which are obviously lower than Medicare reimbursement rates. Furthermore, in this diagram, you can see the compounding effect of inflation over the last 20 years as the lines diverge. There is no Medicare inflation adjustment for physicians. Unlike hospitals, so from 2000 through 2021, the real value of Medicare payment to physicians has significantly decreased. Medicaid rates do not begin to cover the cost of providing care to Medicaid patients in Connecticut. Yet, every patient that comes to a hospital and requires surgery has that care delivered by a Connecticut anesthesiologist. It's time to address the massive Medicaid underpayment to Connecticut anesthesiologists. Thank you very much for your time. I'm happy to answer any questions.
I don't have any questions for you. We know the rates, but I'm going to ask you to email those charts to the administrator so it can go out to everybody.
Sure.
All due respect, I can't see that far away. You had those lines converging and I was like, I'm not certain what you're saying here, but I know what you're saying overall.
Thank you. They're in our written testimony too, but we definitely can email
Great.
them. Yeah, their same charts are there.
Thank you.
And some additional information.
Great.
Thank you
Thank
very
you.
much.
Anybody have any comments or questions? Seeing none, you're all set, sir.
Thank you very much.
Thank you. I'm going to go back to Tracy Wodich online. Tracy?
Thank you, Senator Austin. I apologize for being late. Distinguished members of the Appropriations Committee, my name is Tracy Wodach, President and CEO of the Connecticut Association for Healthcare at Home. Our association is the united voice for our licensed home health and hospice agencies, as well as several non-medical homemaker companion agencies. Together, our members provide services that foster cost-effective home care for Connecticut's residents in the setting they prefer most, their own homes. The association supports House Bill 7254, an act concerning the Department of Social Services implementation of changes resulting from the Medicaid rate study. But we would like to offer several crucial recommendations. We wholeheartedly support the state acting to best serve its Medicaid population and agree that a DSS report concerning the implementation of the rate study is needed, but it must be in conjunction with accelerated, not phased-in, Medicaid rate adjustments, while also addressing some shortcomings of the study. We also support the continual and dependable review of Medicaid rates of reimbursement, but once every 5 years is far too long, given the unpredictability of costs, rapid growth of home care needs, and critical workforce challenges. We suggest rate reviews at least every 2 years. Lastly, we support and encourage the language allowing the DSS commissioner to increase and rebase rates using a more current Medicare base year. It's no secret that Medicaid rates, particularly for home care, have fallen behind significantly. Regarding the Medicaid rate study on which this bill is based, we note a significant flaw in the study. The study failed to account for key home health reimbursement rates, most notably medication administration, T1502, and continuous skilled nursing, S9123TG. These omissions are highly problematic because the medication administration rate represents over 50% of the Medicaid home health expenditures. Excluding it from the rate evaluations renders the study incomplete and misleading when used as the basis for funding decisions. The study states there's no other state equivalent for comparison. However, Massachusetts has a medication administration rate for their behavioral health population. There's more information in my written on this. S9123TG, continuous skilled nursing, while mentioned in the study, is not one of the rates studied. And while it's a smaller line item, failure to align these rates, especially to our bordering states of Massachusetts, New York, and New Jersey, would be an extreme oversight, resulting in fewer cases in the community, forcing higher, far more costly institutional stays. In addition, please note written testimony from Aviana on this oversight, jointly supported by our other CSN providers and the association, has been submitted. We urge the Appropriations Committee to align Medicaid reimbursement rates with the true cost of providing care. This investment is not just about sustaining agencies. It's about safeguarding access to care for our state's most vulnerable populations at a most cost-effective service line. On behalf of the Connecticut Association for Healthcare at Home, we would like to thank you for your time and considerations. And if you have any questions, I'm happy to answer them.
Any other comments or questions? Seeing none, you're all set.
Thank you.
Up next is Ben Shaken. Ben, the floor is yours.
Thank you, Madam Chair. Good morning to members of the committee. My name is Ben Shaken. I'm the Director of Government Relations at the Connecticut Community Nonprofit Alliance. It's good to see you this morning. We have submitted testimony on several bills on your agenda. We're in support of Senate Bill 1551, funding for the arts, We've submitted, will submit comments on your special education bills. I want to spend my time today talking about two bills. One is House Bill 7254, the Medicaid rate bill that others have been speaking about so far. I'd just like to encourage you to amend language in that bill to increase rates for behavioral health services. You've heard a lot from our members over the budget hearings and probably will today about our request from the legislature this year to increase funding for nonprofits by $264 million. That includes Medicaid rate increases for behavioral health and autism services in the full amount called for by the Medicaid rate study. For behavioral health, the rates that the study looked at in the 5 comparable states are 117% higher than what Connecticut is paying behavioral health providers. This isn't news. We published a study 10 years ago now in 2015 that showed that the annual loss in Connecticut for the top 10 behavioral health procedure codes by volume was more than $27 million. And since then, rates have increased once by a few percent in 2021. While costs have skyrocketed. Also want to talk and spend the rest of my time on Senate Bill 1547, which would index funding for nonprofits to raises that state employees receive. Since 2007, this is where the other part of our $264 million number comes from. Nonprofit costs have risen by 45% based on the inflationary measures that we track. And since 2018, the legislature has fought for funding increases for nonprofits in the state budget, and they've added up to about 15%. And so that leaves us about 30% behind. If these rates had instead increased annually with inflation, our request for funding for you every year would be very different. And we wouldn't need to request that this committee find hundreds of millions of dollars in the state budget to just keep pace with nonprofit costs. It would also make life more predictable for you as the legislature's budget writing committee. The legislature, the Office of Fiscal Analysis, the Office of Policy and Management, when they make their budget projections into the future, they're basing them off of only what current statutes say will happen in the future. And there's nothing in current statute that increases nonprofit funding year over year. So the assumption that they make, therefore, is that funding stays flat, the cost stays flat, but in fact, we know that that's not true. There's other parts of our budgetary process where annual inflationary increases are built in. The most relevant example recently is the minimum wage, and that has a significant pressure on our members. In 2024, the minimum wage increased by 4.6%. In 2025, it increased by 4.2%. It will increase statutorily automatically every year the employee cost index increases. I'll note also legislative salaries, campaign funds, lots of other things are also been recently added into the budget or into the statutes with inflationary increases. I do have 2 change requests on the bill very quickly. Right now, the bill is indexed to state employee increases, and we would request that the legislature change that to an inflationary measure. There's lots of different things that go into CBAC negotiations. Wages are only one of them. And an inflationary measure would better track nonprofit costs. And then secondly, the bill references funding increases only for salaries and payment rates for employees of nonprofit providers. We encourage the committee to broaden the language to provide just a cost of living adjustment on their contracts, as you have done with the funding that you've provided over the last several budget cycles. All sorts of costs tied to delivering nonprofit services. Wages are by far the biggest one, but health insurance, fuel, vehicles, food, all those other things go into the costs, and to have the funding increase only to wages would make things problematic for nonprofits delivering services. So thank you very much for your time. Happy to take any questions.
Thank you. Representative Walker.
Thank you. Good to see you, Ben. Ben, if we use the CBAC settlement agreements for increasing nonprofits, what would that dollar amount be?
I think the annual wage increase that that are in CBAC agreements, the current CBAC agreements are somewhere in the 3 to 4% neighborhood right now, and so this is sort of just doing that math in the back of my head right now. But I think it would that would be somewhere in the neighborhood of $70 to $80 million. The total amount of funding that goes into the nonprofit system that we sort of count towards our cost of living adjustment every year when we back out a percentage increases is just under $3 billion. It's about $2.8 billion.
Okay.
So
Okay. Thank you, Madam Chair.
Thank you. Any other Representative Corpus?
Thank you, Madam Chair. Thank you for your testimony. Where would be the best source of information to compare the efficacy or outcomes from certain social services delivered by nonprofits versus social services delivered by government agencies. I would like us to think always about where are we getting the biggest bang for our buck. And I think sometimes nonprofits can deliver things more nimbly, sometimes not, but where would be the best source of information to do that comparison? So as we sit in a strained budget year, we can figure out where our investment dollars are most fruitful.
That's a very good question. I know it's one that the legislature is thinking about now. The Government Oversight Committee has passed a bill this session to try to refresh some of that information. I have sort of two ways to answer it. The first way is that the vast majority of social services in the state are delivered by nonprofit providers. So for example, in the IDD system, in the DDS funded system, nonprofits are serving almost 93% of the clients in DDS with residential services. The other part to answer your question is I'm actually not aware of any recent information that the state has put out related to sort of quality or efficacy differences between the two systems. There are reams and reams of quality data that state agencies could provide that are publicly available through state agencies around nonprofit programs, and nonprofits have a very substantial regulatory quality burden that they meet with their state agency contractors. The last time a comparison was written that I'm aware of, at least, was the legislature's former Program Review and Investigation Committee released a study, I think in 2012, that made a direct comparison of quality between facilities that the state operated through DDS and facilities that nonprofits operated through DDS.
Do you have any other questions, Representative? Lucy wants to ask a question because you brought up her bill. So that's what you get for bringing up a bill from another committee.
My apologies.
So,
No, that's what we get.
yeah.
Thank you, Madam Chair, and thank you for your testimony. I do think that this bill is super important to really identify what, our costs really are. But apart from the financial cost, I also think that we need to think about, the continuum of care that these folks in the community need, because they need to have consistent care. And what I have heard anecdotally, and you can confirm this, that a lot of the nonprofit turnover of employees really do affect that continuum. So outside of the financial aspects, to compare apples to apples, it's important, but we also need to be thinking about the sort of more other tangible things. And I went to a regional center on Tuesday this week, and their turnover levels of employees are a lot less than we see in the nonprofits because they are state employees. So just wanted to add that in, and thank you for bringing up that bill. And I hope we get
No
support
questions,
from-
Representative?
Just was going to ask about the tangible aspects.
Oh, because I
outside.
figured you were going to get to a question there.
Yeah, so outside of the dollars, what are the some of the other aspects that maybe my bill doesn't cover?
So it's a good question. I think you're going to hear from a lot of nonprofits throughout the day today. I got lucky and drew an early number. Predictability is really important for everyone. And right now, if you are a nonprofit, you have no idea until Sine Die what your funding is going to look like next year. The legislature will pass a budget. You'll have a sense, hopefully, in the language of that budget, what you're going to get and how you're going to get it, sometimes a better sense than others. I mean, your employees also don't know. If you're an employee of a nonprofit, you have no idea if on July 1st you can expect, or maybe after July 1st when the state finally distributes the dollars the legislature has appropriated, you don't know if you're going to get a raise, you don't know how much it's going to be. Having that predictability with an annual increase built into the budget, understanding all the pitfalls legislatively that could come with that is still a much better place for nonprofits to be, to plan for their budgets, to plan for their employees' increases, et cetera.
Thank you very much. Thank you, Madam Chair.
Thank you. So Ben, you talked a little bit about the coming up with an inflationary measure. There's a couple of inflationary measures. Did you pick one that was better than the other?
So when we calculate our increases, we have chosen the implicit price deflator for state and local government, which is a Bureau of Economic Analysis statistic.
What is it called again?
It is the implicit price deflator for state and local government services. We think it is, of all of the many inflationary measures, it's the one that most closely tracks with our members' costs. The reason for that is it puts a larger onus on services rather than goods. So like CPI tracks goods and commodities and things in addition to services. And so our members' costs are almost 80% or more at least in wages. And so that was the number that we think most closely tracks. There's other things that the legislature's used. Minimum wage is the employee cost index. There's other metrics. The challenge with CBAC, as I started to say but ran out of time, is when CBAC bargains their contracts with the governor, wage increases are of course important to them, but there's other parts of the CBAC agreement that wages could be bargained against. And so to have these increases only tied to wages would mean that if, for example, CBAC wanted a change in the retirement program and bargained away some wage increases in exchange for it, we would, as the bill is drafted, at least only receive increases based on whatever the wage settlement was.
Thank you. And you talked a little bit about the percentage of private providers versus state and state services that are funded. I've looked at this number over and over again. We were very close on the DD work. Are there any, we've closed down state hospitals. Those all went to nonprofits. We've closed down training schools. They went to nonprofits, except for Southbury, which is dwindling. We've closed down a lot of things. The best practices now are to move some of the DD clients to individual apartments. Have you looked at that change in the process? How is that playing out?
Yeah, I believe the 92% number includes all DDS clients who are being served in a residential setting, and that includes folks that are receiving what are called individualized home supports, or IHS, which
Okay.
is folks that are living often on their own, sometimes with roommates, but who aren't living in a group home technically. They may not have 24/7 staff support in those facilities. So that includes, it doesn't include the folks that are still living at home with their families. It's just folks that are in residential settings that are funded by DDS.
Thank you. Any other comments or questions? Seeing none, you're all set.
Thank you.
Up next is Megan Gorman. Is Megan Gorman here? Okay. Floor is yours, ma'am.
All right. Good morning still, Madam Chair and members of the Appropriations Committee. Thank you all for your time today, and I want to also thank everyone in the room and on Zoom who is going to be a part of this public hearing today. I'm here, like many other individuals, to advocate in support of HB 7254, an act concerning the Department of Social Services implementation of changes to resulting from the Medicaid rate study, and SB 1547, an act concerning funding for nonprofits. I liked a lot of the words that I heard earlier while you were asking questions of Ben Shaken, comments along the lines of efficacy, quality of care, and continuum of care. And the reality is that all of those things are made vitally more difficult to achieve because of the fiscal corner that nonprofits are consistently backed into. I'm the community engagement coordinator for a behavioral health organization called CMHA, Community Mental Health Affiliates. We serve over 7,500 individuals every year from all across Connecticut, and I can guarantee you it includes your constituents. We serve at least 2 people from every municipality, something that I made sure to look up. In addition to the services that we provide for individuals who truly would have no other opportunities or options, we are one of the few organizations in this state to have a CCBHC, a Certified Community Behavioral Health Clinic, which is through federal dollars in order to address critical behavioral health or other social needs within a community by a targeted community organization. That's what we are for the areas of central Connecticut, including everywhere from New Britain and Cheshire and Southington to Waterbury, Thomaston, Torrington, Middlebury. We are here and we are doing the critical work in your communities. And yet, year after year, and this year I've testified alone over a dozen bills before many committees, we're struggling to get where we go from here if the very reasonable changes and accommodations that we're requesting can't or won't be made. being backed into this fiscal corner, the walls are going to fall down and we're going to find that there's a cliff on the other side. There is no other way to ensure that we reduce what is essentially a risk and a liability for this state, not dissimilar to the unfunded pension liability that brought us to these fiscal constraints and where we are now. I believe in quality services and efficacy of care. I believe in doing the most that we can with every dollar. Nonprofits have shown we've done that for decades. And I do want to take a moment to encourage you all to look into the comparatives of services between state-operated and nonprofit-operated organizations. My agency is an LMHA, a local mental health authority, and that means that we are the de facto authority for behavioral health. If someone wants to apply for funding for a certain program or grant, they kind of have to get our blessing. They have to partner with us because we're that good. When you compare us to the state-operated LMHAs in other regions, it's night and day. We have a minimum of 800 clients we have to serve through our outpatient behavioral health programs. We've doubled that. We've tripled that. The state-operated, I think under 200. And there is no incentive for them to serve more, and they close their doors when they hit that capacity. We don't. We didn't do it during COVID, and we don't do it now. I welcome any questions you may have, and I'm happy to send more information afterwards if anything I said sparked an idea.
Thank you. Are there any comments or questions? Seeing none? Thank you very much.
Thank you.
Up next is Josh Kelly. Floor is yours.
Thank you very much, esteemed members of the committee. Thank you for holding the public hearing today. My name is Josh Kelly. I'm here to testify for you today on two different bills in two different capacities, so I'm going to talk very quickly. I apologize for that. First, I'll speak in support of SB 1547, an act concerning funding for nonprofits in my capacity as the CEO for the Thames Valley Council for Community Action. TVCCA is one of the state's 9 federally designated community action agencies with a mission to abolish poverty in our catchment area. We administer 30 programs to over 40 towns. TVCCA and our sister community action agencies statewide provide essential health and human services to some of our most vulnerable individuals and households across the state, but the ability to provide these services is continuously put in jeopardy because costs, largely driven by inflation, rise at a much more rapid rate than our funding contracts do. We know that many human services are items that could be completed by the state that are put into nonprofit hands in an effort to lower costs and provide some level of efficiency. This practice of cutting corners with nonprofit funding, however, does damage to the programs that we provide. In some of our programs, like the state-funded Little Learners Early Childhood Education Program, the failure of our state contracts to keep up with real market-driven costs has led to an inability for our agency to attract and retain staff to a point that we have had to close multiple classrooms and during a time when Southeastern Connecticut is considered to be a childcare desert. The impacts are real, and a failure to address these issues has and will continue to lead to real deficits and shortcomings in our ability to deliver vital needs. You've already heard from Ben Shaken about our 45% inflation rate since 2007, and despite the fact that our increase from the state has been much less, so I won't go into that further. But we urge approval of SB 1547, but we ask the committee to consider broadening the definition enumerated in Section 1. Currently, the definition of a nonprofit human services provider only includes examples related to people living with disabilities and behavioral health services. We ask that the committee include examples such as services for a person living at or near the poverty line to ensure that nonprofit human services providers understood to mean nonprofits that provide services to these individuals. Changing proverbial hats, I'm also here today as a private citizen to provide general comments on SB 1551, an act concerning the Department of Economic and Community Development spending on arts and humanities activities on behalf of the Niantic Bay Playhouse. The Niantic Bay Playhouse is a nonprofit 186-seat theater in the heart of Niantic, producing 6 feature-length stage productions each year. Playhouse currently receives no financial support from the state, as 19 of its peers do. The Niantic Bay Playhouse was born out of a facility formerly home to the Niantic Cinema, a movie theater that very well could have become a detractor and an eyesore in the center of town had nothing gone into it. Playhouse has forged partnerships with local schools, other small theaters, and local businesses to get a stage constructed and make sure that everything's operational, but it takes a lot more than that in order to keep something new going. With 58 unique performances each year, 10,788 individuals have the chance to see a show at the Playhouse on an annual basis. We know from DECD's study in 2017 that an average of $27.70 is added to the local economy on each non-admission event-related goods and services per performance attendee. This is a huge contributor to the Niantic local economy. In summary, we're humbly requesting that the Playhouse be included in this allocation process and that the Appropriations Committee allocate $25,000 per year over the next biennial budget. And I'll now turn it over for any questions that the committee may have, and I apologize, I went a couple seconds over.
No, we appreciate the work you do, Josh. Are there any comments or questions? I think you're all set. Thank
you.
you. Up next is Carrie Dyer. Carrie, I always invoke your predecessor. I've decided not to do that this year other than say predecessor, but not by name.
Well,
Seeing as you've been there like a decade or more now. The floor is yours.
thank you. I'll reference that too. So my name is Carrie Dyer. I'm the CEO at Reliance Health in Norwich. We serve all of Eastern Connecticut. We contract with both the Departments of Mental Health and Addiction Services and the Department of Developmental Services. We serve about 1,000 people a year. We have 18 physical spaces, and we have testified on funding for nonprofit services for what feels like eons. And Kathy's right. My predecessor would talk about us creating the working poor, and that has not changed. So in some ways, I appreciate that you brought that up because it hasn't changed and we're still here. So I was going to mention the Medicaid rates, but for us, they are no longer valid because we closed our clinic. We couldn't serve people anymore with those rates, so we closed. You will start to see that happening where people are going to have to make tough decisions. We've done that, and it's horrible. We hate to do it. We had to do it. The focus I have today, though, is on SB 1547, an act concerning funding for nonprofits. I will echo everything that Ben Shaken said. He is absolutely right that this is something that has needed to happen for a long time. I agree that I don't think it should be based on union contracts. I think there are way too many nuances that go into that. We're talking about the impacts of inflation. So this should be tied to inflation. And my hope is that this is part of a longer plan, because I know we've been talking for many years about all of the needs we have. We could talk about gas and food and all the things that we know that we have as expenses. If this is part of a larger plan, if addressing our wages this year is something that we can do, we'll appreciate that, but we'll be back next year and we're going to ask you to add to that plan because we have other expenses. We have roofs that are leaking. And if we put a bucket under that leak, it's just going to exponentially get worse. And that's everything that we're doing. We've been doing that since 2007. It's more than half of my 30-year career. We're here begging every single year to try to get some sort of compelling story in front of a group to say that we need this to happen. If you come and you meet the people we serve, you'll know that they're worth it. They should not be living under leaky roofs. We should not be coming and bringing them and parading them in front of you and asking for more. This is a long standing issue. Sorry, I'm just so upset. I did not sleep last night. I can't get my thoughts straight because it's been a long journey and it's incredibly frustrating to have to continue to beg. Our staff are impacted. That's the relationships that they have with the people we serve are impacted. If you went to the doctor and every time you went, you had to meet someone new and explain your story again, you'd stop going. I have members calling me, clientele calling me saying, I'm not coming back. I don't even know who my service coordinator is. What kind of service is that? It's despicable. We have people who live in homes who are lashing out. They're punching holes in walls. They're hitting our staff. They're verbally abusing our staff. That has an impact. That goes to the question that we have of it's not just a financial implication. If we have to hire, we have to repost for positions, that's expensive. We have to retrain, we have to reacclimate people. And when they come in and they see the impact of the work that they have to do, they leave. It's not worth the $18 and change to do this work. So I please beg you, please make this difference. If this is one step, we appreciate the one step. Thank you.
So Carrie, you never have to apologize to us for emotions. Representative Ackert.
Thank you. And thank you for your passion. You know, we've been on, most of us have been out and visited homes and stuff and know the impact and the passion that the parents have for their child too. And I appreciate you bringing that passion. You mentioned a dollar amount. What is the disparity between a nonprofit and the state pay for equal jobs?
Equal jobs, I would say it's somewhere, we're paying $18 and change, and I would say it's about $25 if you leave and go to the state, and that happens frequently.
Yeah, and that's the number that I've heard also. So thank you again for your time. Thank you, Madam Chair.
Thank you, Representative DiCaprio.
Thank you, Madam Chair. Carrie, nice seeing you here
Nice to
today,
see you
and
too.
thank you for sharing today. And we will definitely take what you have to say in account.
Thank
Thank you.
you.
Thank
I
you, Madam Chair.
appreciate the time you've spent with us as well.
Are there any other comments or questions? Carrie, I would also say that in fairness, there's not very many state positions that are in your job class anymore. More for you because of mental health,
Correct.
but less in some of the other nonprofits like DDS. DDS is almost all nonprofit now.
That's correct.
And in many cases, the mental health was not switched over, although we decided that people could leave our state hospitals.
Mhm.
And that's who you have
Mhm.
mostly.
Mhm.
You know, we closed them. We closed our training schools for DDS people. We have closed a lot of facilities now and expected change to happen. Have you seen any change other than further burden being put on nonprofits as a result of the facilities that we have closed?
Yes, limited resources. So just yesterday, we had someone who suicidal. No beds at brief care, no beds at the hospital. They weren't willing to take her back, so we brought her back to our house. Terrified that she is going to fulfill her plan. So limited resources, limited supports. We, rely heavily on emergency services, police departments, and quite frankly, they're getting tired of getting phone calls. And that breaking down of that relationship is a problem. Because our wages are not what you would expect them to be, we can't always fill our second and third shifts at these houses that are taking place at the hospital. So the burden then becomes over time. We have staff who worked 2 jobs. If, God forbid, that person falls asleep on their shift, we have to investigate. We have to report if it's a DDS home, we have to report it to DDS. They potentially become part of the abuse and neglect list, and now they lose both their jobs if they're working in human services. That's happened. Yes.
Thank you for that. And I think many of us care about what's going on here.
Mm.
I'm hoping that we can make at least incremental change. And we have, up next is Representative Belinsky for you.
Thank you very much, Madam Chair. Carrie, thank you so much for your testimony. This is an issue about which I cry. And I have conversations and have had conversations with your colleagues and with Ben. And Megan's testimony was also just absolutely mind-blowing because to know that our nonprofits are so productive with the dollars that we budget, yet we budget so poorly to support them. I just wanted to share with you a conversation that I had with some adults yesterday about what we're facing in the state of Connecticut. We have this youth mental health crisis that's going on. And as the representative of Newtown and Sandy Hook, mental health is something that needs to be far more respected as far as the vitality and the survival of our communities. Megan pointed out that the service standard for her industry or for her nonprofit is 800 patients, and the comparable state agency is serving 200. And then on top of it, because of the competence of the way our nonprofits typically handle these problems before they become emergencies, like Carrie is describing, Megan's, in an organization that's serving 1,600. So that's 8 times the productivity that we have from our state agencies. The 800-pound gorilla in the room is pretty simple here. Connecticut is struggling. We came out of COVID, mental health crises across all facets of our society, but especially in our children. are going completely unaddressed or not being treated with any urgency by our state agencies. If we lose any more of our nonprofits, where the hell does that leave us as a society? Where does it leave us as human beings? So I have been talking to Ben and anybody who will listen for for years about tying us to to inflation, because coming back here year after year after year and begging for the ability to serve the citizens of the state of Connecticut, and keep us moving forward productively as human beings, that rests in the hands of these nonprofits. So to Ben, to Megan, to Carrie, to Candace Bohr, who runs Newtown Youth and Family Services, to all of you, God bless you. Thank you so much for what you do. And I am sad and sorry for the fact that we just refuse to come to the table and have enough wherewithal to figure this
Representative
out.
Belinsky, do you have any other questions? I'm sorry.
No, I'm sorry, Senator. Thank you for cutting my time off. I was quite.
I apologize. I so apologize, but I've done it with Representative Dathan, so I feel like I have to do it with you too. I'm sorry.
No. You don't have to apologize at all. I understand you.
I know you really care about this, so I don't mean to be. Thank you, sir.
Thank you, Senator. Thank you to our nonprofit partners and to my colleagues. We need to work this out. Thank you.
Thank you. Seeing no other questions, you're all set, Carrie. Thank you. Up next is Betsy Gara. Betsy, are you here?
Yeah.
There she is. Go ahead, Betsy.
My name is Betsy Gara. I'm the Executive Director of the Connecticut Council of Small Towns. We represent 115 smaller communities throughout the state, and I'm here today to testify in opposition to the penalty provision in House Bill 6865, implementing the governor's recommendations for general government. We honestly feel that this municipal spending cap is a problem in and of itself. As I know Senator Austin knows and others know, towns work really hard to control the growth of their local budgets and to minimize the need for additional property taxes. And although there are some exceptions under the municipal spending cap, we're very concerned that the penalty provision will just impose a harsh reality on towns whose spending increases for reasons beyond their control. So for example, in a regional school district, you have schools that their share of the cost of the education is based on the average daily membership. That can go up and down and change the amount that the town in the regional school district has to pay. So we do have one town that was actually penalized last year because they exceeded the 2.5% growth in their local budget. And they were like, there was no place else for them to cut. It's also important to note that these budgets are approved at either town meeting or referendum, and so they reflect the will of the voters and the people that understand that maybe they need to make some increases in the budget. As a result, we also have one town that is going to be no longer going to be an alliance district next year, and their education budget is expected to increase by 5% to meet the needs of their students. And I know this committee is very focused on looking at the education and special education funding. It's a real problem. So we oppose the penalty provision, and we hope that this is deleted from House Bill 6865. Thank you.
Thank you, and thank you for your testimony. Are there any questions or comments? I just want to ask you, could you just very quickly explain the municipal spending cap that you referenced in your testimony?
Sure. The municipal spending cap, I don't actually recall when it was put in place, but if a local budget increases by more than 2.5%, there's currently a penalty provision so that the municipal revenue sharing account would be grant under the program would be reduced. This increases that and imposes a 10% penalty for towns that exceed the 2.5% increase. And again, we do believe that it's a problem.
Thank you. I don't think everybody's familiar with it because I saw some people sort of looking when you said that. So I wanted to make sure that everybody understood it. So thank you very much. Thank you for your testimony. Have a good day.
Thank you, Representative.
Yep. Next is Michael Van Leer. I'm not going to try the last name. You can tell me what your last name is.
That's fantastic. Better than most.
Good afternoon, or good morning still.
Bill. Members of the Appropriations Committee, my name is Michael Van Landeren. I am the Chief Operating Officer of Reliance Health, which provides mental health and developmental disability services in Eastern Connecticut. I have the pleasure of working for Carrie Dyer, who you just heard from and who laid out the situation brilliantly, as did Ben Shaken from the Alliance earlier. And I'm here to speak on SB 1547, an act concerning funding for nonprofits. And I would say two things to echo what Ben said, which is using a different inflationary index other than the state wages, because it gets into, every year it's, they have step raises and health benefits and such, and it would be easy to get lost in the weeds of what actually that meant for nonprofits down the road. And also to target not just wages, but the overall contracts. If I have not enough time to say everything, I want to at least say this. Some of you may remember, some of you may have never known this, but in 2015, August of 2015, then Governor Malloy announced that the state of Connecticut was the first state in the country to end chronic veteran homelessness. In the following year, in 2016, the United States Interagency Council on Homelessness declared that Connecticut ended all veteran homelessness. Now, the nuance of that is that there are still homeless veterans on the street, but we had the capacity within a 30-day period to do outreach to any veteran on the street and attach to them a housing voucher and proper support services. Neither one of those things are the case today. Homelessness is a complicated issue, but I can tell you the person providing the intervention is the most important part of the intervention. And nonprofits struggle with turnover, as you've heard, and as you actually pointed out up there from where you sit. It's hard to do this work, anything, with staff churn. Imagine if you brought your child or your aging parent to the doctor on a regular basis and you saw a different doctor every time and had to explain your story time and time again. Imagine if you had to defer all of your home maintenance repairs, peeling paint, leaking ceilings, cracked sidewalks, because you didn't have the financial resources to repair anything. And I know that's my time. Year after year, nonprofits are doing the same work with fewer dollars. This indexing bill is the lifeline that we need. You know that, and I know for the most part, I'm speaking to the choir. So I'm happy to answer any questions.
Thank you. Are there any questions? Yes, Representative.
Thank you, Madam Chair, and thank you for your testimony. When you look at the compensation of nonprofits, there's a salary which is addressed in this bill. Is it the case that in the other elements of comp, such as health, let's take health insurance benefits first, that each nonprofit, whether they're of a large scale or small scale, provides health insurance benefits to their full-time employees?
So I can really only speak to our agency, but I can tell you we provide health insurance to our employees. It's the second biggest line item we have after wages. It goes up exponentially every year, and sometimes we're the size of our agency means we're sort of rated on our own particular use. We're not in like a broader risk pool. We have year after year had to jump providers because the rate that we got from last year's provider either was 40–50% increase, or they just flat out refused to give us a quote. We are fortunate that we've been able to piece this Rube Goldberg machine together. We've done the best we could as an agency not to pass all of those costs on to our staff because their wages aren't going up. So nonprofits make decisions like deferring fixes on our residential buildings, except for things that are really safety concerns. So yeah, health insurance is a big issue for us.
Through you, Madam Chair, a follow-up. And then with respect to retirement plans, I'm trying to get an apples to apples comparison of the elements of compensation for a nonprofit employee relative to a state employee, and how much each one of those individuals costs the state, because all three of these elements are a cost.
Yep.
So what in general, if you could speak to it, is the retirement plan for a nonprofit employee?
Yep. That's a great question. And thank you for pointing out that there are broader issues and nuances to this thing, because it's not just, we're paying $18 and the state is paying $25. We have no pension. We have a 401k plan, which means the staff person is paying into it. And guess what? If you're making $18 an hour, the age of 65 and what you're going to have then doesn't even work into your calculation. We have found that we try to auto enroll people when they first start, so at least they see they see it, and hopefully they stay in it. Most don't, but our turnover rate has essentially doubled. So people are just kind of leaving anyway. It's hard to, when I started 33 years ago, this was a job, you could come in as a direct care worker and build a career, right? I'm not sure that's how people think of it anymore. I think people come in and they fall in love with the work, or they realize they can make more at Home Depot. Yeah, whatever, we highly encourage folks to plan for the future, but again, it's 401k. We do provide some match, but it's mostly on the backs of the staff.
Thank you.
Thank you. Representative.
I think that's me, Cavros DeGraw. You gave me the look.
Okay, I was like, sorry, Representative Panos.
Getting back to what you said about homelessness, it's wonderful that you are providing some kinds of benefits, but we're hearing from many providers, and maybe you're seeing this as well, that a lot of the people who are providing care for the homeless are nearly homeless themselves and or on Husky or SNAP or both. So I'm wondering if you could just speak to that a little bit.
It's absolutely true that our direct care staff are eligible for state benefits in terms of insurance. And it's absolutely true that I am embarrassed to say this on record. We have had direct care staff living out of their car while they were working for us. We absolutely have young staff living in their parents' basement. And that, as an administrator of an organization, as a leader of an agency, that is considered for 13 of the last 14 years, and that's not an accurate number, but it's pretty close. We have been a top workplace in Connecticut. And this is what our staff are going through. So, yeah.
I appreciate that. Thank you, Madam Chair.
Thank you, Representative. I remember when I first started as a legislator back in 2000. And I remember the beginning push to move state jobs to nonprofit. This was a design. And the thing that's most sad is that it's created a war between two people that should not be warring.
That's right.
And I'm sitting here, it's killing me because I'm hearing, Well, the state employees get this, but that was by design. They're they're not the enemy.
That's right.
And I want us to be very conscious of that because we are so much in the vein of always trying to create an enemy for us to try and step on. And I they're trying to do the job and they're struggling too. So, but they get paid more because they're still under a union contract with the state, which we should have never allowed the state to move things to the nonprofit world only without keeping everything side by side. It was done deliberately to save money supposedly and cut the number of people that were going to be receiving funding from the state. So I want to make sure that we do everything in parallel. I think that's the only thing we should be doing. We should make sure that as we increase, we should increase for nonprofits too. It should be done for everybody along board. But I also don't want us to villainize people that did not have anything to do with it. It was done by other people. So I thank you for your comments and everything. And it's not just you. I mean, this is such a caustic era right now that we're so quick to blame somebody for something. And I remember saying out loud on the floor, doing this is going to have a very bad long-term effect. But of course, I was a freshman, so they didn't really care what I said, but
And I hope my testimony didn't come across as
No.
But that's the only comparison we have.
But I hear the questions are going in that direction.
Yeah, they are.
And so I just wanted to make that statement.
That's also information for us, though.
It's not your fault. Thank you. Thank you very much. Thank you for your
I
testimony.
just want to say really quickly, I've been doing this for a long time and coming here for a long time. It's easy to be jaded about the process.
Mhm.
The first hour of today has given me such hope and lifted my spirits, and that this is something we can do, and I'm grateful to all of you. So thank you.
I think also we've had so many public hearings and we've heard from so many people that we've wanted to jump out and say something, but then when you have 300 and 400 people in line and you want to go home so you can come back tomorrow, it's sometimes we have to cut those questions down to them. But we hear you, and we all are talking about everything that everybody testifies to in front of us. But sometimes, and I just want to remind my colleagues up here that we have 106 people that have to be. So who's going to be here tonight when the lights go down, because it's not the people that are asking the questions, I guarantee you, it's other people. So thank you, sir. Thank you for your testimony.
Thank you all.
Next is Rafael Feliciano Roman. Is he on remote?
Yes,
Oh,
I'm here.
Good. Good afternoon. Good morning. I just want it to be afternoons. I'm sorry.
Close.
Good morning, sir. Go
Close.
right ahead.
Taytay Due, Tairi Diri, Rafael Feliciano Roman, Borinquen Taino Curada Calaton, Cauria, Cayo Kaya, Calada Caia. I just basically said in Guajia Taino tongue, good morning, honorable members of this committee. I am Rafael Feliciano Roman. I'm of Taino Borinquen lineage in the city of Waterbury. My tribe is the Taino Learning Community, and I'm full of joy to be here today. Thank you all for hearing me. I last night was able to attend on behalf of DECD and Connecticut Office of the Arts. I'm one of the newly minted arts heroes for the Greater Waterbury region. I'm here today to express my strong support for SB 1551, which seeks to provide more reliable funding for the humanities, arts, tourism sector by allocating a percentage of our existing meal tax to these vital cultural institutions, including urging this committee to please invest more in statewide arts and continue with culture, art, and tourism infrastructure funding, specifically $5 million to Connecticut Humanities, $5 million to Connecticut Office of the Arts, and $12 million to the Connecticut Office of Tourism. The Afro-Caribbean Cultural Center envisions a world where Afro-Caribbean, Black, and Taino cultures thrive here in the state of Connecticut, bridging generations, preserving and respecting traditions, and empowering our communities to be a cornerstone for social and cultural revitalization and restoration through creativity, education, equity, and healing. This vision is realized throughout our programs and performances and community events that we have featured throughout the state of Connecticut in partnership with our amazing partners like Mattituck Museum, Connecticut Museum of History, the Bushnell Performing Complex, Seven Angels Theater, Silas Bronson Library. And in the last 4 years, we have brought over 25,000 visitors from across the Northeast, including New Jersey, New York, Massachusetts, Rhode Island, and including some folks from Puerto Rico. This influx of visitors has made significant benefits to local businesses and restaurants and hotels in Greater Waterbury and throughout the state, creating a ripple effect that strengthens our regional economy. From the jumping launch pad of funding from Connecticut Humanities and Connecticut Office of the Arts, our organization was only one of 4 organizations throughout the entire state of Connecticut to receive federal National Endowment of the Arts funding in the Arts Here sector of over $130,000. From a funding launch pad from these amazing statewide institutions to propelling us to national dominance, the economic reverberations of state investments in humanities and tourism cannot be overstated, including my friend Terry at the Greater Waterbury Chamber, who does our regional tourism stuff. Palante Theater and the Afro-Caribbean Cultural Center employ local artists and stage crews and service providers who rely on this funding. More reliable funding through a percentage of the meals tax would ensure continued economic benefits, allowing organizations to plan long-term, hire more talent, and expand programming. I end with saying Connecticut has the opportunity to recognize the arts, humanities, and tourism as a key economic driver. Senate Bill 1551 is an investment in small business, local jobs, and community development. I urge you all to support this measure. I thank you all for your time, and I welcome any questions, comments, and Jajom is Guajira Taino for thank you, and we continue to be here in service. Thank you.
Thank you, and thank you for your testimony. Are there any questions? Thank you, sir. Have a good afternoon. Next is Michelle McCabe.
Good morning, Representative Walker and distinguished members of the Appropriations Committee. My name is Michelle McCabe, and I come to you wearing 2 hats, both equally invested in and reliant upon a strong arts, culture, and tourism sector. I'm the Executive Director of Connecticut Main Street Center, a statewide nonprofit that is focused on creating and maintaining downtown vibrancy. I'm also the President of the Board of the Connecticut Arts Alliance, which is another statewide nonprofit that uniquely gives voice to the entire arts ecosystem, from organizations to individual artists and all corners of the creative economy. I'm here today to testify in support of SB 1551 and increased funding to strengthen arts, culture, and tourism, because when these critically important sectors thrive, our state's quality of life, small business economy, and main streets and downtowns across the state also thrive. As the state's leading downtown resource for 25 years, Connecticut Main Street assists main streets and downtowns in executing a proven 4-point approach to revitalization and sustained vitality across rural, suburban, and urban municipalities. Without question, a robust arts, culture, and tourism ecosystem contributes broadly to the economic health of Connecticut, and specifically to that of our downtowns. Our Main Street experience entices residents and tourists alike to live, work, and play in Connecticut. Our unique communities are assets to bring in and retain our workforce, recruit new companies, and grow existing ones, and to encourage visitors to contribute to our economy. We know that arts, culture, and tourism are a critical component to a great Main Street. Our main streets and downtowns are currently grappling with 2 conflicting new realities. On the one hand, we have a wide diversity of people, from young workers to empty nesters that want to live in walkable communities. On the other, traditional workplaces and shopping habits have shifted dramatically with the pandemic, and all types of businesses now are trying to adjust to these changes in consumer behavior. We rely heavily on the arts culture sector to bring foot traffic with a wide array of activities and the special vibe that creative community adds. Many of our arts and culture organizations are situated on a main street and in a downtown, and they serve as anchor institutions for the community. Our theater performances, public art projects, outdoor concert series, historical walking tours, library programming, and many other assets and activities bring life and economic activity to Main Street. They build community on the main streets that are everybody's neighborhood, create jobs, bring people to restaurants and retails, and help us to reimagine the new downtown environment as workplace and shopping habits change. Tourism shares Connecticut Main Street experience with the broader world, bringing attention to all communities, large and small. With increased funding to arts, culture, and tourism, we'll see more inventive collaborations across the state. And I want to make a specific point as my time is running out that the Office of the Arts and Connecticut Humanities through the Cultural Fund is ideally positioned to ensure that the entire sector receives support, which in turn means that all of our municipalities, especially those that benefit from a strong creative economy, will not be left out. In fiscal year 23, they served 159 of our towns, 735 organizations, which is unprecedented in terms of scope. And I know that our main streets and downtowns benefited tremendously from this investment. And I hope you will consider continued investment in this absolutely critical sector for our state. Thank you.
Thank you for your testimony. And you've in some of the small towns, you've really done a great job. I mean, in the towns, but it's nice to see downtowns, and especially for people, for walkable neighborhoods. Those are great.
Thank you very
Any
much,
comments or
Representative Walker.
questions? No? Thank you.
Thank you
Have
so
a good
much.
day. Next, Frank Mitchell online.
Yep. Good morning, Representative Walker and distinguished committee members. Thanks for this opportunity to speak in support of SB 1551 concerning DECD spending on arts and humanities activities. I'm Frank Mitchell. I'm a New Haven-based CT Humanities Board member and a Legacy New Haven Convention and Visitors Bureau Board alum. That board service history means that I truly appreciate the arts, culture, hospitality, and dining synergy represented by SB 1551. My association with the Greater New Haven CVB began with a tourism guide focused on historic Black New Haven and evolved into board service on an entity with a regional charge. I joined people from other New Haven neighborhoods and from as far as Durham in negotiations to recognize the balance between arts, culture, and history content in the city of New Haven and hotels, B&Bs, and restaurants on the shoreline or in Durham. It wasn't always easy, but we did find ways to emphasize the city's cultural assets, the shoreline's environmental treasures, and all the shopping, dining, and hospitality opportunities along the way. This bill recognizes that history and all the efforts of the current Arts, Culture, Tourism Coalition and the potential benefits of that ecosystem as we approach this country's 250th. My friends from the CVB could have imagined that the year-long exhibition shining a light on various Yale truths would draw families, extended families, conference attendees, and alumni tourists who'd park or leave the train station and then enjoy a meal after the exhibition, and in some cases, spend the weekend to catch up with friends who now live in this area. They could imagine the similar impact of a smaller exhibition at my own Dixwell Q House's Tony Ann and Wendell C. Harp Historical Museum. They'd appreciate the ways this ecosystem fed and fortified those organisms. But what they couldn't have imagined is the threat, the recent threat of DOJ's attack on the NEH and what that poses to this synergy. Possible grant termination threats would cut salaries of CTH staff, in addition to all the other Connecticut residents whose jobs have been eliminated recently. None of us could have imagined the urgent need for this bill. So I'm incredibly grateful for the consideration and the support. I'm going to just say thanks again for the opportunity. And I can obviously answer any questions or try to, and there'll be folks coming up behind me who will be even better prepared to answer questions too.
Thank you, sir, and thank you for your testimony. Thank you. Any questions? Thank you. Have a good morning. Next is Frank Stillwanger.
He'll be joining us later.
Okay. Next is Brian Mezek.
Good morning, Representative Walker and members of the committee. My name is Brian Mezek. I'm here on a very specific, very limited issue, and I promise to be brief this morning. I'm president of the State Marshals Association. We represent the marshals across the state. So Generally in the state of Connecticut, we serve all the legal process, any legal writ. So I'm here to provide testimony on the governor's recommendation 6865, specifically as to Section 18. Now this concerns issuing writs of special election in very limited circumstances, like when there is a tie in a probate court election, or there's a vacancy in the office of a probate judge. In that instance, the governor would issue a writ of election, the marshals serve it on the town. That's what calls the special election. Section 18 would envision, I guess, the governor's office serving their own process in this instance. So we would just ask that this section be removed. This has popped up a couple times over the years. These are very limited, rare situations. This probably happens a handful of times every couple of years. So state marshals provide due process. We're the different people. We serve all the legal process. So we would never set up or ask the state to set up a system where someone served their own legal papers, like in an eviction, a divorce. So in this legal writ, we want the marshals to continue to serve it. And that's my testimony. If you have any questions, I'm happy to answer questions.
Thank you. Thank you for your testimony. Yeah, you have been up here a lot. Any questions? So thank you. Thank you. What section was it?
This is Section 18 of 6865.
Section 18? Okay,
Yes.
great. Have a
Okay,
good
thank you.
day. Thank you. Next is Thomas Farquhar.
Hi, good morning. Representative Walker, Senator Austin, Senator Summers, Representative Nuccio, and members of the committee. My name is Thomas Farquhar. I am a resident of West Hartford, and I'm a radiologist practicing in Connecticut. And I'm speaking today on behalf of the Radiological Society of Connecticut to comment on House Bill 7254, an act concerning the Department of Social Services implementation of changes resulting from the Medicaid rate study. So as many of you have probably heard, the issue of Medicaid rates has been discussed in this session in a number of venues, including the Human Services Committee, which has a bill that will phase in an increase in Medicaid reimbursement over 3 years, up to 75% of the Medicare rate. And then these payments would be indexed annually to keep up with increases in healthcare costs. The Radiology Society of Connecticut strongly supports House Bill 7254 as well as House Bill 7191. We think that Medicaid reimbursement increases are long overdue for radiology and other providers. It was back in 2015 that DSS made drastic payment reductions to the provider component of Medicaid for imaging examinations. And we saw pretty immediate effects from this. One of the 2 private practices in the city of Hartford closed shortly after that due to the pressure of this decreased reimbursement. And that really underscores that radiology practices are small businesses. They employ hundreds of employees with good paying jobs in communities across the state. And we want to keep these viable as appropriate venues of care outside of just the acute care hospitals that we have across the state. So House Bill 7254 would mandate DSS to review the rates and then rebase them at least once every 5 years, which we think is a reasonable and fair requirement. I think the last time the rates were adjusted were 15 years or so ago, so it's long overdue. Thank you again for your time and for listening. We appreciate it.
Thank you, sir. Are there any questions? Thank you. Have a good morning.
Thank you. Take care.
Brian Lynch. Brian.
Good morning.
Good morning.
How are you today? Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and members of the committee, I'm Dr. Brian Lynch. I'm an optometrist who practices in Brantford, Connecticut for the last 4 decades. I am currently serving as legislative chairman for the Connecticut Optometric Association. Last fall, I had asked our association to survey our members to find out how many of our members participated in the Medicaid program. And we found an astonishing 90% or 89% of our members participated in Medicaid and were currently accepting new patients into their office. 89% stated that they would continue providing care to the Medicaid population, especially if the rates were readjusted. Those 11% who did not responded negatively to our survey had shared that they would consider joining Medicaid again if the rates were readjusted. In other words, 9 out of 10 optometric doctors are doing the right thing currently. With better reimbursements, even more will join the program. More optometric doctors will mean that more Medicaid patients are seen for their vision and eye medical needs. More appointments will obviously open up. To further highlight optometry's importance to the Medicaid program and our commitment to caring for those patients, for fiscal year 2024, optometrists provided nearly 120,000 non-duplicated visits, according to HHS data, accounting for approximately 70% of all of the primary eye care that was provided to the Medicaid population. We support House Bill 7254. It provides for an adjusting of the reimbursement codes every 5 years to keep them up to date. Still, though, an inequity exists within the current system, and we would like you to please address that. Due to an outdated Department of Social Services regulation, we are reimbursed only 90% of what an ophthalmologist is. There are medical practices in the state where optometry and ophthalmology work collectively under the same roof, and yet optometrists are paid 10% less than ophthalmologists when providing the same procedures and diagnosing the same conditions and checking the same codes. This is one of the reasons why so many of our members, the 11%, are not participating. And again, they would re-engage if indeed that inequity was addressed. We request, as this bill goes forward, and we hope it does, that you will address this 10% disparity and keep optometry practices in mind with respect to any reimbursement changes going forward. Thank you again, and thank you for your time today. And we hope this bill does move forward.
Thank you, Dr. Lynch. Thank you for your testimony. Are there any questions or comments? Thank you, and have a good morning.
Yes, have a good day. Thank you very much for your time. It'll be a long day for you.
Going closer.
Yeah.
Next, we have Leilani Jimenez. Yes. Oh, well, come on down. Step on down. Here? Sure. Make sure that when you start to do your testimony that you give your name. Okay. And you have 3 minutes. Yep. And you'll hear a very loud ding dong ding. Yeah.
You know what, though? I really think that they just copied the sound from Back to the Future.
You hear those? Okay, you can sit. You can sit. You can sit and read if you like.
Okay.
Okay. And welcome. It's go right ahead. Okay.
Good morning. My name is Leilani Jimenez, and I am here to strongly support House Bills 7252, 7563, and 7254. These bills are crucial to protecting our youth, ensuring fair access to education, and strengthening social services for those who need it most. HB 7252, which addresses juvenile justice, is a step in the right direction. We know that rehabilitation, not punishment, is the key to breaking cycles of incarceration. Young people deserve access to mental health care, substance use treatment, and educational support. Investing in these programs now will mean fewer people in our prison systems later. It's not just the ethical choice, it's the smart one. HB 7563, which focuses on special education, ensures that students with disabilities receive the support they need while balancing resource allocation. We must ensure that children are not left behind simply because of financial concerns. Fair and appropriate education is a right and not a privilege. HB 7254 strengthens the Department of Social Services, which is the backbone of support for so many families in Connecticut. From healthcare to financial assistance, DSS provides essential resources to those struggling to make ends meet. Strengthening this system is a direct investment in the well-being of our communities. These bills are about fairness, justice, and the future of Connecticut, but they are also about standing against the growing forces that seek to dismantle our social safety nets. We are watching as powerful figures like Trump, J.D. Vance, or Elon Musk push policies that strip away public service and consolidate powers in the hands of the wealthy. If we don't fight back now, we risk a system where only privileged few thrive, while the rest are left to struggle. I urge you to support these bills. The time to act is now before we lose the protections that make our community stronger, more just, and more equitable. Thank you.
Wait, that's it. Since it's your virgin opportunity to talk to us and everything you're just starting, we want to make sure that you have a moment to either respond or at least hear from different people. First of all, thank you for your testimony. You represented 3 different bills in a shorter period of time than anybody else up here. And you got your point across, so maybe you can help them get to the point too when they want to do their testimonies. But you did a fantastic job, so thank you
you.
very much for that. And all of the things that you have testified for and support are really important for the state of Connecticut, for every community. So thank you.
Thank
Okay.
you.
Are there any questions or comments? You did a great job, okay?
Thank you. Have a
And
great
don't
day.
forget to watch yourself next time, because you can, it'll be aired and you can watch it.
Oh, okay.
Okay? And remember, you're at 11:30, so it'll be an hour and a half into it, so you don't have to watch the whole thing, okay?
Okay. Thank you.
Thank you. You too. Have a good day. Next is Jason Mancini.
Good morning, Representative Walker and honorable members of the Appropriations Committee. I'm Jason Mancini. I'm the Executive Director of Connecticut Humanities, testifying in support of SB 1551. Thank you for raising this important bill at a critical time in both the state's and nation's history, when our social fabric is being torn apart before our eyes. This, along with HB 7176, draws attention to the critical need for cultural investment in the state through arts and humanities. Many before you today and those submitting written testimony will note the economic benefit of investment. It is real and demonstrable. And while we can offer you endless data to support this argument, and I had different testimony to offer, I'd like to focus my comments on something more urgent relating to emails I received late last night. As many of you know from the New York Times reporting, DOGE staffers visited the offices of the National Endowment for the Humanities on Monday. Subsequently, rumors began to spread about grant suspensions and terminations. At midnight last night, I received from the chair of NEH a series of letters terminating our operating support grants. These are the funds through which we serve Connecticut's cultural sector. Our grant making to museums and cultural organizations, and through our civics initiatives, literature programs, digital projects, and educational resources. This also means that direct NEH grants to Connecticut organizations will cease. Coupled with the termination of the Institute of Museum and Library Service grants and suspension of IMLS staff, this means that millions of dollars of federal funding will no longer be invested in our communities. Almost certainly funding from the National Endowment for the Arts to Connecticut Office of the Arts and arts organizations will be next. We don't know yet what the full impact will be, but it will affect our creative and knowledge economies. I hesitate to be alarmist, but I'll say it. Our rainy day is here. We stand to lose more than just funding. Cultural investment through arts and humanities in Connecticut makes our state an extraordinary place to live and work, and a place that a growing number of people want to visit. While arts and humanities may feel to some like abstractions, nice but not necessary, they are not. Through arts and humanities, we seed the ground for curiosity, knowledge, and understanding, innovation and critical thinking skills needed for confronting life's challenges and opportunities. We provide spaces and places that our residents learn about each other and the world we all share. Through arts and humanities, people express themselves, experience others, all key in social emotional learning and development and combating societal concerns such as the loneliness epidemic. All the problems, the pain and suffering we confront, the love, the joy, the connection we hope to feel are rooted in and expressed through arts and humanities. While it's tempting to ascribe a dollar amount to all of this, we should recognize arts and humanities for what they truly are, invaluable. We bring people together, connect us, and in times like these, we are the light in the darkness and the wellspring of wisdom that someday, hopefully soon, will guide us through. Thank you.
Thank you for that testimony. And arts and humanities are our soul. and we're seeing it ripped apart.
Yeah.
And I thank you, and I feel your pain very much so, because I believe that if we lose that, we lose who we are. And I thank you for your testimony. Are there any comments or questions? Representative Fabro.
Evros DeGraw, yes, thank you. Jason, it's nice to see you.
Thank you.
I know this is new information for you because a lot of this just came in last night, but I think that when we're hearing all of this coming at us constantly, we're talking so much about the numbers that we're not talking as much about the human toll that we're having with this. I don't want you to estimate, but I would imagine that this means the loss of jobs here in Connecticut. And I would say, so you don't have to speak specifically to your organization, but just in terms of how this would affect communities, you know, if you can speak to that a little bit more, that would be useful.
So it's hard to even grapple with it at this point. I mean, the total impact, I mean, it's going to affect, it will affect the operations of museums and cultural organizations across the state. You've heard testimony from folks like Rafa. I mean, he's a bright spot in all of this and really growing and thriving. But there are a lot of smaller organizations that are on a shoestring budget, and a little bit of funding goes a long way. We're an incredibly resourceful group of people. But when the funding stops, businesses close, people are let go, and services end. These are, you know, we feed an ecosystem here of knowledge, of education, of innovation, small businesses, all of it, the creative economy. You know, Connecticut has a wealth of providers and knowledge keepers and knowledge makers. I mean, these things will find a way, but the disruption is going to be unimaginable. And the impact on our communities, we just don't even know yet.
Thank you very much for that. Thank you, Madam Chair.
Thank you.
Thank you, Representative. And I mean, the idea that all the culture that we have maintained and preserved for our children is going to go up in dust. I mean, it's almost going to look like, you know, during COVID, all the theaters will be closed, museums will be closed because we don't have that.
Yeah.
But the problem is, it's not something that we can get immunized for. It's something that is here.
Yeah.
Without our choice. So we have to figure out a better way. So thank you very much for your testimony.
Thank you. Just a quick final comment. We've made so much progress in the past years and through the Cultural Fund. You know, and to be able to continue that with your support would be a solution.
Thank you.
Thank
And
you.
thank you for celebrating our diversity. Thank you. Next, Bruce Stovall.
Good morning, Representative Walker and other members of the committee. My name is Bruce Stovall, and I represent Oak Hill. Oak Hill was established in 1893 and is the largest provider of disability services in Connecticut. We provide a wide continuum of programs and services. We operate 65 group homes, an accredited special education school, several camps, an assistive technology center, as well as a number of specialized clinical programs. We employ approximately 1,700 individuals in 50 towns across the state. I'm testifying in support of SB 1547, an act that would index our rates. Again, I would put in Ben's caveats as well that the CBAC agreement indexing is a great step. What we want to index to is slightly different, so I would echo Ben's comments in that regard. What's going on at Oak Hill? We have about 900 direct care positions. Of those 900, 350 vacancies. You can imagine what that's like. Our guys are working 70, 80 hours a week. We depend on pool staffing, which costs us a premium. And again, the quality is mezza at best. We have closed approximately 20 programs in the last 10 years. Yesterday, we closed our last day program, which is 22 individuals. We just cannot make a go of it. 17 of those are Oak Hill folks. We'll take care of them internally. 5 of them live at home with their families and parents, and it breaks my heart, but they have 90 days to go find a new program or find new arrangements. Again, it's just more of the same trend. Couple fun cost facts, pre-COVID. At any given time, we have 150 vans on the road. Pre-COVID, a minivan was 28,000. It's now 48,000. A wheelchair van, which was 48,000, now runs us 80,000. Electricity, we've all opened our bills last year, and like what is happening here, times that by 65 homes. I talked to my CFO and I said, what's that add up to monthly? That's $25,000 per month, as opposed to pre-rate jump. So 300,000 a year, no offset on that. Again, I'm 36 years into this. I heard testimony. I started as a union member, as a direct care guy. I could afford a mortgage. I put a couple kids through school. I built my family. That is not the case anymore. You're coming in, you're making $17, $25, $18 an hour. It's one of maybe 2 or 3 jobs. And again, in my 36 years, I have not seen the situation as dire. So again, I would commend you for the bill, Senator Austin in particular, having some indexing. At least it stops the gap from widening. I think Ben testified we're still 30% behind, but at least it stops the bleeding a little bit. So again, thank you for your efforts. I think you have a great opportunity to really shore up the nonprofit system. Thank you.
Thank you. Thank you for what your organization does. It's phenomenal that what you have been able to do with what little we offer you. But thank you for all the works that you've done.
Thank you.
Now you, but thank you and have a good day.
Okay,
Thank you.
appreciate it.
Oh, I'm sorry. Sorry. Wait, just a
Thank you, Madam Chair. Just,
Mm-hmm.
can you just go over the statistic again about the physician count? You're down 300?
350 out of a base of 900.
And are these full-time? These are full-time positions?
These are typically full-time jobs, a mix of some part-time, but typically full-time. And again, we simply cannot attract and we cannot retain folks. Again, you've heard the testimony. Why don't I go to Target and make $22 an hour as opposed to bathing, distributing medication, dealing with G-tubes, dealing with complex behavioral issues? It is a calling, but we've got to make people, reasonably whole. I think Senator Gilchrist last year said, we are subsidizing the working poor. And I hate to say it, but it's pretty accurate. So again, thank you very much.
I'll tell Representative Gilchrist you gave her a promotion. She may not think it's a promotion, but I'll let her know. Okay. Thank you.
There's actually a group home 2 doors down from where we live in Lebanon, and
you were nice enough to come over.
I was talking to some of the staff, and they're very passionate about the work they do, and I appreciate the work you do and your.
I appreciate your visit out there. I remember it.
Okay. Thank you, Madam Chair.
Thank you. Yes, Representative.
Thank you, Madam Chair, and thank you for your testimony. Maybe you don't have this information with respect to nonprofits generally. And the enemy here is lack of mental health care, homelessness, hunger, et cetera, not any particular category of people. But the question I have is, if we look at the nonprofits generally in Connecticut, do you have a sense of what % of their funding comes from state dollars versus private donors versus federal dollars?
I can speak for Oak Hill, obviously. Where federal and state dollars are about 93% of our funding stream.
Okay.
We have some side contracts and some for fee services, but generally it's our primary department is DDS, but we also have contracts with DCF and DEMIS as well. But so I would say well over 90%.
Okay, thank you.
Sure.
Thanks. Any other questions? Thank you, and thank you. Have a good day. Thank you. Next, we have Mark Schaefer.
Good morning.
Good morning, Representative Walker, Senator Austin, Representative Nucci, Senator Summers, and members of the committee. My name is Mark Schaefer, Vice President, System Innovation and Financing at the Connecticut Hospital Association. I appreciate the opportunity to testify concerning House Bill 7254, an act concerning the Department of Social Services implementation of changes resulting from the Medicaid rate study. CHA supports the intent of this bill, which is to address the significant Medicaid underfunding across the healthcare continuum, such as you just heard, for example, about Oak Hill. As we've previously testified, Connecticut substantially underinvests in Medicaid relative to other northeastern states. We would spend $2.5 billion more a year on Medicaid if our spend was in line with these other states. This is consistent with the marked underpayment found in the recent DSS reimbursement studies. However, we think it's important to note that the Phase 2 study released in January failed to document the substantial hospital underpayment that exists today in Medicaid. Connecticut hospitals are reimbursed less than 60 cents on the dollar for the services provided to Medicaid beneficiaries after accounting for the taxes they pay to fund the state share of Medicaid services. The hospital operating shortfall has grown sharply in recent years, reaching $1.4 billion statewide in FY 2023. According to a recent Office of Health Strategy report, the Medicaid hospital shortfall in Connecticut is 79% higher than the national average. It is critically important to address this issue. We strongly encourage the legislature to include hospital increases as part of this proposal. We believe that such increases could be enabled by a comprehensive redesign of the Medicaid program, one that could include better use of Connecticut's hospital tax program to advance the important public policy goals that the legislature set forth in Section 17 Public Act 23-171. These goals include addressing social, economic, and environmental drivers of health, improving the long-term health and well-being of individuals enrolled in Medicaid, and promoting affordability for all. There are two elements that are critical to this Medicaid redesign that I'd like to call out before closing. The first is that we believe the hospital tax, in combination with other sources of revenue, should be used to reduce or eliminate the shortfall and provide for annual updates. Second, we believe that a new payment model is needed, one that capitalizes on the role that multi-sector health partnerships can play in addressing the root cause drivers of poor health. We recommend a financing and accountability framework that provides new investment funding for hospitals and their multi-sector partners to invest in place-based health initiatives. We also recommend that 100% of the resulting savings be shared for reinvestment back into the communities. We welcome the opportunity to engage further on a comprehensive solution that will support the cost of care delivery and drive better health and affordability for all. Thank you.
Thank you, Mark. Thank you for your testimony. I know we are all trying to work through the hospital plan that we have to create with the state of Connecticut, and I think it's going to take us a little while, so I hope we get to it soon. Thank you.
Thank you.
Thank you. Any questions, any comments? No. Thank you, and have
Thanks
a good
so
day.
much. You too.
Next, Karen Niag.
Good morning, Appropriation Committee.
Good morning.
I'm Karen Niag. I'm a mom. I also am a board member of Oak Hill. My daughter Stephanie, and I apologize, I wish it could be so much bigger, but my daughter Stephanie lives in a group home in Torrington on a road called Wyoming Avenue, which is typical for Oak Hill to name their group homes after the street. So these are the ladies of Wyoming. There's 6 individuals that live in this group home. I adore the house. It is absolutely beautiful. However, it's not the magic in my daughter's life. It's the staff members that come every day. According to our house manager, there's 84 slots of shifts that need to be filled every week. And she has typically 33 slots that she cannot fill. So there are actually times when I'll bring my daughter home because there's not staff members. When there's not staff members, that means the house is at risk. That means a beautiful organization like Oak Hill is at risk. Although I'm here today to support the bill that 1547, It's really very stressful for Oak Hill to be finding people that qualified to stick with the job, that are good citizens to come in and work with our kids and give them a healthy, normal wellness lifestyle. I know I've been here since 2012 and more, so I've been here many times asking for help. Today, I actually hear a little hope in your voices that maybe you're understanding. I can't spark off some of the figures and the stats and all the other stuff that goes along with getting nonprofits to run, but I'm the one here that says that these girls really need our attention, as well as all the other kids in the group homes that Oak Hill provides for. I thank you for your time. I'd love to have the other voices have more time than just me as a mom. I appreciate all you do for us. Thank you.
Thank you, and thank you for representing the parents from Oak Hill. And I think your testimony will go very far for that. So, and what you're hearing in our voices is tired.
It's gonna be a long day.
Oh, long months, long months. Thank you, and thank you for your testimony. Linda Ivana. Good morning.
Good morning. Good morning to all the members of the Appropriations Committee. My name is Linda Iavana, and I'm the CEO of CCARC, which is a nonprofit provider of day, employment, and residential services all throughout central Connecticut. We contract with DDS and DSS. We serve 170 individuals and their families and employ 270 people. Several of these are per diems and subs. Thank you for the opportunity to testify in support of SB 1547, an act concerning funding for nonprofits. Thank you for the increases the legislator has been able to provide over the last few years, but please understand that it is not enough. The greatest problem facing our organization is our inability to attract and retain employees across all programs and even throughout administration. Historically, nonprofit wages were over that of entry-level positions in retail, food service, and other sectors. Now, nonprofits pay equal or even less than these entry-level positions. There's no incentive for people to take on the additional burdens of working in human services like med certification, regulatory compliance and oversight, and even more significantly, confronting physical and emotional challenges presented with many of the people that we serve. We have received funds for specific expenses like benefit pool and new program development, but we have not received consistent increases to justify annual budget allocations for wage hikes. Private providers frequently lose star employees to DDS and other state service departments because union employees receive a significantly higher rate of pay. Just in the last year, we've lost 3 behaviorists and 3 managers to DDS, not to mention countless direct support professionals. The state has indexed increases helping their staff compete with inflation. Indexing salary increases for nonprofits equal to that would help stabilize our workforce. This stabilization is essential for providers like CCARC to remain fiscally sound and able to provide quality services that comply with the safety standards set by the state. We do our best to bring in people into program as it is our mission and drives fiscal management. However, we are turning away higher need people because the rate of pay does not cover associated staffing costs. If we can't pay the staff an attractive rate, we can't serve the people. If staff were paid a competitive wage, we would not have staffing shortages. Managers and directors would not be providing direct care. Better management of staff and programs would lead to more efficiently managed programs and services, and senior management would be able to address strategic issues like rolling out more independent living and employment options that are sought by DDS. And I'm out of time. Thank you very much. Does anybody have any questions?
Yes. Yes. Does anybody have any questions? No. Thank you. And thank you for your testimony. Thank you
Yes.
very much.
Just a quick comment. If you wanted actual costs of healthcare benefits, I'd be happy to provide that. Somebody had asked a question about that earlier, so you can see
It,
what we
it would be
provide.
good if you could send it to Susan Keen, who's the administrator for appropriations, and she'd
Sure.
get it out to all of us
Sure.
so that all of us get the same information.
Happy to
Okay?
do so. Thank
Thank you, thank you, and have a good day.
Next, Wesley Brolick. Is he online? Go right ahead, sir.
Dear leadership and members of the Appropriations Committee, thank you so much for this time today. I have to be honest, I'm a little sideways after the news from Connecticut Humanities. My name is Wesley Brolick, and I'm a resident of Wethersfield, and I serve as producing artistic director of Times Fool Company. I'm a nonprofit professional theater in Wethersfield with a focus on accessibility. We believe that art is a human right and cost should not be an obstacle to attending professional theater. So if you haven't come to our free Shakespeare in August, you should. Bring the whole family. It's free and it's a magical night for everyone. Everyone. There's something to that word. The arts in theater should be for everyone. Almost 25% of our audience is under the age of 18, and for most of those kids, it's their first professional theater or their first Shakespeare. Over half our audience is from outside Wethersfield, and folks regularly attend from as far away as the Berkshires. Our professional union artists serve thousands each year, and our events are either free, like our summer Shakespeare, or pay what you can, and that means I have to raise a lot of money and write a lot of grants. I also serve as chairperson of economic development for the town of Wethersfield, and I'm submitting testimony today in support of SB 1551 with respect to the dire need for increased investment in statewide arts, culture, and tourism infrastructure. Federal agencies that support arts and culture are being decimated as we speak, so the time to do something about it is now. I believe the arts are also a cornerstone of economic development, and data shows that if you want to transform Main Street into a thriving place, the arts are the way to do it. Now, people ask me, how are the arts economic development? Well, ask our shopkeepers and businesses how they're impacted when we hold an event. Try to get a table at the Charles or Lucky Lou's or a slice from Village Pizza. A few weeks ago, we held an event at Heirloom Market, and we had to turn people away because we were at capacity for fire code. What could have been a sleepy, quiet night in February turned into that business's biggest day of the month because of our arts event. We can't do what we do without help from agencies like Connecticut Humanities and the Office of the Arts, and we receive funding from both. We are also the recipient of a Good to Great grant, and we are grateful this essential assistance. Essential because we have very little earned income in an effort to make art accessible for all. A bill like this could be transformative for our organization as we serve the public for its benefit and betterment. We bring an estimated $70,000 of additional spending every year to Wethersfield because of the programs we offer. And I think if you look at the Wall Street Journal today, you'll look at the economy, and those folks need that $70,000 in additional spending. And we can't do it without your help. Personally, I believe the theater is one of the last bastions of true democracy. It's one of the few places in our fractured world where folks with different ideologies can gather together side by side and watch their collective humanity reflected back at them at the stage. Thank you for your time, and please support SB 1551. Happy to answer any questions.
Thank you. Are there any comments or questions? Seeing none, you're all set. Thank you. Up next is Sandra Fiera Molina. The floor is yours.
Good morning, or good afternoon. Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Sandra Ferreira Molina, and I'm testifying on behalf of the Connecticut Oral Health Initiative in strong support of House Bill 7254, which seeks to increase Medicaid reimbursement rates for dental services in Connecticut. Connecticut is in the midst of an oral health crisis. Medicaid reimbursement rates for dental services are among the lowest in the region, forcing providers to cut services or close entirely. A study commissioned by the Department of Social Services revealed that Connecticut funds community health centers at 20% below the average of their peer states, a gap that has led to devastating consequences for thousands of patients. We are already seeing the fallout. Community Health and Wellness Center in Torrington was forced to shut down its entire dental program, leaving 1,400 patients with no local access to care. Staywell Health Center in Waterbury has had to eliminate critical procedures like crowns and root canals due to financial losses. Bridgeport Hospital is canceling 75% of dental cases in the operating room, leaving hundreds of children, many with severe dental disease or special healthcare needs, without treatment. These are not just numbers. These are real people suffering because they cannot access the care they need. Patients are not waiting with excruciating pain. Parents are driving hours just for a routine cleaning, and emergency rooms are filling with preventable dental cases, all because Connecticut has failed to fund oral health care adequately. The financial strain extends beyond dental providers. Hospitals across the state are already absorbing $1.4 million in Medicaid losses, weakening their ability to serve our communities. If Medicaid reimbursement rates remain stagnant, we will see more closures, more suffering, and worse health outcomes for our state's most vulnerable residents. The solution is clear. House Bill 7254 must pass to bring Connecticut's Medicaid reimbursement rates in line with our neighboring states. What this will do will keep dental clinics open and allow them to serve more patients, ensure essential procedures remain available, reduce costly emergency room visits for preventable dental conditions, improve overall health outcomes, and reduce disparities. Oral health is not a luxury, it's a necessity. We all have teeth. Well, most of us, but we all have a mouth. You have the opportunity to protect access to care for thousands of low-income families, seniors, and individuals with disabilities. Thank you for your time and consideration. I urge you to vote in favor of House Bill 7254 and ensure that all Connecticut residents have access to dental care. Thank you.
Thank you. Representative Cavros DeGraw.
Thank you so much for being here to testify. I just want to, because this is not the Public Health Committee, but certainly I think it's really important that we discuss the fact that how important dental health is to our communities. Could you just expound a little bit on where our health starts and whether or not it's in our mouth?
Interestingly, Lena, I am not a subject matter expert when it comes to dental care. I'm a public health professional, but we all know that there are many studies that have come out that heart disease, Alzheimer's, all of those, not necessarily preventable, but can be reduced in risk if we do take care of our mouths. A simple cavity can lead to a root canal, which then can lead to an extraction, which can lead to infections and a whole bunch of other things. So it's essential.
And I would add to that list, not having good oral health, regular flossing can lead to pancreatic cancer.
Exactly.
Which is,
Thank you.
it's really on the rise right now. So thank you so much for being here today. Thank you, Madam Chair.
Thank you.
You have a question? Representative Walker.
Thank you, and thank you for your testimony. Are you familiar with the Mission of Mercy?
Of course, yes.
Okay, yeah, I just want to give you guys an incredible shout out. For those that don't know, it's a free clinic that we do in Connecticut, and we move it around the state. And I've had a chilling experience of being there on both, at least the last couple of times it's there. And the people that come and stand in line because they
hours.
don't have dental service, they start the night before, and it was really, it was shattering to me to see that people really are needing. So as my colleagues are saying, it's important. You've got to have dental care. And I thank you guys for supporting it and standing out for this, because we got to make sure we save the people of Connecticut in every way. Thank you.
Unfortunately, thank you, Representative Walker. Unfortunately, that's just a Band-Aid.
Oh, yeah.
Right. And it's great. And it's probably going to be full in June. They have a clinic in New Britain. And so we know that hopefully people will go, but we need to fix the system and not just put Band-Aids.
Thank you.
Thank you.
Any other comments or questions? Seeing none, you're all set.
Thank you so much.
Thank you. Up next is Randy Collins. Randy?
Good afternoon, members of the committee. My name is Randy Collins, Associate Director of Public Policy for the Connecticut Conference of Municipalities. Just briefly wanted to comment on two bills. The first is House Bill 6865, an act implementing the governor's budget recommendations related to general government. CCM has significant concerns with some of the proposed changes. I would like to start on a positive. We do support the recommendations in Section 19 that would provide grants from the regional planning incentive account for stormwater mitigation through the regional COGS and flood mitigation. Certainly, the issue of flooding is a rising concern for our towns and cities, and the planning portion of it is a major hurdle for a lot of our smaller communities. We have concerns with the proposed changes in Section 30 that would eliminate the provision that provides surplus revenue at the end of the year to our municipalities. It's not a consistent revenue stream, but it is something that can help when available offset costs. Proposed change would carry that forward to fund pilot and motor vehicle reimbursements the following year. As we've seen significant state surpluses, we don't understand why we would take that money that may be available to our towns. It was a great initiative by the Appropriations Committee. We appreciate it when it is there. We have a I know Betsy Garrett from Cost referenced the issue with the 10% penalty under the revenue sharing grant based on inflation. We're seeing significant budgetary increases across our communities, and these are driven by largely out of their control: inflationary costs, rising utility, healthcare costs. The idea that to meet those needs that they would be further punished will just push more onto that property tax. Also within Section 36, it removes the hold harmless provision that we put into place when we adopted the tiered pilot. That really was a critical piece in getting, having Darien, who didn't benefit from the tiered pilot, but understanding the benefit to our some of our needier communities, but making sure that they would not fall below. And it's a hold harmless, I think, at 2021 levels. While the governor's proposed budget would maintain it this year, it does make it easier, I think, to see movement on that. The last one that I just wanted to mention is support for 1545 early funding, funding for early voting. I know that it is a study. It's certainly, we need assistance on this. We have municipalities received a one-time $10,000 grant. The costs are significantly beyond that. Voting is a collaborative effort that should be carried by the state and our municipalities, and we do need support to continue to ensure we implement those provisions. Happy to answer any questions, and thank you for your time.
Are
I
there
didn't
any,
want to get the bell.
are there any other comments or questions? Thank you, Randy. Appreciate it. Up next is Thomas Burr. Mr. Burr, floor is yours.
Yes, good afternoon, Senator Austin and members of the committee. My name is Thomas Burr. I'm the Public Policy Manager for the Connecticut chapter of the National Alliance on Mental Illness, otherwise known as NAMI Connecticut. NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. If any of the committee members are unfamiliar with us, I've attached more information to my written testimony. I am testifying today in support of Senate Bill 1547, an act concerning funding for nonprofits. One of NAMI's 4 key areas of policy focus is to improve health. As an organization, NAMI fights for policies to ensure people get the best possible care, and this includes expanding access to health coverage, parity for mental health, and promoting early intervention and care integration, and ensuring that the right services are available at the right time. We are in support of this bill as we believe that this will help decrease the wait times and increase the availability of timely behavioral health services. As you've already heard this morning, funding for Connecticut's nonprofit behavioral health providers has lagged significantly behind inflation for years, as had the Medicaid payment rate for healthcare providers who accept Medicaid. This has resulted in providers cutting staff, cutting programs, as well as limiting the number of people they serve who utilize Husky, Connecticut's Medicaid program. This creates increasingly longer wait times for people to access behavioral health services. This level of funding increase is long overdue and makes both fiscal and moral sense, as they can help people with behavioral health conditions regain their health, as opposed to their health declining and leaving some of the most vulnerable people in Connecticut to continue to suffer unnecessarily, and as a result, becoming harder and more expensive to treat when their needs are not met in a timely fashion, and their health needs then become critical. And while we again support the overall concept of this bill, we do want to support the stance of the Connecticut Community Nonprofit Alliance, who is advocating for modifications, changing the indexing metric to a measure of inflation rather than tying it to state employee increases, and providing the COLA for nonprofit services that includes all the costs of delivering the services, including health insurance, fuel, vehicles, et cetera, as you've heard. So in conclusion, please approve Senate Bill 1547 with the aforementioned changes, which will help immensely with having these life-saving behavioral health services available when people need them. And since I didn't hear the ding, on a side note, I did a quick survey of our membership before coming here today, and 94% of them are in favor of this as well. And I'd also like to echo Jeff Vanderploeg's comments on the funding of the UCCs. That's critical for children's mental health. And I'd also like to reference Carrie Dyer's earlier comments regarding just some of the things that are happening boarding in emergency rooms. Peer-run respites could really offset some of that at about 1/10 of the cost of an inpatient hospitalization. So I would encourage you to include some money for peer-run respites. Thank you, and I'd be happy to take any questions.
Thank you. I just have one question.
Sure.
Have you done an analysis of how many on the mental health side? Because we were looking at DDS. DDS is mostly served by nonprofits now. What is the breakdown between the services by state employees or state services and nonprofit providers? Do you have a breakdown on mental health?
I don't, but I bet you Ben Shaken does, so I can ask
Okay.
him for that.
We will ask him. Thank you.
You're welcome.
Anybody else have any questions, comments? Representative Corpus?
Thank you. And thank you for your testimony. I think you had said in your testimony that you would have preferred to see the wage increases for nonprofits tied to inflation versus tied to employee raises,
Yes.
state employee raises. Could you give us a quick pluses and minuses of each of those kinds of frameworks for this bill?
Well, I think, as you've heard earlier today, the way that if it's tied to the CBAC agreements, the different weight that might be in that agreement for wages versus benefits comes into play. And having a cost of living, at least by the analysis of the Alliance, seems to be a more equitable, fair, and complete solution as opposed to tying it to the CBAC contracts. That's how I understand it anyway. You're welcome.
Any other comments or questions? Seeing none, you're all set.
Thank you.
Up next, Lisa Armatruda.
Good afternoon, Senator Austin, Representative Walker, my Senator Eric Berthel, and esteemed members of the Appropriations Committee. Thank you for allowing me the opportunity to testify on Raise Bill 1545, an act concerning funding to municipalities for early voting. My name is Lisa Amatruda, and I'm the Republican Registrar of Voters in the town of Woodbury and the chair of the Litchfield County ROVAC, Registrar of Voter Association of Connecticut. As I testified last week on Bill 17, the cost for early voting, especially on small towns, is overwhelming and unsustainable without financial help from Hartford. I'm completely in support of Raise Bill 1545, which requires the Secretary of State to report the costs incurred by municipalities for election administration relating to early voting. Some of the factors that I'd like to be considered in this study are the costs for residents of smaller towns, in addition, and also additional equipment needed with some of the other recent changes in the law around early voting. As I mentioned above, I'm the chair of the Litchfield County ROVAC, and we represent a lot of small towns in Connecticut. When the money is typically appropriated and then distributed, I'd like you to please consider the cost directly to the residents of smaller towns. All towns and cities had to have a minimum of one early voting polling location in 2024, and no towns or cities opted for more than that one early voting polling location. The laws around early voting are across the board, regardless of the size of town, which, I'm not opposed to that at all, but the costs are spread out to a much smaller pool of residents in a smaller town. It means that the costs are actually a lot higher for a resident of a town with, say, 1,000 voters than a city with 30,000 plus voters. Even though they have more voters to accommodate in bigger cities, the basic costs of setting up one polling location were similar for at least last year in the presidential preference primary and the August state primary in 2024. So in the second round of grant money that was given in 2024, small towns and cities received much less money than the cities and towns with more voters. And many of the small towns also have more than one district, which requires more staffing due to the requirement that we need to have one ballot clerk per district. This increased the cost again, even though there are many less voters in small towns. to bear the burden of that cost. And with the new statute that each district and precinct must have their own tabulator, the costs are going to drastically go up again. Most towns use secure transport cabinets to house election supplies, including the tabulators. And the cost for these cabinets are approximately $3,000 each. The original cabinets purchased only fit 2 tabulators, so many of the towns and cities will need to purchase more. In some towns and cities, the cabinets alone will be tens of thousands of dollars that they'll have to buy. So early voting is very expensive, and it has more than doubled my town's entire election budget for this year, as I mentioned last week. So in closing, please help our towns and cities fund early voting. Please support Bill 1545 so you can get the information you need to be able to fund early voting, hopefully permanently. Thank you.
Thank you. Are there any comments or questions? Representative DiCaprio.
Thank you, Madam Chair. And just a question for you as far as the discussions you've had with other registrars. Is there any talk of maybe shortening the early voting time, to reduce costs?
If we had any say in that, we would absolutely shorten that. We that's up to the legislators to do that. And so every registrar that I've talked to, not every single one, but I would say the overwhelming majority do support reduced number of days, particularly for things like primaries, where we paid $165 approximately per vote in my town. Just for early voting costs. So, we would love to see shortened days in early voting.
Just one thing, and maybe if you have a suggestion for us, maybe we can include that in the discussion anyway. Thank you for that. Thank you for your testimony today. Thank you, Madam Chair.
Thank you. Any other comments or questions? Seeing none, you're all set.
Thank you.
Up next is Rufus Duran. Floor is yours.
Good afternoon, members of the Appropriation Committee. My name is Rufus Duran. I'm a resident of Kent, Connecticut, and I'm the interim director of the Connecticut Arts Alliance, which is the statewide arts, culture, and creative economy advocacy organization. And I'm testifying today in support of SB 1551. We're at an inflection point in our state and our nation. As my colleague Jason mentioned earlier, with DOGE gutting both IMLS and NEH in the last 2 weeks, and most likely the National Endowment of the Arts next, with the takeover of the Kennedy Center, with our Smithsonian Museum system under attack, our arts and culture workers are not doing okay. We're used to lean times, doing much with very little. We're deeply trusted by our communities, increasing civic engagement, preserving our history, bringing our communities together, and increasing almost every social indicator of health that there is. Our sector is a vital public good and has true and very real impact to our state beyond our deep and vital economic activity that makes up about 4% of our state's GDP. That's about $12.7 billion. And brings millions of people into our downtowns every year. The stress is palpable. People are worried about their jobs. We're worried about closing doors on community assets, all to save a small fraction of the budget. We need bold and decisive action from the legislature right now. Our sector has barely recovered from the last recession in 2008, which still represents the state's high point in investment in our sector. With the exception of ARPA and COVID funding that for a brief moment brought Connecticut to the #1 state in the country for investment per capita in our sector. And that was a brief moment because now we're back down into the bottom of the pack. And we lag behind our neighbors in investing in arts, culture, and tourism. The funding proposed in SB 1551 and even more so HB 7176 can work to establish and save our cultural legacy in this state. The connection to restaurants and the meals tax is mutually beneficial relationship. If you've ever tried to get a restaurant seat when there's a big show going on or a festival, you can't. I truly believe it's a sustainable and lasting way to solve some of these funding issues that have plagued our sector for the last decade. If we want to support the next generation of creative thinkers and workers, and we want to cement our legacy as a creative state, we have a history of innovation and of creativity in Connecticut that goes back to our founding as a state. We need a bold investment from you right now. I encourage you to look at increasing the percentage allocation of SB 1551 closer to HB 7176 so that we can keep our downtowns vibrant, celebrate the diverse and deep history of our state, and bring our communities together. We look forward to working with you to make this bold investment so that other states can look to Connecticut as an exemplar of how we are going to band together to keep why we all live in this state, the reason why we stay in the state. I grew up here and I moved back here for a reason. I love Connecticut. I love the fact that I'm 10 minutes away from a hiking trail no matter where I am in the state. I love the fact that we have a carousel museum. It's one of the best museums in the country. I love the fact that we can go anywhere and hear great music and see our history preserved in unique and interesting ways. I mean, in my hometown, we have the Sloan Stanley Museum that works to connect young children with trades. It celebrates the history of our tradesmen and that work in our state. I mean, Connecticut's special, and we're at a point where we need this help, and I'm looking for you to help that. And I do want to mention that I have been doing this advocacy work for almost 10 years in Connecticut. I have never seen this much support, bipartisan support for our sector in the legislature ever. And I want to thank you for recognizing the vital work we do in our communities and the support that you've given to us as we all work out how do we deal with what we're dealing with. So thank you.
Thank you very much. And I am so impressed that you came today and spoke about how great this state is, because it is. It truly is. The services that we provide here are better than almost any other state. Do we have some need to fix our revenue relative to disbursement? Absolutely. But I am so impressed that you came here and didn't say Connecticut's just awful and they shouldn't be doing anything and blah, blah, blah. When I think that what we have as a state is truly special. Our open space, our shoreline, our everything, our subbase, our everything about it. The museums are fantastic. And so I'm just so impressed. I wanted to thank you for coming up and saying Connecticut was great, because it is. Is there any other comment or question? Seeing none, you're all set.
Thank you very much.
Thank you. Up next is Michael Biondi. No? Up next is Gabrielle Gamadella. No? Tracy K. online. Tracy?
I guess I'm here. Thank you. And thank you. Good afternoon, members of the Appropriations Committee. I'm Tracy Kay, a resident of Stamford, Connecticut, and CEO of the Bartlett Arboretum Association. I also currently serve as the Vice President of Connecticut League of Museums. Thank you for the opportunity to submit testimony in support of SB 1551. The Bartlett Arboretum Association, also known as the Bartlett Arboretum and Gardens, is a nonprofit organization providing educational programming for students of all ages and abilities by highlighting the unique collections of flora and fauna associated with our 93 acres of open space and natural habitats. The property was purchased from the Bartlett family in the 1960s by the state of Connecticut using state and federal open space funding. Upon the purchase, the Connecticut Department of Environmental Protection assigned the responsibility for operating the Arboretum to the University of Connecticut Department of Plant Sciences. That department partnered with the newly formed Bartlett Arboretum Association to plan and develop the Arboretum as a living museum. In 2003, the property was transferred to the City of Stamford, and the association now partners with the City of Stamford to maintain and grow the programming of the Arboretum. In addition to serving as part of the educational infrastructure of our region, the Arboretum provides workforce development opportunities in landscaping and arboriculture and is the host site for the Yukon Master Gardener program. The guidance and support of the art that the Arboretum has received from the Connecticut Humanities has been transformational. Grants from the Connecticut Cultural Fund, Connecticut Summer at the Museum, and Good to Great Grant 2.0 programs have allowed the Arboretum to increase its level of engagement with members of our community and well beyond. The Arboretum now serves over 100,000 visitors annually, with an estimated 15% of those visitors coming from out of state. In fact, HGTV rated the Arboretum as Connecticut's top green space in recognition of its stunning landscapes, outdoor adventures, and family-friendly activities, all free and open to the public. We've become a destination point for many travelers along the Northeast Corridor, many times when they're stuck in traffic, but we'll take that. Many of those travelers visiting the Arboretum extend their stay in Stamford, patronizing many of its eating establishments and, in several cases, its lodging options. With what Jason and Rufus have referred to as anticipated elimination of funding for our cultural institutions at the federal level, alternate sources of support will be critical to maintain the character of our communities that make them places people want to live and visit. Funding from the proposed bill will help immensely. Thank you for consideration and hopefully your support of SB 1551.
Thank you. Are there any comments or questions? Seeing none? Thank you.
Thank you.
Up next is Andrew Feinstein. Andrew, the floor is yours.
Hi, I'm Andy Feinstein. I'm legislative chair of SEEK, which is Special Education Equity for Kids in Connecticut. I do want to point out that in your talking about the virtues of Connecticut, you left out one very important point. This legislature is so hardworking, so well-informed, so accessible. I've worked in other legislatures. Nothing matches what Connecticut legislature provides. So in the list of Connecticut's virtues, I want to add that. Getting any money out of this committee is worth it. Two bills you have before you dealing with special education. Neither add anything. Both ask for data that already exists on the state website. But let me just talk briefly about both of them. One of them asks the commissioner to come up with cost savings for special education. Now, the fact is that we have a legal obligation to provide kids with a free, appropriate public education. IEPs are designed to do that. Cost should not be a factor in terms of designing what's an appropriate program, but as between various appropriate programs, of course, a district can choose the less expensive one. The opportunities for cost saving in special education, I think, are actually fairly limited. Sure, we could do things more efficiently, but we cannot do it by depriving kids of the free, appropriate public education to a certain extent. The other bill deals with transportation. Two things I think should be considered there. One, having the State Department of Education create an online clearinghouse so districts can share transportation, particularly to placements out of district. And two, when you look at the costs, which are spectacular of transportation, it seems to me that liability is a very big piece of that. Why don't we think about the state assuming the responsibility for liability and then paying sort of like we do for taxis on a mileage and time basis, which I think would substantially reduce the cost of transportation, rather than having every district contract with either provided internally or contract with some company to provide that transportation. I think there are ways to deal with that. I very much look forward, Representative Corpus, to the recommendation. And Senator Austin, the recommendations of the select committee. Time is getting short. Eagerly awaiting what you're coming out with on that. And I hope we can put together a package of special education reforms that will control costs and provide excellent education. Thank you for your time.
So, thank you. do you remember the time when we used to have a transportation grant and took that away relative to a cost saving measure? And the intention of the transportation one, the data is there, but not widely used, and trying to figure out the differences in programs. So if you're in a area of the state that requires more time to travel between picking up the student and dropping them off at a special education system, either out district, just down the road, it's still more expensive the farther they have to travel. And that's something that we were trying to just say out loud. You know, sometimes you have to say it out loud like 6, 7 times before people start recognizing it. Do you think that if we concentrate solely on cost, that some of the programs that exist right now would not exist if they were not able to receive the dollars? If we, for example, cap special education cost, do you think that that will have a negative impact on the available services?
Yes, yes. There's not a week that goes by that I don't get a call from a parent telling me that their kid is stuck at home because there's no program to place the kid in. We are really short of programs right now. RESCs provide programs and the private providers provide programs. If we cap costs too low, we'll see what's happened with Medicare, which is services that aren't provided because people aren't going to provide services if they can't make ends meet.
And most of the services that are provided in these regional hubs, for lack of a better term, generally requires staff to have specialized training. Is that training going to lead to an increase in the cost of that individual providing that service?
Yes. Yes.
So I'm saying that out loud because I've talked to a lot of people who say we should just cap the costs. And I'm concerned if we cap the cost that we're not going to have anybody at that level to provide the service, because we're saying, even though you work harder, you needed more education to get to this level, you needed to be have a broader expertise in a certain area, that we're going to pay you less than what's being paid at the local board of education. So we've sent them out of school because the school didn't have the resources. If we send them out and they don't have the resources available to them, or they're not paying the person that has the expertise, I'm concerned, I don't know if you share my same concern, that we're not going to be able to provide those resources.
I'm very concerned about that. And I also think that, when we look at private programs, I don't know that a public school could provide them any less expensively than the private programs do. A lot of these schools, a lot of these private schools have one-to-one staffing with behavior therapists, one-to-one with kids. That just costs a lot of money.
Right. Representative Walker.
I'm one of those that want to cap the services. Just thought I'd put it right out there.
I believe I sent you an email on that subject recently.
Yes, you did. I right now, we don't have a barometer. We don't have a barometer of who's really providing the good services, who's doing the things that we need for our kids. But we have a lot of people that provide us services. So I think we have to come back and evaluate what we've got and make sure that these are the services that we want for our kids. I've seen some programs that, they just have somebody sitting there with a kid in a room. I've seen ditto sheets and things. I mean, but yet they get top dollar. And so what it does is it drains on our educational funding. And that's what I worry about mostly, because we haven't really established the parameters to evaluate the programming for me. I'd be happy, whenever we get through some of these conversations we're having here, I would love to debate it. I would love to go to some of the facilities and show you what I saw and see if we would have that same discussion. I think our children deserve the best, but I also believe that we have a lot of children that probably aren't getting those services because of the cost that they are, because the districts aren't paying for it. So we've got a long way to go for me to provide additional funding when we need to know what are the things that our kids should be getting and how we should be providing it. Thank you.
In terms of the quality of services, I'm completely in agreement with you that the services often are inadequate, that we have no way of monitoring the effectiveness of those services. And we need to look at that. I think capping costs doesn't get us there. I think that process is critically important, that we need to do that. We need to do that not only for the private placements, we need to do it for the risks, and we need to do it for the in-district programs as well.
Yeah, absolutely. And maybe capping costs isn't the term, capping rates. I right now, it's because I'm not saying that, we shouldn't spend the money, but I think that there are people that are taking advantage of us because we don't have any monitoring going on in Connecticut. And they tend to overcharge for things. And so, like I said, I want to make sure that the education funding doesn't get depleted by people who are, trying to make their life pensions off of our educational system. So that's just my thoughts. As long as we get our kids taken care of, I'm good. But I want to make sure we have.
No disagreement on quality, disagreement as to whether capping rates gets us there.
Yeah, thanks.
Representative Nuccio.
So I want to align myself with what Representative Walker is saying. I also think we need to be looking at capping the rates. I think we have to look at private equity. It's no different than private equity in the healthcare field, which we're seeing has been pillaged. Like it's coming in to take over the public service stuff. And, I think with private equity here, it's a profit model, period. And education shouldn't be a profit model. And I also have concerns about the quality of education people are getting and also the classification of education that people are getting. Because when I'm at public forums and I'm hearing that it's cost $1 million to educate one child, I want to know how much of that is actually for education and how much of that is not. Because there are things that I think that are being done that should be handled through insurance or Medicaid. PT, OT, unless it's directly related to a child holding a pencil or something like that from an education perspective. We are placing people in residential units in Utah, or we have people that are in residential units that they're living in other states that are costing our local taxpayers $350,000 a year. They're living there. I don't know how living someplace has something to do with education. Education happens between certain hours in the day, et cetera, et cetera. So I think that there is definitely room in this model. I think there's a problem with transportation across the board again. And I don't like the fact that private schools can just change their rates in the middle of the year. And then the town has to respond to that. And the flip side of this is that when that happens, it hurts every other child in that school because there is no option to not pay it, right? The private schools and the outplacements have the ability to change their rate and say, this is what you have to pay because you have to provide this education. And in doing that, you are then hurting every other child that is in that school system because their budget is already passed. And now you have to pay for this, which means you have to take from that. And it's not a balanced or equitable equation. I think we have to really just look at the services that are being provided, the education that's being provided, the quality, whether or not it's doing what we need it to do. Are we overextending to overreach beyond education? And I personally just don't think there should be any private equity involved in it because we are constitutionally required to provide an education. That means it is a governmental service. It is a constitutional requirement. And in that case, I think you bring private equity into it, and we've got Prospect Hospital closing down hospitals. We've got private institutions charging hundreds of thousands of dollars to educate a child, and with no defined outcome that this is the best education for them. So I'm interested to see what people have to say. I think looking at this transportation cost and also looking at the cost of these outplacements is required. It's a necessity. You know, I think the pendulum has swung so far one way that everything is off balance. So, I'm with Tony on this, Representative Walker. I think, you know, we have to look at capping the cost, and we have to put in measurable accountability to be sure that the dollars that we are spending are doing what we need it to do in relation to education. And if there's something else, then, you know, insurance or whatever else, we have to look at that. Residential placement should not be part of educational costs. So I think there's a lot of work to be done here. And I think we're just kind of hitting the tip of the iceberg with this special education committee. I think this is going to be a few years long process to really define what this looks like. And I'm glad we're just actually finally starting to have the conversation.
I don't want to prolong this, but I do want to push back on a couple of issues.
Go right ahead.
One, I know of no child placed in Utah under an IEP from a district. I do know of cases where there's a settlement agreement that provides some funding for those placements, but I don't know of any official placements under an IEP there. Second, the issue of private equity or the issue of private ownership. I think the question is, you take the services, the direct services provided out, and then you look at overhead as a percentage of that. And it seems to me that that's you know, whether it's a nonprofit or a RESC or a privately owned company, that's where we ought to be looking for you know, sort of similar levels. If the amount of overhead is higher for one of those or for a particular program, that's what we ought to be looking at. And third, and most importantly, you've raised a lot of important questions there. I think we need to get some answers to those questions before we set up a system of rates. And I'm not sure that the Department of Education, which, you know, under 1244, has a year to do that. I'm not sure they have the time or the capability to do that. These are some very serious questions that take a lot of work, and you know, and the danger is that if we don't do it right, we end up without the programs we need, or if we don't do it right, we end up paying too much, perhaps. So let's spend the time. Let's spend the next year or two actually answering these questions and coming up with a scheme that makes some sense. So I think.
You know, I agree with you. I think we have to. It's like we have to be in the space where we can ask those questions without being attacked for asking those questions, which I think we're there. And we need to have the ability to get that information. And as far as you're talking about the overhead, I absolutely agree with you. I've seen a phenomenon across this state, whether it be in elementary and secondary education or even higher education, where we're seeing a massive decline. We all know babies are not being born at the rate that they were. We're not even replacing the amount of people that die. We've seen a significant decline. And what we have seen on the offset is a massive uptick in admin, right? So for every two teachers that get laid off, an admin gets hired at double their salary, right? So I absolutely agree with you. Admin and overhead needs to be looked at, and we have to look at MBR. There are so many different things that we have to look at, and the evolution of what education is and how it's delivered in this state. I'm here for it. I'm here for the work. You know, I'm here to take that, like you said. This committee is not going away, as far as I know, for any time. You know, I'm on it. Tina's on it. So much of people here are.
I forgot to mention that you're on it. I know
yes,
that.
That's okay. Listen, I don't need to be mentioned on it, but I think it's just important that we talk about the fact that there are people at this table who really want to start digging in and getting this done. And I think it goes beyond special ed. It looks at education as a whole in the state. So, you know, again, I'm eager to be at the table with you, but I think, you know, we have to look at all of it.
And I'm totally committed to working with you on all that. And would never attack your motives for saying this.
Yeah.
I just want to point out that, you know, you have like 2 weeks to your reporting deadline for
trust me.
For select committee, so that's plenty of time to solve it.
Try plenty of time to solve world hunger, right? Yeah, I know. Trust me. I'm asking the same questions. We all are. So thank you.
Representative Corpus.
Thank you, Madam Chair. Thank you for your testimony, Andy. I won't rehash a lot of the excellent points already made. I do share your frustration, you know, that we need to get this bill and we need to start, you know, we need to see it in its totality. And we also need to look at all of these topics together. I had this issue in Education Committee, which was why are we dealing with pieces of the special ed bill versus dealing with it all in one place because every piece affects the other, including this transportation issue. But since it is before us, I wanted to ask you a specific question. You'd mentioned a State Department of Education portal, which would show the routes as a clearinghouse for all the districts to potentially figure out, can they save costs? Sometimes the district's costs are 50% transportation for special ed. The portal would create a system whereby two neighboring towns could look on the portal, see where students were going, and possibly pool together and save costs. What is your opinion on that? Is that a workable system? I've heard both sides of it, including that these kids can't be on buses for very long, individualized buses, and that the buses need to be outfitted for their particular needs. I'm curious as to your point of view on this bill before us.
I don't
or
think
this
it's a
topic.
I don't think it's a panacea. I do think that at relatively low cost, we could produce some savings by doing that. I agree, you know, that if it means that the regulations now say that a child should not be spend more than an hour getting to school. If it means that you're going to exceed that because you have to do pickups, obviously that's a problem. But, you know, I just look at at your area, Representative Corpus, where there's a whole bunch of towns that send kids to CES in Trumbull, all along the 95 corridor there. I don't understand why when you go to CES in the morning, there's a list of buses from each different town, each carrying one or two kids. There's got to be a way to make that more efficient.
Through you, Madam Chair, thank you for that, because I want to make sure it is more efficient, because my towns now collaborate on students on an ad hoc basis.
Right.
But if you think that there could be, maybe it's not a quantum leap, but a material step forward in efficiency by doing this, that's helpful testimony.
I
So
think that's
thank you.
right. Thank you.
Thank you. And there are two sides to this. I am very worried about us capping and doing this. I've talked to many people on this issue relative to rates and how we're handling the problem of special education. There are $1 million kids out there. I do think that there is a component that minimizes some of the resources available for regular education students. That's a problem with ECS and how we're funding it, not a problem with the special education services that we are, in many cases, not providing at the level that we need to make change in that student's life. I don't think that we should minimize them or the regular education students. Having had a family member participate in special education and often told you have to come up with the cost of those special education services and paying those special education services, whether it's in because of medical or mental health or developmental reasons, is not a reason to minimize what that child would get, and puts an awful burden on the parent that has that special education child. So I am worried about this as people are looking for a way to drive down the costs. I think special education is very expensive. I also think that the federal government, while not willing to take on the responsibilities that they have as a federal government, is supposed to pay 40% of regular special education costs, which would take a lot of pressure off of local school districts. Instead, in Connecticut, we get 6% and are soon to see that diminished to nothing. So I think that this is something that we have to continue to talk about, but I am not interested in having no services for special education kids. And I'm not interested in seeing a cost to students that don't need special education services diminished because of the special education services. So
Well, I want to say two things. One, let's not equate spending more money with better services.
correct.
There are plenty of ways to provide better educational services at lower costs than we're providing now. First. And second, yeah, I think we can all agree that let's put the cost cap on hold, and let's spend a year or two and devote some resources to really studying it and answering all the great questions that Representative Nuccio and others have come up with here. Thank you.
Thank you very much. We're gonna be talking about this nonstop. Up next, you're all set, sir. Up next is Wendy Vincent. Wendy, the floor is yours. No.
Thank you. Thank you for the opportunity to speak here today. My name is Wendy Vincent. I'm a resident of East Haddam. I own a business in downtown New London. I sit on the board of Sector, and I am also the executive director of the Cultural Coalition, which is a nonprofit located in Norwich. And our mission at the Cultural Coalition is to support the arts, heritage, and cultural communities of Eastern Connecticut, which is why I'm here today to submit testimony in support of Bill 1551, with respect to increased investment in statewide arts, culture, and tourism infrastructure. We've had some amazing speakers go ahead of me today who I know you've clearly seen the impact of what dollars for our sector does. And I've got the numbers here on a piece of paper to talk about, but I don't really think that we can look those up. We can talk about how we're number 3 nationally as an economic driver for our sector. But I really think what we're hearing a lot of today is the human capital piece of this. We touch a lot of different sectors and places. We do things like work on projects like social prescribing and revitalization, as Michelle mentioned, with CT Main Street, and hopefully help slow what Carrie deals with over at Reliance Health and intervene before it gets to that point where people are in dire emergencies. Rufus mentioned, we really haven't bounced back from COVID and, our industry shuttering doors and things that have happened. A lot of my constituents include individual artists, creatives, museums, theaters, municipalities, historical societies, chambers of commerce, arts organizations, creative entrepreneurs, health organizations, and we work to connect everybody and collaborate between all these sectors to make sure our ecosystem through workforce development, economic development, education, out-of-state investment, health and wellness, and cultural vibrancy to ensure that. We've all heard IMLS cuts, NEH cuts, NEA is next. Connecticut is an amazing place to live, work, and play. We have a really strong arts and culture community here. And in fact, one of my constituents the other day and I were having a conversation. She's an artist who's a transplant from California, who said she came all the way out here just because Connecticut is well known as a great place for artists to live and work. I would really like to, thank everybody who came ahead of me to speak on this too. Michelle, things that Rafa is doing is amazing. We just had our Connecticut Heroes Arts Awards last night in Hartford, and to hear the work that people are doing at this community level to ensure the vibrancy of our communities, to ensure our culture is being preserved, to ensure that people have safe spaces during a time when everybody, there's a lot of people under attack right now. Is amazing. And I really just want to end on, and actually I'm going to pull from what Representative Walker said earlier, arts and culture are really our soul. And with everything that's happening right now and the anxiety in the world and everything that we need to work on, I really would like to end with that arts and culture are our soul. And thank you for your consideration and your support of our sectors.
Thank you. We're going to go back to number 17. Frank Stillwagner.
Hello.
Frank, the floor is yours.
All right. Great. Thank you so much. Good afternoon, members of the Appropriation Committee. My name is Frank Stillwagner. 2.5 years ago, I moved to Connecticut to work as the Director of Development for Goodspeed Musicals in East Haddam. And today I am pleased to submit testimony in favor of Senate Bill 1551 in respect to the need for increased investment in statewide arts and culture infrastructure. I'm here today on behalf of the Board of Directors of Goodspeed Musicals and our Artistic Director, Donalyn Hilton. Goodspeed and all arts organizations not only serve as vital cultural hubs, but they also are key drivers in economic growth and community engagement across the state. To me, and I think to many, the arts are essential to the identity as a state and play a crucial role in enriching the lives of our residents. Investing in arts and cultural programs fosters creativity, stimulates intellectual discourse, and enhances the quality of life for all of our citizens. By supporting arts through state funding streams, we can assure a thriving cultural landscape that showcases Connecticut's rich heritage and diverse talent. Moreover, the economic benefits of the arts cannot be understated. Theaters like Goodspeed attract visitors from outside of our state. They drive tourism. They contribute to local economies. For every dollar invested in the arts, studies shows that it returns about $7 back to the economy through job creation, increased tourism, and spending in local retail businesses such as restaurants and hotels. By allocating tax revenues to support the arts and cultures, we are making a strategic investment in both our community's cultural fabric and its economic vitality. The COVID-19 pandemic has highlighted the importance of the arts as a means of healing and connection. However, even 5 years after the start of the shutdown, the arts continue to strive to recover. The need for support in this sector is more pressing now than ever. Dedicated funding will enable the performing arts not only to strive, but to thrive. It allows us to produce innovative programs, hire local artists, engage in educational activities that reach young audiences and underserved communities. In conclusion today, I'd like to just mention that dedicating this portion is not merely a budgetary decision, but it is an investment in our communities, our economy, and our collective spirit. Goodspeed, and dare I say, all the arts and cultural organizations that the state are committed, are absolutely committed to this vision. And we urge you to support this initiative, ensuring that the arts and culture continue to flourish throughout our state. Thank you for your time and your consideration today. I'm happy to answer any questions.
Thank you. Are there any comments or questions? Seeing none, you are all set, sir.
Thank you very much for your time.
Up next is Paula Mann Agnew.
Yes, good afternoon. Senator Austin, Representative Walker, esteemed members of the Appropriations Committee. My name is Paula Mann Agnew, and I am the Executive Director of Discovering Amistad. I am submitting testimony in support of SB 1551 with respect to the need for increased investment in statewide arts, culture, and tourism. Also, in support of HB 6737, the act of concerning the operation and maintenance of the Freedom Schooner Amistad. Senator Austin, a few minutes ago, you talked about all of the incredible assets to our state. And I just want to share with you one of a tremendous asset we have is this Connecticut's flagship, the Amistad. But unfortunately, I'm here to express my dismay that the governor's budget completely eliminated the operational funding for Connecticut's flagship. We need your help in getting it reinstated. As you are aware, Discovering Amistad is a nonprofit educational organization that owns and operates the 129-foot Amistad ship. The ship is a reconstructed historical vessel that symbolizes freedom and human rights. Right now, in this time of our history, it is crucial that we don't discard this great asset to our state. The organization has been in existence for almost 10 years and has been effective in using the ship as a floating classroom to teach the lessons of 1839 Amistad Uprising and the relevance for today. Our programming reaches 14,000 people annually, most of whom are students and teachers within 25 school districts. Annually, the ship travels to 7 to 10 ports throughout Connecticut and engages community members in free educational tours. Our school-based curriculum is in alignment with Connecticut core standards and serves 4,000 students annually. Discovering Amistad has provided professional development and culturally responsive pedagogy to 450 high school teachers to assist them to effectively teach the Connecticut African American, Black, Puerto Rican, and Latino course of studies. In a time like this, it is imperative that the work of Discovering Amistad continue so that our students can learn history that is representative and relevant to each of them in their communities. Histories come alive when students participate in this unique hands-on experience aboard the ship. They are inspired as they realize that they too can become leaders and change agents, as did the young Mende. They are empowered to know that the young BIPOC heroes of the uprising changed the course of history and brought structure to the abolitionist and civil rights movement. Our organization typically raises over $250,000 annually. However, DA's funding has been significantly impacted due to the political attacks on National Cultural Organization, as Jason Mancini already mentioned a few minutes ago. Not reinstating Discovering Homicide in the budget will result in the closure of the organization and the discontinuance of the use of Connecticut's flagship. DA would more than likely need to return the ship back to the state or completely dispose of it. This would have a direct impact on our tourism, our education, cultural vibrancy. Another disturbing fact is that our state just dedicated over $1 million to renovate the ship. Absolutely incredible. We're so thrilled that the state did that to keep the history alive. It would be an ultimate shame if our newly restored flagship just gets parked, and especially now when it's needed the most. So we strongly urge you to support us in restoring Discovering Amistad to the budget, and keep in mind the benefit to our state, to our communities, and most importantly, the impression of the young minds of Connecticut students. Thank you.
Thanks, Paula. Appreciate it. And I think we fixed the funding mechanism with correcting the name. So appreciate all you do. Is there any comments or questions? Seeing none, you're all set. Thanks.
Thank you.
Up next is Julia Wilcox. Is Julia on? Christian Damiana. Floor is yours, sir.
Good afternoon. My name is Christian Damiana, and I'm the Public Policy Manager at Mental Health Connecticut, a direct care and advocacy organization that has provided essential mental health services across the state for more than a century. Year after year, nonprofits come before this committee to explain the same crisis in different words: underfunding, workforce shortages, unsustainable costs. We've laid out the numbers, the reports, the economic arguments, but at its core, this is not just a fiscal issue, it's a human one. Connecticut's nonprofits are filled with passionate, talented professionals who have dedicated their lives to serving others. They show up every day in crisis centers, group homes, community clinics, not because the pay is great or the workload is easy, but because they believe in the work. They fight through burnout because they know that walking away could mean someone falling through the cracks. And for all of that dedication, they are rewarded with wages that barely keep up with the cost of living, let alone reflect their skill and their sacrifice. We are in this position because the state has not kept up its end of the bargain. If funding had kept pace with inflation, we wouldn't be here asking for emergency fixes year after year. That's why SB 1547 is so important. This bill does more than just provide temporary relief. It ensures we won't be back here in 2 years having the same conversation. By indexing nonprofit salaries to inflation, it acknowledges a basic reality. Costs go up, but if pay doesn't rise alongside it, services will erode, programs will shut down. This isn't radical, it's responsible. It's how we treat other essential services, and it's time we do the same for the nonprofits that hold Connecticut's safety net together. At Mental Health Connecticut, we've seen firsthand what happens when staff funding fails to keep up with reality. We face ongoing challenges retaining employees, with more than 30 vacancies on average at any given time. This isn't just an administrative inconvenience. It means fewer staff to support those in need and an increased burden on the dedicated professionals who stay. It also means that our ability to go above and beyond contract requirements to provide exemplary whole health care is shrinking. We want to offer the best possible support to the people we serve, but chronic underfunding makes that harder every year. The question before you is not just about dollars, it's about whether Connecticut truly values the people who do this work. If we don't act now, staff retention will worsen, waitlists will grow, and the people who depend on these services will be left with nowhere to turn. Nonprofit workers spend their careers serving this state. It's time for the state to return the favor. I urge you to support SB 1547 with the requested substitute language from the Alliance. Thank Thank you for your time and consideration.
Thank you. Are there any comments or questions? Seeing none, you are
Thank you.
all set, sir. Up next is Reverend Odell. Is Reverend Odell here? No. Up next is EJ Satori. No.
Yes. Hello, thank you for giving me an opportunity to speak on behalf of Niantic Bay Playhouse. I am testifying, I'm providing testimony for SB 1551. We are a nonprofit, 180-seat theater in Niantic. We produce multiple stage productions each year for all ages. Niantic Bay Playhouse was created in a facility that unfortunately went out of business during COVID or after COVID, the old Niantic Cinema. In the last couple of years, the Playhouse has been extremely successful in its adaptive reuse of the space. It's partnered with local schools, other small theaters, and local businesses to get the stage and sets constructed at a great cost, mostly through donations, as well as lighting and set design. However, with rising costs and the constant need for improvements at the building, there's a great need for additional funding. The impact of the Playhouse on the community of Niantic and some of the surrounding communities has been tremendous. Niantic Bay Playhouse's children's productions and summer camps have exposed school-age children, including my son, to the arts. It allows them to instill confidence in themselves, serves as a productive outlet, and forges lifelong relationships. The shows bring thousands of folks into downtown Niantic, which is a huge benefit to the restaurants, bars, and shops downtown. Currently, the Playhouse is not receiving any financial support from the state of Connecticut. As you know, many cultural centers were forced to close during the pandemic and/or had to severely restrict their budgets. We're aware of other playhouses and theaters that are receiving some sort of state funding, and many of these are similar in size and scope to Niantic Bay. So we are humbly requesting that the Niantic Bay Playhouse be included in the state's 2026-27 budget allocation process at an amount of $25,000 per year. This modest amount of funding would be crucial for the Playhouse to continue its mission to serve the community. And I thank you for the time.
Thank you very much. Are there any comments or questions? Seeing none, you're all set.
Thank you.
Up next is Amaris Williams.
Hello.
The floor is yours.
Thank you very much, Senator Austin and esteemed members of the Appropriations Committee. I really appreciate the opportunity to speak with you today about what has become in recent days a really urgent investment in our state's cultural sector through SB 1551. My name is Amaris Williams. I'm the Executive Director of the Connecticut League of Museums. We're the State Museum Association. And in addition to being an in-house community partner of the Public History Program at Central Connecticut State University in New Britain, where we're based, we are also a funded partner of Connecticut Humanities, which means, like many of our members, we receive a good portion of our funds from grants that come through CTH. Museums account for more than half of the 700 plus cultural organizations here in Connecticut. And in addition to relying on grants from CTH and the Office of the Arts, they rely on the federal agencies that support our museums, libraries, and other collecting institutions. As my colleagues Jason and Rufus and Paula have already pointed out, the recent attacks on IMLS, NEH, the Smithsonian, as people have already profoundly expressed earlier in this hearing, are going to be quite devastating for our state's cultural community as well as elsewhere. in this environment, I think investment in the cultural sector through bills like SB 1551 and HB 7176 can truly be a lifeline. And we can decide to step up for what Representative Walker really called the soul of our communities. So while Connecticut is home to nationally known places like the Seaport, Twain House, the Wadsworth, most of our state museums are really those small and mid-sized organizations that anchor and support social life, commerce, and education in every single one of our towns. They're what make Connecticut such a great place to live, to raise a family. Representative Cavros DeGraw asked earlier about the potential impact of NEH's cuts to CT Humanities. And I can speak to this a little bit as someone who really relies on CTH for, to pay our staff and run our programs. One example of something the League has been able to do over the past decade is build and expand a project called Connecticut Collections. This is an open source collections management system and portal to the collections of our state's museum and archives. So on the back end, it provides institutions with a state-of-the-art database that they can use to understand what they have and make it accessible. But it also comes with a public-facing component that aggregates the public collections and archival materials of our 50+ participating institutions and makes them searchable in one place online. So students can find inspiration for History Day projects, researchers can explore archives and artifacts, and museum goers can get ideas for their next day trip. During the pandemic, when museums were closed, Connecticut Collections was a lifeline for museums large and small, helping staff and volunteers do their work remotely and keeping visitors engaged online. CTH funds have helped build, launch, and sustain this system, making it affordable for small museums so that they can share their amazing collections online just like the big guys do. It is projects like this that are going to be imperiled, and meaningful state investment in our cultural sector, like that described in SB 1551, can help support this important digital cultural heritage infrastructure used by our own state's museums. Thank you so much for your support, for the chance to speak, for your empathy with our sector, and I know we'll be able to keep our souls here in Connecticut. Thank you.
Thank you. Are there any comments or questions? Representative Corpus.
Thank you, Madam Chair. Thank you for your testimony. As we sit here today on April 3rd, if we look at the funding of our whole arts community in Connecticut, and there's a line which is coming from the federal government, there's a line which comes from the state, and there's a line which I've learned today is kind of small, that is funded by the private sector. Do you have a sense, what is the whole? Like, as we sit here today, how much do we know we have lost from the federal government, so that when we sit to put pen to paper on our state budgeting process, we know what we're trying to fill in? Do you have a sense of what that number is? Like, what do we tangibly know today is that number?
Yeah, every on the federal side, every federal agency maintains some publicly accessible information. I mean, fingers crossed that'll all stay up. The Institute for Museum and Library Services has a great statewide data explorer where you can drill down on all of the funds that have come from IMLS to Connecticut libraries and museums. The National Endowment for the Humanities, the National Endowment for the Arts, the National Science Foundation, which also does a lot of funding for especially science and technology centers and nature centers, as well as graduate education and things like that. They all have their own places on their websites where you can explore grants by state. I would be pleased to share with the committee links to these resources. You have to kind of aggregate them all. I do have some materials that I prepared for Museums Advocacy Day in DC a couple of months ago that talk a little bit about some of the major grants that have come in the past fiscal year from places like Park Service, IMLS, NEH, and NSF. And I'd be also pleased to share that with the committee.
For you, Madam Chair. I don't mean to put you on the spot in any way, because maybe you just don't have it yet. I know this is all developing in real time, but order of magnitude, I just still don't have a sense of what we're talking about. Like, is the
millions. I mean, the grants are in the millions of dollars. Even just in the past, if I can bring up a document really quickly on my computer, I can probably tell you at least some numbers. Federal grants to Connecticut. So in fiscal year 2024, this is just fiscal year 2024. $2 million in federal grants from IMLS, NEH, NEA, and the National Science Foundation. My colleagues at Connecticut Humanities will be losing $1.5 million if these grants are rescinded as planned. So, and that's one fiscal year. Many of the grants from the federal agencies are multi-year projects. And so there are funds that are hopefully being used here in Connecticut that were granted in previous years. And I don't have those numbers at the tip of my fingers. But again, I would be pleased to share more with the committee if that would be useful. I think that, certainly the ask that my colleagues at Humanities, the Arts Alliance, the Tourism Coalition, and the Retail Association have been putting forth, the $5 million for each for CTH and for the Office of the Arts, would really help address the shortfalls from the federal level.
Through you, Madam Chair, thank you for that. I appreciate that. So, and again, I know that it's unfolding as we speak, but you had mentioned 2 million and 1.5 million. So that's 3.5 million. That's very helpful because all of us care about this issue deeply. And it would just help to know what the concrete shortfall is. Is the whole $100 million or is the whole, and I'm not suggesting it's only 3.5, but of the two numbers you gave me, they add up to 3.5. It's helpful to know exactly what we're dealing with so that we can problem solve around it. And try to make up for it. So the more specifics available as it unfolds, the better. Thank you.
Yes. Thank you for your question.
Thank you. Are there any comments or questions? Seeing none, you're all set. Up next is Suzel. I'm not going to try to say your last name. Here, not here. Not here. Matthew Zabrowski. Matthew Zabrowski here.
Hello. Hi,
The floor
folks.
is
How you
yours,
doing
sir.
So Senator Austin, Representative Walker, and distinguished members of the committee, thank you for doing this today. My name is Matthew Zabrowski. I am a special education teacher of 22 years. I also serve on the Cromwell Board of Education, and I'm here actually to speak in favor of raised bill number 1546, a study on the cost of transporting students. It is my belief that we are very inefficient with how we transport students, and that we need to find a way to bring those costs down. I know that special education transportation issues are, the pricing on those are outrageous and growing. I know that I heard Mr. Feinstein speak about some of those before in his earlier testimony. But I don't think we should be limiting it just to looking at special education transportation costs. I think we really need to take a look at how we're transporting general education students as well. I did provide my written testimony earlier in the week, and I hope you've had a chance to look at it. If not, I encourage you to. But one of the things I point out in it is that one of the side effects or after effects, I guess, of the pandemic conditions were that during the pandemic, when the schools reopened, families largely drove their own students into school and picked them up from school in an effort to maintain social distancing. And now that we're back to normal operations, that has largely continued. To the degree that we are seeing school buses designed to hold around 80 students showing up to schools and dropping off 7, 10, 12 students. It's inefficient. Incredibly inefficient. We could be consolidating some of those. The reason this is happening is because the laws that dictate school transportation or that require districts to provide transportation date back to, from what I can tell, the 60s. And I think we need to perform this study, figure out exactly where we can make some changes, and then consider if we need to update or amend some of those laws to allow families to choose either district provided transportation or their own transportation, so that districts can then actually cut down on the number of buses they're using for the general ed population. As far as the special education population goes, I've been a special education teacher for 22 years. If you don't think my heart is in it for these kids, you'd be very mistaken. So I will tell you though that having been a special education teacher for 22 years, special education as a whole there's a lot of inefficiencies in the way that we do things, including even in the way that we've organized our schools to provide special education services. There's a lot of things we could tighten up there, but specifically we look at transportation. There's some districts, and the district where I represent people in Cromwell is actually fairly good at this. They will work with nearby districts to combine transportation and share costs. That should absolutely be done more. I will tell you that if you look at school budgets and you watch them as the year is progressing, you will see that transportation costs for special ed always exceed what has been budgeted. And that affects every single person in the district. It affects every single taxpayer. And I think, this study is long overdue. We've got to take a close look at this, figure out where inefficiencies are, and figure out where we can make some changes, both to save money and still provide the appropriate transportation and services that we need to. So I welcome any questions you have. I'm guessing if I'm not up on time, I'm about to be. Thanks.
You're all set, sir. Are there any comments or questions? Seeing none, you're all set. Thank you.
Thank you so much, folks. Be well.
Up next is Valerie Williams. Is Valerie Williams here?
Yes, I am here.
Floor is yours.
Good afternoon, Madam Chair and members of the committee. My name is Valerie Williams. I currently work for Connecticut Renaissance. Previously, I worked for Keystone House in Norwalk. And before that, I worked at Fairfield Hills Hospital, a state-run psychiatric hospital in Newtown. I live and I vote in Stratford. Connecticut Renaissance has programs in Norwalk, Stamford, New Haven, Bridgeport, and Waterbury. We have residential substance abuse and behavioral health programs, community reentry programs, outpatient clinics, and support services for youths involved in the criminal justice system. For many of our programs, we can only take referrals from the Connecticut State Department of Corrections. The DOC decides who we will serve. They have guidelines on the staff we can hire and how much we can pay them. We lose staff constantly. Our turnover rates are high. We spend an inordinate amount of time recruiting and hiring staff to have them leave us to go work for other state agency because they get paid more. People that work in Connecticut nonprofits are your neighbors, your friends, and your voters. And your neighbors, your friends, your voters, and you have all benefited from the services that nonprofits provide for all of Connecticut. We need a living wage. We should not have to take time every year to come and beg for a livable wage. In reading Raised Bill 1547, it's to the point. Stop treating nonprofit workers as second-class citizens. Pay us a livable wage. The Raised Bill reads that you pay nonprofit workers the same rates negotiated by CBAC for state employees to do the same jobs. This makes sense at first. However, union negotiations are very complicated and involve so much more than just wages. Please consider the requested substitute language submitted by the Nonprofit Alliance. State funding should reflect what it costs nonprofits to deliver the services and should increase when their costs increase, not only when CBAC negotiates a raise for its members. As nonprofits, we have so many more regulations, reviews, and audits than state programs have, yet we are paid less. We've been paid so poorly for so long, we are crumbling. Other people have testified to the same. We can't recruit staff. We can't retain the staff we have. Our programs are so underfunded. I know so many organizations that are closing programs and clients are going without needed services. Well, they're showing up in emergency rooms. They're becoming homeless, back involved in the criminal justice system. Where I work, they've already closed 2 outpatient clinics and may have to shutter more. It is maddening that it is happening right in front of our eyes. Please stop treating nonprofit workers as second-class citizens. Pay us a livable wage. Give us a contract that covers the costs for the services you want us to provide. Please support Senate Bill 1547, an act concerning funding for nonprofits with the requested substitute language by the Alliance. Thank you for your time and consideration.
Thank you. Representative Belinsky.
Thank you, Madam Chair. This will be very quick. Valerie, I just want to make a comment and thank you. You are truly dedicated to mental health. It is not often that I get to say thank you to somebody who has been in this field ever since, well, that has Fairfield Hills State Hospital on their resume. So I appreciate everything that you do, and we're listening. Thank you very much. Thank you, Madam Chair.
Thank you. Are there any other comments or questions? Seeing none, you are all set. Up next is Christina Quaranta. Christina, are you here? Yeah. Up next is Jennifer Reed. Jennifer Reed.
She hasn't accepted the panelist.
Okay. Jennifer, if you want to come on, you need to accept the panelist upgrade. Thank you. Up next is Frank Ritchie. Frank.
Good afternoon. My name is Frank Ritchie. I serve as a fellow for Yankee Institute. The proposed bill, an act concerning funding for nonprofits, is a ruse for increased union negotiating power at the expense of the taxpayers and is an affront to good governance. Under the act, funding for certain nonprofits would automatically increase whenever state unions negotiate a pay raise. This isn't about ensuring constant funding. It's a scheme to turn nonprofit workers into a sympathetic de facto lobbying group for Connecticut's dominant special interest, the government unions. Funding nonprofits should be based on performance and the genuine needs of the population they serve. This bill would install an arbitrary mechanism that links funding to state employee wages, bypassing considerations for merit and efficiency. This goes against good governance and common sense. There should be zero-based budgeting and rigorous evaluations for each nonprofit's efficiencies and effectiveness. We, the taxpayers, should know if the nonprofits are meeting the community's needs. Under this bill, nonprofits would have a vested interest in supporting higher wages regardless of the state's financial conditions or the actual needs of the programs they administer. It also adds a third party to labor negotiations that have no voice at the bargaining table. The situation resembles a kidnapper's bargain, where the criminal holds hostages to forced concessions from their loved ones. Here, the essential services are the captives, with funding tied to their wage increase. Just as a ransom forces difficult choices, this proposal forces taxpayers to either accept increased government union pay or risk underfunding vital nonprofit services. If our state's nonprofits need more funding, that's an important discussion worth having. But this is the wrong way to produce that outcome. Taxpayers deserve assertions that their money's being spent efficiently and the public good. It shouldn't just be a bargaining chip in a broader political gambit. Rather than using nonprofits to lobby for wage increases for state workers, we should adopt a free market reforms and increase prosperity for the people who need it and support common sense fiscal policies that will keep our state's balance sheet strong and stable. I would also refer you to Jeffrey R. Beckham's, the Secretary of OPMs for the Office of Policy and Management, his testimony that talks about just a 3% raise in 2026 would cost the state an additional $61.7 million. His testimony is a little bit unclear, and this may be duplicated again in 2027. I just don't want to misquote his testimony, but I encourage all the representatives to take a look at that. I'd be happy to answer any questions, and I submitted written testimony as well.
Thank you. No questions. You're all set. Thank you. Hope Chavez. Is Hope here?
Yes, I'm here. Can you hear me okay?
Floor is yours.
Thank you. Hi there, co-chairs Austin and Walker and members of the Appropriations Committee. My name is Hope Chavez. and I'm the Executive Director at the Arts Council of Greater New Haven. And we are a state-designated regional service organization supporting the arts ecosystem of 16 towns across Southern Connecticut. In Greater New Haven alone, there is over 5,000 creative businesses that generate more than $8 million in state tax revenue annually and employ thousands of artists and administrators and craftspeople and cultural workers. But these individuals and institutions don't just enhance our quality of life. They're the bedrock of Connecticut's economy and our stability, especially coming out of the COVID-19 pandemic. You've probably heard a lot today, but I will reiterate that statewide, the arts and culture sector contributes a staggering $13 billion to Connecticut's economy, which makes us the second largest contributor to the state GDP. But Connecticut actually ranks among the lowest in New England in per capita public investment in the arts. That disparity puts our creative economy at risk, and especially in the face of federal funding priorities that are shifting. So I'm here today in support of SB 1551's proposed allocation of the meals and beverage tax revenue to the Connecticut Cultural Fund. This legislative session, I'm very excited that so many bills have been put forward to address the potential gaps in federal funds by allocating state revenue to fund arts and culture. And I've actually had the opportunity to meet with many of you who represent our 16 towns that we serve. And many of you have shared with me the personal connections that you have to the arts and culture community yourselves. So I want to invite you to think about this bill and this need for funding from your own personal perspective. What will it mean to you if the theater that your spouse works for loses their job because that theater's NEA grant is revoked? Today, the NEH terminated their funding for the Connecticut Digital Newspaper Project. So where are you going to learn the histories of Connecticut's communities when our public archives are decimated? Where are you going to take your kids if their favorite music program or summer camp is canceled due to the changing philanthropic priorities away from the arts? This bill is really smart and a strategic investment that recognizes the interconnected nature of our economy. In the most recent American for the Arts study, they told us that for every dollar spent in arts and culture in Connecticut, that generates $7 in local businesses for restaurants and hotels and shops and more. So by passing this bill, you're going to help demonstrate to the residents, the entrepreneurs, and the businesses alike that you understand why people choose to live here, why they create here, and why our cultural economy is essential to the state's future. Thank you so much for your time, and I'm happy to answer any questions you may have.
Thank you. Are there any comments or questions? Representative Corpus.
Thank you so much, Madam Chair, and for your testimony. I wanted to ask a question that I asked a prior witness, and because you have a breadth of responsibility in the Arts Council of Greater New Haven, I'm going to ask it again, which is, we know the kind of arts environment that we live in today, and we at the state level are being asked, and I think it's appropriately so, to fill in a hole that may potentially be left by the federal level. How big do you think that hole is? A prior witness said that she could identify about 3.5 million in total that was being cut out of, from her perspective, out of Connecticut's arts. Do you have any information which would suggest a different number or that number in the work that you do, Ms. Chavez?
That's a really great question. And I'll kind of give you two responses. One is certainly we don't know the breadth of it entirely yet, right? There's still department by department changes at the federal level, and they haven't quite gotten to the NEA and the NEH in full. So unclear how far reaching the impact will be. But a couple of things to highlight for you. In our membership, and so in the region that we serve, we already know of at least 3 organizations that have not been given their NEA funding as they were going to receive it. So they've been stopped. The other thing I want to highlight is that we don't have a statewide philanthropic engine that's specifically geared towards arts and culture. We have, of course, have many foundations and things like that, but our independent artists specifically, and a lot of the arts organizations as well, but especially for independent artists, if you're going to try and get grants and funding, you're most likely going to get that from the Office of the Arts and the Office of Humanities, both of which in some cases receive almost 50% of their budget from either the NEA or the NEH. So if those federal departments go away or significantly decrease their funding or feel that the state is not in alignment with their priorities and we lose that funding, those 2 engines of getting out dollars to the small, mid-sized arts organizations and the independent artists and entrepreneurs will be absolutely devastating. The exact number, I couldn't tell you off the top of my head, but I'm more than happy to submit some written responses to you as well.
Through you, Madam Chair, thank you for that. And so the 3 arts organizations that you know today have received cuts. Any sense order of magnitude of what that amount is? And I say this with absolutely zero agenda other than to figure out
Yeah.
the magnitude of the problem we're solving and the hole that we're trying to fill. So if you
I
have
think
any
that's right.
about those.
Yep. What I can say for those organizations, it would be in the hundreds of thousands. It would be somewhere between $200,000 and $400,000 total across the 3 of them that I'm aware of. And then, yeah, I don't want to misquote the funding at the other State Department levels, but I will absolutely submit some written responses to you because I think that's a really smart question that you're asking.
Thank you. So if we have 3.5 million so far that we've identified from another witness and call it another million here, provided that doesn't overlap with what we've already learned. So far, we could see about a $4.5 million shortfall. So that helps us as we try to put pen to paper in the state to support our arts community. Thank you.
Yeah, absolutely. Thank you.
Thank you. Are there any other comments or questions? Seeing none, we're all set. Up next is Adrian Benjamin. Adrian? The floor is yours.
I'm Adrienne Benjamin from New Britain. I appreciate you all so much. I am aware of how hard you work and how much you care. This is my daughter, Zoe Benjamin. She is a 28-year-old with profound autism. She's nonverbal, needs help with all of her personal hygiene issues. And she, luckily for us, gets support from HARC, residential and day. I'm still a little upset about the speaker for a few minutes ago who called raising wages for nonprofit workers a ruse. I'm going to try to calm down. That was really insulting. I would like him to visit HARC and see what kind of staff, what the staff do to help these severely disabled people. We've heard today of staff, full-time staff living in their cars. And I know most of them, where my daughter goes, have second jobs. So they work till 10 a.m. to 5 p.m., whatever. And then they go to their next job and then they have to be back the next day. I mean, this is wrong. I know you all know it's wrong. And I am sorry that that man doesn't understand. We know there's people like that here and I'm disturbed. I hope that they do come visit group homes at Marrakesh, Park, Oak Hill, Mark, Manchester. We have very severely disabled people that are being taken care of. This wasn't my speech, but it is now. SB 1547 gives me hope that finally, there's a chance to begin to remedy the incredible inequality status suffered by the nonprofit agencies. Unequal in terms of pay and benefits for the direct support professionals who do the very difficult, challenging work that the workers do at the state. And I am not against state employees. I am certainly not against unions. I chose HARC in part because it's a union shop. But for years, the direct support professionals, they're really the human guardrails. I know there's a lot of talk about fiscal guardrails. They are the human guardrails who make sure my daughter doesn't choke because her meat's cut up properly, make sure she doesn't run in the street because she doesn't have safety awareness, and 100 other things they do every day, every hour, rain or shine, snow or no snow. So the consequences of the low pay, of course, you all know, is the staffing shortages. Zoe's lived in her group home for 4 years. There's been at least 25 wonderful staff members who left to get better jobs. There's only one direct support professional who was there when she first started, the wonderful, amazing direct support professional named Lou, who was fabulous with her. And he's the only one left from 4 years ago when she first started. We've been through 5 managers in 4 years. Think of how disruptive it is, not just to the residents, but the staff to have a different boss every 6 months, every whatever. Why do the managers leave? Because they're the ones that have to fill in the shifts when someone's kid gets sick and they can't come into work. So managers are extremely taxed. My daughter's lucky because she does have this placement. I need to remind you that there's 100 people on DDS's emergency residential waiting list. What does emergency mean? We all know what it means. It means it's very, very bad at their family's home. They're in peril. There's also 700 on the urgent list. The urgent list is supposed to be between 1 to 2 years that they can get support. But there's empty beds in group homes. Why? Because there's not enough staff to fill those beds, especially with the severe people. So I'm I'm the chair of the Profound Autism Alliance. I forgot to introduce myself. And we have, since we launched our Profound Autism Alliance this year, we have met so many families that are being rejected again and again by group homes, by day programs, because their kids have the most severe form of autism, which includes ID, behaviors, epilepsy, often epilepsy as well. So I know you've heard the message again and again. It breaks my heart that I have to say, and I also care about mental health, and I also care about homeless. And you know what? I also care about the arts. What in the world are we doing? Thank you. If you have an idea on what I should do to help more, please tell me. I will try to do it. I do have some data for you all that I will try to pass out later. It shows the level of need of people that are served by DDS, and the large column, of course, is the people that are most severe. That is why my daughter has to have a one-on-one. There are people that don't need that. That's fine. That is what she needs because she has no safety awareness and she's very active. And I'm going to stop talking now. Thank you.
Thank you. Are there any comments or questions? No, appreciate, so Representative Dathan.
Thank you very much. Very quickly, can you share those charts and data with our administrator so that she can circulate to the committee?
Yes.
Thank you very much. Thank you, Madam Chair.
Thank you. And we appreciate you sitting here all day too.
Well, it's fascinating. And I know I am so impressed by you all. I say that every year and it's true every year. So-
Actually, we're more impressed with you. No,
You're advocating all the.
Thank
Yeah,
you.
thank you very much. Appreciate it. Up next is Kareem, Dr. Kareem Guman.
Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee, thank you for the opportunity to testify today. My name is Horam Guman, and I'm the current president of the Connecticut State Medical Society. At the outset, we want to acknowledge the leadership of this committee, along with the House and Senate leaders, for your commitment to addressing Connecticut's Medicaid rate crisis. We recognize the significant time and effort invested in this critical issue, and we appreciate your work. House Bill 7254 takes an important and necessary step in implementing the results of the Medicaid rate study. The study confirmed what physicians have long known. Connecticut's Medicaid reimbursement rates are far below those of the neighboring states. As a result, we have seen diminishing physician participation and growing disparities in access to care. This bill seeks to correct that by establishing a process for periodic review and rate adjustments. However, we urge the committee to recognize that the Medicaid rate study did not fully account for all physician specialties and subspecialties. Without a comprehensive approach, some areas of the care may receive needed adjustments while others remain unfunded, exacerbating the existing gaps in access. We cannot afford a piecemeal approach. Every specialty plays a critical role in patient care, and disparities in reimbursements only serve to deepen inequities, particularly in the underserved communities. A holistic, equitable approach is necessary to ensure fair reimbursement across all specialties and protect patient access. We strongly support the establishment of a structured review process, as the lack of regular updates has left many Medicaid rates stagnant for nearly 2 decades. Without a system for periodic adjustments, rates will continue to erode, making it even harder for physicians to sustain Medicaid participation and further limiting access for our most vulnerable patients. That said, we have concerns about the proposal to tie Medicaid rates to the Medicare fee schedule. Medicaid rates have been subject to frequent reductions and uncertainty at the federal level, and not all specialties like pediatrics and OBGYN align with Medicare's structure. If we anchor our rates to an unstable benchmark, we risk reinforcing the very underfunding that we are trying to correct. Instead, we urge consideration of a benchmark tied to the Medicare cost inflation, and which would more accurately reflect the economic realities of providing care. We applaud this committee for recognizing the urgent need to increase Medicaid physician rates. Ensuring access to care requires a comprehensive and sustainable solution, one that fairly raises rate across all physician specialties and ties them to a reliable benchmark with regular updates. We respectfully urge the committee to consider these concerns as this bill moves forward. I want to thank you for your time and your commitment to strengthening Connecticut's healthcare system. Thank you.
Thank you. Are there any comments or questions? Seeing none, you are all set. Up next, Mark Maselli. Is Mark here? We're going to go back to number 48, Jennifer Reed. Jennifer Reed, are you on?
Yes, I am. Good afternoon.
The floor is yours.
Yes. Good afternoon, Senator Austin, Representative Walker, and esteemed members of the Appropriation Committee. I'm here for Bill number SB 1547. Thank you for the opportunity to come back and speak. My name is Jennifer Reed. I'm the Director of Outpatient at Connecticut Renaissance. You heard the majority of our organization's departments and sites from Valerie Williams, but I'm here in representing the outpatient sites. I'm representing how the lack of funding continues to be a core issue. With stagnant reimbursement rate and limited funding for behavioral health services, we have struggled to offer a competitive salary to attract and retain qualified clinicians. I am here as the Director of Outpatient, who once was an accountant, and after a near-death experience, a social worker. A behavioral health center was the one that got me back to working and changing careers to be a social worker and help the people in our community. However, with the staggering rates, our salaries, we are not able to retain clinicians or director, and as a result, we had to close one of our outpatient sites in Waterbury, which has served many, many clients. Without more funding and without more help, we're not able to retain clinicians, and we're not able to serve the clients who desperately need our service. I'm here as a positive representative of the SB 1547 bill. I'm hoping that you will look at the bill and you will help out the clinicians and our outpatient services and all of our mental health and substance abuse service centers, that we may be able to do the job and the work that we greatly love and that's greatly needed. Thank you so much. Are there any questions, please?
Let me see. Are there any comments or questions? Seeing none, you're all set. Thanks for coming on.
Thank you so much.
Up next is John Marie Long or Jean Marie Long. No. Up next is Karen Daly. Karen, the floor is yours.
Thank you. Good afternoon, members of the committee. My name is Karen Daly. I'm the Chief Executive Officer of Optimus Healthcare, a federally qualified health center operating 30 sites throughout Bridgeport, Stratford, Milford, and Stamford. We provide essential medical, dental, behavioral health services to 43,000 patients, 60% of whom rely on Medicaid. Thank you for the opportunity to testify on House Bill 7254. While I have submitted written testimony, I want to underscore the urgent need to rebase Medicaid rates for FQHCs and allocate $80 million to address this issue. The recent Connecticut Medicaid rate study found that Connecticut's reimbursement rates for FQHCs are, on average, 20% lower than those in Maine, New Jersey, and New York. And we've learned 25% lower in Massachusetts and Rhode Island. More concerning is the fact that these rates do not cover our actual costs, as documented in the annual cost reports we file with the Department of Social Services. At Optimus, the gap between the total revenue, Medicaid revenue we receive for providing medical and dental visits and our allowable costs, as set forth in our most recent cost report, is $5 million. This underfunding is unsustainable and has forced us to take drastic measures. For example, we are in the process of closing 4 service sites, and we have permanently closed one of our dental sites. We have reduced operating hours and implemented a hiring freeze. And we are planning additional cuts that will further limit access to care. These reductions will have devastating consequences. Patients will face longer wait times, disruptions in continuity of care, and reduced access to essential health services. Many will turn to emergency departments, where care is significantly more expensive and less effective for long-term health outcomes. Additionally, inadequate Medicaid reimbursement makes it increasingly difficult to recruit and retain clinicians. Unlike hospitals and private practices, we struggle to offer competitive salaries. As a result, our clinician vacancies take, on average, 6 months to fill, leading to wait times of up to 3 months for a physical exam and 2 weeks for acute care. But beyond the patient impact, FQHCs provide significant cost savings to the state. In 2023 alone, Optimist helped Connecticut save $13.2 million by providing care to Medicaid patients at a lower cost. With 17 FQHCs across the state, the total savings multiply dramatically. Ensuring the financial viability of FQHCs is not just the right thing to do, it's fiscally responsible. If Connecticut is truly committed to health equity, it must properly fund FQHCs. I urge the committee to support the $80 million needed this year to rebase Medicaid rates. This investment is essential to preserving and expanding access to quality, affordable care for the communities that need it most. Thank you for your time and consideration.
Thank you very much. Let me see if there's any questions, any comments or questions.
At you.
But
Throttle a phone.
Representative Walker.
Thank you. Thank you for your testimony.
Thank you.
I know I work closely with the 2 in New Haven, and we've been going through this for quite some time.
Right.
And I know that the thing that really bothers me is the fact that we are trying to defer costs from the most expensive delivery of services. So I have not figured out what the benefit is for the administration to ignore that. It's going to jeopardize our communities for a health benefit issue because of the fact that if people don't have medical care, then we will be spreading more problems in communities, and they will translate into all the neighborhoods of Connecticut because there's not a barrier. Everybody can't wear a mask all the time. So I think that we need to raise the voices about this because I know the FQHCs do an amazing job of serving the people. So thank you. And you gave us a number for the number of people, the dollar amount that you think that was saved from their, okay.
Yes.
Okay, all right. And the other question that I would ask is if you could provide us with the number of people that, I know you don't know all of them, but all the patients that are covered between all the FQHCs in the state right now, if we could get the number of patients.
I believe that's 440,000.
440,000.
440,000 patients, yes.
Thank you. Thank you very much.
Thank you very much. Thank you.
Any other comments or questions? Seeing none, you're all set. Oh, I'm sorry. Representative Baker, I apologize. You're all set, sir.
Thank you, Senator Austin. I'm Karen Daly. Thank you for coming in and just sharing the things that are going on and the obstacles that you're having in Bridgeport, where your offices are in my district. So once again, I thank you for coming out and just sharing the information with some of my colleagues. Thank you and have a good day.
Thank you, Representative Baker.
Thank you.
Thank you.
You're all set this time.
Thank you.
Up next is Bree Sanka. Is Bree here?
I am. Good afternoon, Senator Austin,
Representative Walker, and members of the Appropriations Committee. My name is Bree Senka, and I am the Vice President of Behavioral Health at Alara Caring. I'm an RN with over 24 years experience, most of which has been in home health in the state of Connecticut. Alara Caring is the largest provider of behavioral home health services in Connecticut, serving over 5,000 individuals in their homes statewide, over 4,000 of which are Medicaid-funded behavioral health patients with severe and persistent mental illness. We have locations in Middlebury, New Haven, Windsor, Rocky Hill, and Shelton. And our behavioral health population is concentrated primarily in urban neighborhoods with patients in New Haven, Hartford, Bridgeport, and Waterbury. I am here today to comment on House Bill 7254. We support a requirement for regular reporting on implementation, a plan for Medicaid provider rate increases, as well as establishing routine and planful updates to rates. Medicaid home health rates have not been materially updated since 2007, and behavioral health home care providers are further challenged by the fact that the rate for medication administration was cut by 15% in 2016. Unfortunately, the rate study, which serves as a basis for the proposals in the bill, indicated that home health medication administration in Connecticut did not have a comparison state to serve as a benchmark when comparing rates. However, our organization provides this very same service in Massachusetts, and that rate is substantially higher. This session, we urge you to restore the medication administration rate to 2016 levels. And we note that if this is done, Connecticut's rate would still be $10 below Massachusetts. This service is billed as medication administration, but is far more than that. Our nurses specialize in behavioral health, and most of them have years of psychiatric nursing experience. Many of the patients we see come to us with highly acute diagnoses such as schizophrenia, bipolar disorder, split personality disorders, anxiety, depression, and often criminal histories. They are very clearly behavioral health patients. Yet when the state directs funding increases to support behavioral health providers, the service that we provide has never afforded those rate increases. We implore the state to restore the 2016 cut and prioritize this rate when implementing the Medicaid provider rate study. Home health medication administration must be recognized for the behavioral health service that it is, and our patients and nurses deserve your attention. Thank you so much for the opportunity to speak today.
Thank you. Are there any comments or questions? Seeing none. You're all set, Bree. Next is
Thank you. Have a great day.
Amy Vitale.
Hello,
Amy,
good afternoon.
go ahead.
Good afternoon, Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and members of the Appropriations Committee. My name is Amy Vitale. I'm the Chief Clinical Officer at Connecticut Renaissance. We have a variety of contracts throughout our agency providing critical services to the reentry population, individuals involved with court support services, both adult and juvenile, where we focus on the complex needs of each person, including their behavioral, emotional, and social health. Thank you for the opportunity to testify in support of SB 1547, an act concerning funding for nonprofits. I'm grateful for the increase that you have provided over the last few years, but I continue to be stumped at why our sector must come before the Appropriations Committee year after year for hours upon hours, sometimes deep into the late night, to prove our worth in the extensive healthcare system. We provide care to Connecticut residents, your constituents, who not just rely on, but would not be able to lead the same meaningful, productive, and healthy lifestyle that we all deserve to have if it weren't for our programs. I must say that if we could have back the time spent historically and the time reserved to speak before you today, we could spend it fully invested in our work without constant fear of how we will make ends meet, pay our workforce the wages they deserve, and keep them motivated to do this work, the kind of work that requires passion and dedication. Please index funding to state contracts. Include us in the most basic of requests, to have our state-funded contracts receive the annual increases that are built in. There's not enough minutes in a day to devote to our clients. Instead, we attend advocacy meetings, we rally at the Capitol, we meet to discuss and plan our budgets internally, we meet to discuss how to make our ends meet. In my role at the agency, it robs me of being able to fully invest the clinical oversight that I so desperately want to contribute, but instead my time is divided. It doesn't feel good to divide my time from a group of individuals and a workforce who deserve undivided, fully focused, dedicated, and individualized time. If the rates the state pays for our services had increased along with inflation in 2007, as Ben Shaken mentioned earlier, we wouldn't need to be at the legislature every year asking to find hundreds of millions of dollars in the state budget to keep pace. Inflation on the cost of our services since 2007 is 45%. The legislature has only been able to provide increases equal to about 15% the last few years. Please, respectfully, I ask you, make this right. I urge this committee to support SB 1547, an act concerning funding for nonprofits, with the requested substitute language by the Alliance. Thank you.
Thank you. Are there any comments or questions? Seeing none, you're all set.
Thank you.
Up next is Christopher Preuss. Christopher?
Good afternoon, members of the Appropriations Committee. Thank you very much for the opportunity to testify in support of Senate Bill 1547, an act concerning funding for nonprofits. Nonprofits employ about 118,000 employees throughout the state of Connecticut. These vital programs and services take a large burden off the state and act as essentially as a foundation of the safety net for our most vulnerable populations, which are your constituents. Without these services, hospitals and state services would be overrun, the system would collapse, and in all reality, lives would probably be lost. It's extremely important that these nonprofits have funding available to be able to pay employees a livable wage that also keeps up with rising inflation. Inflation on the cost of our services since 2007 is about 45%, but the legislature has only been able to approve increases equal to about 15% over the last few years. You can see that our sector is still very much behind the 8 ball in terms of funding. There's a large disparity between what it costs and what we are able to pay. Compensation for state workers and nonprofit workers is a critical disparity in our system. Each year, we're forced to ask and lobby for an increase in funding just to make up some of the ground that inflation has caused us to lose. I myself have done this over the last 4 years, sometimes till very late at night. Just last few months testified on another bill where I was testifying past 10 o'clock. Indexing an increase to wages for nonprofit workers each year would eliminate this need for us to have to come and basically beg for money every single year and help provide continued increases in compensation in order to provide appropriate wages for our workforce. Many employees must work 2 or 3 jobs just to make ends meet. And if we don't have a workforce, we're unable to provide these critical services. As a senior director, I see staff leaving for better paying opportunities constantly, many of them actually with the state itself. And it also makes it very difficult to hire qualified candidates that can provide services at the levels that our clients really do deserve. So closing the gap on the pay range would be vital to helping maintain our services and the integrity of our services as well. Thank you very much for your time and consideration.
Are there any comments or questions? Seeing none, you're all set.
Thank you.
Up next is Corey Gers. Are you here? There you go. Hi, how are you?
Hi, my name is Corey Gers. I wrote warm welcome from Mystic Aquarium on this rainy and cloudy day. I'm the Chief Operating and Financial Officer at Mystic Aquarium. I'm here to support the bill SB 1551, which underscores the need for increased investment in Connecticut's tourism and cultural infrastructure. I would like to share how Mystic Aquarium significantly contributes to Connecticut's economy, the local workforce, and state's tourism industry. Mystic Aquarium is one of Connecticut's premier tourism attractions, welcoming over 800,000 visitors annually, about 450,000 of which are from out of state. The aquarium directly supports around 300 full-time and part-time employees, offering stable jobs and career opportunities in diverse fields, from animal care to education, research, and hospitality. Beyond employment, Mystic Aquarium generates millions of dollars in direct economic impact each year, benefiting local businesses such as hotels, restaurants, and retail stores. We provide complimentary free admission to EBT cardholders. In 2024, this program benefited over 100,000 individuals, ensuring Connecticut residents who may face economic challenges with opportunity to experience our exhibits and educational programs at no cost. Quality of life, including access to cultural resources, plays a significant role in relocation decisions. Mystic Aquarium enhanced Connecticut's reputation as a destination for family-friendly, educational, and one-of-a-kind experience. The aquarium attracts out-of-state visitors and encouraging them to explore other cultural and recreational sites in the region. Mystic, Connecticut was previously ranked as #4 summer destination by USA Today, largely thanks to the appeal of Mystic Aquarium. However, we are deeply concerned about the proposed budget cuts to our line item in the governor's proposed budget, which could have significant negative impact on our operation. As a nonprofit organization that relies on both ticket sales and state support, any reduction in funding would directly affect our ability to maintain operations, continue our educational programming, and our EBT cardholder program. By investing in tourism infrastructure, Connecticut can ensure it remains a competitive and appealing destination for visitors. Continued support for cultural assets like Mystic Aquarium will drive job creation, economic growth, and solidify the state's standing as a hub for world-class tourism and great place to live. Thank you for your time and your ongoing support.
Anybody have any questions on penguins, seals, or turtles? They don't this time. Last time we had
I do.
questions.
I'm online. This is Senator Summers.
Go ahead, Heather.
Okay, just quickly. I know that you touched on the fact that the aquarium provides free entrance to the EBT cardholders. Could you tell us what that equates to in dollars that you're providing to the residents of Connecticut?
In 2024 alone, it was over 100,000 residents, and the dollar value of that support was over $4 million in 2024 alone.
Okay, and we're at a tipping point where that may be something that would have to be foregone if we can't at least get you up to where you were previously before the governor's cuts. That's what I'm hearing. Is that correct?
That's correct. Unfortunately, we have to, like, we are in the crossroads to make a decision about these kind of services if we will have budget cuts in our line item.
Thank you. And thank you for all that you do for tourism and the community and for the seals and the penguins, as Senator Austin said. Thank you.
Thank you, Senator Summers. I appreciate it.
Thank you. Yeah, Representative Kennedy.
Thank you, Madam Chair. Thank you for being here. I just want to ask a question when you're talking about some of the work to do. I wanted to just say thank you for all you did for Chappie the seal. Unfortunately, he didn't make it. But with these budget cuts that you're talking about, how would that impact the work that you do when you have these type of rescues, and that how would your work be impacted?
Well, unfortunately, while we are the only organization in the state of Connecticut to respond to seal rescue and turtle rescue, we don't have, for the entire state of Connecticut shoreline, we don't have any direct funding just for animal rescue. Therefore, any budget cuts in our line item will greatly impact our ability to provide additional support to programs like as Senator Summers mentioned, to EBT card program, or as you mentioned, to animal rescue program. Like the wait list for rescue requests is tremendous, and the more we can find funding for animal rescue programs, the more animals we can rehabilitate and then release it to wildlife.
And thank you for that. And I was wondering, I don't know if you submitted written testimony, but a rescue of that nature, can you give me an estimated cost of something like that? Because that was fairly extensive.
The care for animal can range differently based on the need, but in average, it is around 10,000 per animal, and for each seal. as I said, we have a long, long list. Just yesterday, we admitted two pups again to an animal rescue program. Right now, I believe we have 7 little pups under our care, and we are attending them, and we hope that they will make it and we can release them to wildlife. And in the environmental committee, we have also a bill this year that we put forward for specific support for animal rescue at the $250,000 level, which is going to be a great support if that will go through.
Thank you. I appreciate it. Thank you, Madam Chair.
Thank you.
Thank you. Senator Hartley.
Thank you, Madam Chair. And just very briefly, and thank you for appearing here before us and also the work that you do. But so I've just recently learned a little bit more about the animal rescue and that you are very, very unique in this sector because quite frankly, we don't have capacity otherwise. But can you talk to us about the turtle rescue? It seems like that is a population that is very, very expansive, and the relationship with deep in terms of the re-entering of the turtles.
Well, for snapping turtles, we are the only institution in state of Connecticut to provide that support. We are always in contact with DEEP in those rescue efforts, but at this point, even the residents, they directly call our hotline to get the support that they need when they see an animal that needs rescuing. And we always keep DEEP informed about our efforts. They are very supportive of it, but there's no financial support that we are receiving from them. And to your point, their population is growing, and that increased the need for the rescue efforts that we have. Currently, I believe we have over 30 in our facility that we are caring for. And it's always a like rolling door that as we get them better, we release them. We got the new ones, and it's a busy time period for us. The biggest challenge with the turtles is sometimes, most of the time, we need to travel south to release them. And right now, for example, we are waiting for the warm weather to release the next batch and trying to find the best location to release them. And as you can imagine, to find usually takes a plane to take them in there. So they go there safely and quickly. To assign a staff, to find a plane, to find a pilot that's volunteered to go there and releasing them in that environment is a lot of coordination and effort.
So is a release of a turtle more expensive than any of the other animals that you are caring for and releasing to their habitat?
Anytime we need to travel south, it is additional cost for us in terms of travel expense for release. Turtles are more expensive. In terms of caring for the animals, seals are definitely much more expensive to care for.
Thank you. Thank
Yes.
you very much, Madam Chair.
You all are staying until the end of the meeting. I'm just letting you know. All of you are staying till the end of the meeting. Representative Ackert.
Thank you, Madam Chair. This will be my last question. I have to step out. I'm kidding. No, after your discussion, we're a small state. I imagine you must get calls from outside of Connecticut, and do you get any resources from other states for the support that you do for maybe those calls?
Great question. As a matter of fact, we support over 1,000 miles of shoreline. That includes the entire Connecticut, entire Rhode Island, and the islands of the New York for seal and turtles. And at this point, we haven't started receiving funding from Rhode Island. As we explain them what kind of support we provide to their shoreline, we start receiving funding from Rhode Island. anywhere from 100,000 a year to $250,000 range. And currently we are at for this year at $250,000 support from them for this calendar year, and we hope to continue those efforts with them. As I explained it earlier, like there's no enough funding for this because the rescue operation is very expensive. It is not just like caring for the animal. We need to have the proper infrastructure for the proper tanks and the life support system, staffing, 24/7 operation. It's not just spending the 10,000 average for the care and medical care of the animal. There are easy 800,000 to $1 million investment required to keep the services going.
Thank you, Madam Chair, and thank you for your answers and your testimony. Appreciate it.
Thank you.
Thank you. Any other comments or questions?
I just have one more comment for the second time with
For
your.
the second time,
Okay.
Senator.
Can
Go
I-
ahead.
I'll be quick. I just wanted to be clear on one thing. It's my understanding you have sea turtles and you have snapping turtles. The sea turtles are what you were talking about, putting on the plane to the warmer water, etc., which is part of the rescue and very expensive. But then we have another problem with the snapping turtles that we can never release because DEEP will not give authorization for them to be released to the wild. So they are permanent residents. And it's like long-term care for snapping turtles and taking up space, resources, and they start small and now they're very big. And that's something that we would like to work with DEEP to see if they can help fund the care of those snapping turtles. So we have the animal rescue that we don't receive any money from the state of Connecticut. We do receive some from Rhode Island, but we do take care of animals all over Connecticut. And then it's very expensive to maintain that. I just wanted to be clear on that. Is that correct? The way I've described it?
Thank you for highlighting the difference between those two, Senator Summers. That's absolutely accurate. And anybody who will promise to care for them next time I come here, I can definitely bring those snapping turtles for the committee members to bring with.
Okay, I just wanted to make sure because I remember on the tour that was something that you guys brought up as another cost, and your mission is to rehab and perhaps release animals, and you are prevented from releasing them back into the wild, so they are permanent residents and taking up space, etc. So I just wanted to clarify that. I thought it was a little confusing on the turtles. I wanted to make sure there was clarity on two different kinds. Thank you.
Thank you for the clarification.
Thank you, Madam Chair.
All right, I'm going to try one more time. Are there any comments or questions about turtles, seals,
Whales?
lobsters, whales? Seeing none, you are all set.
Thank you, Senator Alston, and sorry for taking the extra time.
Up next is Mario D'Aquila. Mario, are you here?
Yes, thank you.
All right, it's your turn now. I don't know if you can beat that one, though.
I'm going to have a hard time with that. That was fantastic, though. I learned a lot. And hello, distinguished members of the Appropriations Committee. My name is Mario D'Aquila. I'm the Chief Operating Officer and co-owner of Assisted Living Services. I also serve as chairman of the DSS Medicaid Committee for HCAOA, Connecticut, as well as a member of the Board of Directors for the Connecticut Association for Healthcare at Home. I am testifying today in support of House Bill 7254 and request that the committee approve it. This bill is essential because it calls for the DSS commissioner to review the Medicaid reimbursement rates to increase and rebase them as deemed necessary to ensure equality amongst providers. These measures will provide policymakers with a clearer understanding of Medicaid reimbursement rates to help ensure fair and appropriate increases to maintain quality of care for seniors in Connecticut. Currently, our agency provides services to well over 400 seniors funded through Medicaid waiver programs, such as the Connecticut Home Care Program for Elders. Our agency also provides homemaking, personal care, live and companion care, and adult family living care foster services to seniors throughout the state. In support of House Bill 7254, we are urgently requesting that beginning June of this year, agency providers should receive a 13% increase in Medicaid reimbursement, and for the next 2 fiscal years, followed by a 10% annual increases in subsequent years, as well as implement a retroactive 4.2% increase effective backdated to January 1st of 2025 to account for the mandated minimum wage hike at the start of the year. These reimbursement rate adjustments will help offset the increases in minimum wage for providers, as well as to address the wage disparity between the unionized independent self-directed PCAs, who were approved for a 26% wage increase last year. Without these adjustments, our agencies and many others may be unable to continue accepting new clients funded by Medicaid waiver programs. Home care agencies play a critical role in caring for seniors at home. Today, we ask for this reimbursement increase so that we can continue to be there when seniors need us most. Thank you for your time and consideration today.
Thank you. Are there any comments or questions? Seeing none, you are all set. Up next is Jim Mahfood, Children's Center.
Hi, good afternoon, Senator Austin, Representative Walker, Senator Sommers, Representative Nuccio, and members of the Appropriations Committee. I'm Jim Mahfood. I'm the CEO of the Children's Center of Hamden. We have a 190-year history of meeting the unique behavioral, educational, and emotional needs of children and families from across the state. And we employ approximately 200 Connecticut residents at any given time throughout the year. I thank you for the opportunity to testify in support of Bill 1547, an act concerning funding for nonprofits. Additionally, I want to make a statement, regarding Bill 7253, an act concerning limits on special education expenditures. Regarding that bill, I just encourage that before any decisions are made regarding special education rates and funding, that a comprehensive study be conducted that looks at all elements impacting special education costs. I think it's good that this is in the forefront and being looked at to try to strengthen our system, but I would hope a real comprehensive study is done before actions are taken. Regarding Bill 1547, I thank you for the increases that the legislature has been able to provide over the last few years for the nonprofits. And while these have been helpful, they have not been enough to meet the needs of the people we serve. We continue to be challenged to keep programs operating as our costs increase at rates that far outpace the increases the legislature has been able to provide. An example regarding that challenge we face is medical insurance. We had a 20% increase in a single year alone, which equates to approximately $700,000 more than the previous year's costs just for medical insurance. We've been told by our broker to expect at least 10% increases each year, at least to be prepared to pay that much. We also now are being told our liability insurance costs are going to increase due to some of the challenges in providing the care for the individuals we provide services for. On the staffing side, many of our incredible, caring, compassionate staff are deciding to leave their service to children in the nonprofit sector, to take jobs that for them might be less rewarding, but allow them to provide for themselves and their family. Earlier today, I heard, I believe it was a COO from another agency testify that he has staff earning approximately $18 an hour, and he has staff that also, unfortunately, sadly, tragically, have to live out of their cars. Here at the center, approximately 35% of our workforce earns close to $18 an hour. And these are staff that are expected to work directly with our clients 24 hours a day, 7 days a week. They're expected to understand the complexities of the children's mental health issues that they're helping, engage them in positive social interactions, and keep them safe around the clock. It's a lot to ask for $18 an hour. Indexing would certainly help us be able to build in COLAs and help move them on a pathway for themselves and their family. If the rates that the state pays for our services had increased along with inflation since 2007, we wouldn't need to come before you every year asking to find hundreds of millions of dollars to try to keep pace with inflation. So since 2007, 45, I think it's been the cost of our services have increased 45%. we just really encourage you to help find a way to have indexing hit our contracts. I urge the committee to support Bill 1547, an act concerning funding for nonprofits with the requested substitute language by the Alliance. And I thank you all for your time.
Thank you. Any comments or questions? Seeing none? You're all set.
Thank you.
Up next is Robert Krett. Robert,
Thank you.
floor is yours.
Good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee.
Hey, what number are you?
He's number 62. Thank you. You are 61. Go ahead.
My name is Robert Krett. I'm the CEO and Executive Director of the Connecticut Museum of Cultural History, and I'm here today to speak in favor of SB 1551, which would allocate additional culture and tourism. The Connecticut Museum is a private nonprofit organization.
Can you hear us? We can't hear you.
I'm sorry, my screen just went blank. If you can hear me,
Yep,
I'll
we can hear you.
continue.
Continue.
All right, I'm sorry. Connecticut Museum is a private nonprofit organization established in 1820, our 200th anniversary, and is one of the state's premier historical societies and cultural institutions. We're located in the historic West End of Hartford, and the museum houses exhibitions, a library, a research center, and a vast collection that includes more than 4 million manuscripts, graphics, objects, and artifacts. The arts and culture sector in Connecticut includes some of the state's most significant world-class organizations that are committed to creating meaningful and relevant experiences to explore cultural diversity and strive to define our identity. Working together with the tourism industry, we can make a significant difference in the state's economy. The beauty of that of the circumstances in Connecticut is that the infrastructure is already in place.
Can you hear us, Robert?
I'm sorry, now I can. The problem is that there's not enough people that know about these hidden cultural gems across our state. Additional funding will help jumpstart a dormant industry in Connecticut and create an environment where the rising tide of cultural tourists, which is the highest per capita spending tourist, lifts all boats. One of the most effective ways the state can invest in this sector is through increased funding for the Connecticut Humanities. This organization provides support to cultural organizations and accountability on behalf of Connecticut residents. During the COVID era, in partnership with the DECD, Connecticut Humanities successfully administered over $60 million in state grants to support cultural investment through a variety of programs. The Connecticut Museum was pleased to receive some of this funding and saw a significant positive impact to our programming and participation. The positive impact of cultural tourism can be seen across the globe, and I offer two brief examples. Pittsburgh, Pennsylvania saw 400,000 international visitors prior to the pandemic, with the greatest number from the United Kingdom, Germany, and China. These international visitors primarily seek culture and nature attractions, which are abundant in Connecticut. Also before the pandemic, the Corning Museum of Glass in upstate New York, far from any significant population center, welcomed over 200,000 international visitors because of years of meaningful investments in marketing. All of this benefiting restaurants, hotels, and retail stores. One lesson learned from these examples is that cultural tourism generates significant revenue for our communities and states, but it needs to be sustained and nurtured. Finally, if you support this additional funding, you are also supporting education. Every art and cultural organization have education as a fundamental component of its mission. Thank you for your time and attention.
Thank you. Any comments or questions? Seeing none, you're all set. Lisa Scales?
Good afternoon, Senator Austin, Representative Walker, and the esteemed members of the Appropriations Committee.
I want to thank you, first of all, for your service. I've been on this call since 10 o'clock, so I can appreciate all of the work that you do, and I know this is just a small part of it. My name is Lisa Scales, and I was born and raised in Danbury, Connecticut, a former resident of Bethel, Connecticut for 25 plus years, raising my family, and I currently reside back in Danbury. I am also the executive director of the Cultural Alliance of Western Connecticut. We are a regional arts organization based in Danbury, which was recently cited as being among the top 10 cities in the country for our diversity, which we're quite proud of. For the past 18 years, I have had the privilege of advocating for arts and culture in the greater Danbury area, and that includes some of the wonderful surrounding towns of Bethel, Brookfield, New Milford, Newtown, Reading, and Ridgefield. My passion for this work comes from a deep belief in the transformative power of creativity to enrich lives, to bridge divisions, to develop minds, to soothe souls, to heal bodies, and to strengthen our communities. I'm grateful for the opportunity today to support SB 1551 and the need for increased investment in statewide arts, culture, and tourism infrastructure. My colleagues before me shared the urgent need given the current climate on the federal level. Already a crisis for many, and it's on track to get worse. I just received an alert from Americans for the Arts, and we are all deeply concerned by the current administration's efforts to politicize and reduce essential federal support for the arts. Our creative economy is a powerhouse in terms of our impact for people, communities, and the economy, and I do believe that all of you on the committee understand that. The words of Representative Walker touched me. She believes and has stated that arts and culture is our soul, and our soul is being ripped apart. If we lose that, we lose who we are, and we just have to figure out a better way. We are and will continue to be a guiding light, especially in dark times. I believe that now is the time to double down. Our job is to reach as many people as we can to integrate arts and culture in our cities and our towns. And we're asking you to invest in arts and culture so we can continue to do just that. Recently, the Cultural Alliance hosted a Meet the Moment gathering with arts and cultural leaders in our region. We had an opportunity for creative leaders to come together to get guidance and to discuss the pressing conversation about who they're allowed to serve, changes on the federal level, and what a brighter future looks like for arts and culture. Increasing support for arts and culture is an essential step towards that brighter future and for building resiliency for the state of Connecticut for arts, culture, and tourism as a sector. I want to thank you all for your time and for considering this important investment in our shared future. And if you have any questions.
Thank you. Are there any comments or questions? Seeing none, thank you so much. Up next is Evilise Correa. Evilise. Up next is Nick Foster. Is Nick Foster here? Floor is yours, sir.
Thank you, Senator Austin, to the esteemed members of the Appropriations Committee. My name is Nick Foster. I'm the director of the Wilton Historical Society and Museum in Wilton, Connecticut, as well as the president of the Board of Trustees of the Connecticut League of Museums, and I'm a resident of Wilton. Thank you for the opportunity to testify today. I'm speaking today in support of SB number 1551 with respect to the need for increased investment in statewide arts, culture, and tourism infrastructure, specifically to Connecticut Humanities, the CT Office of the Arts, and to the CT Office of Tourism. Arts and culture institutions like mine are vital parts of our communities, not only as mission-driven organizations that support and educate our audiences, but as businesses that employ residents and impact our local economy. In 2023, my museum was fortunate enough to receive 2 grants from Connecticut Humanities, one for a new exhibition and another to subsidize free visitation for children during the summer. Both gifts totaled just over $10,000, and it completely transformed both the museum as well as parts of the community for several months. First, much of that funding immediately went back to local businesses, with paint, tools, and supplies purchased from our local hardware store, crafting materials from the art store down the street, graphics from our print shop in Bridgeport, and an ad purchase in a local news outlet, which helps support local journalism. These dollars were not just an investment in us, but it was also direct investment in local small businesses. By making the museum and that new exhibition free and accessible, we saw a 67% increase in visitation compared to our pre-pandemic numbers, with visitors not only from Wilton, but all across Connecticut, as well as New York State. This doesn't include the high school classes who were able to join us for day-long field trips to engage with the exhibition, which was focused on historical examples of civic engagement, infrastructure development, and community activism. This funding is more necessary than ever, given the cuts and the uncertainty at the federal level, with the Institute of Museum and Library Sciences recently dismantled, and the cuts at the National Endowment for the Arts and Humanities happening as we speak. We just did a determination that those cuts for the state and regular funding is somewhere between $9 and $10 million. That does not include the competitive grants that organizations across the states can apply for, which vary from year to year, but equal probably a similar amount of that $9 to $10 million. This also has an impact on private philanthropic funds as the pool of funding shrinks. Museums and other cultural organizations have to reach out for private funders, and the competition greatly diminishes our capability to spread that money around equally. Investment at the state level is basically the only real safeguard we'll have as these cuts come in. As the president of the Connecticut League, I can say that the impact of this funding is undeniable. I've seen organizations big and small make their community more vibrant places and places that people want to live and work. I'm proud to be a Connecticut native who's been able to stay close to home, to live and work here, making an impact in a field that I and so many others care about deeply. I strongly urge you to support Bill number 1551 so that our state's museums can continue to flourish with the support of CT Humanities, CT Office of the Arts, and CT Office of Tourism. Thank you.
Thank you. Are there any comments or questions? Seeing none, you're all set. Up next is Scott Dolch. Scott here? Pamela Fields. The floor is yours. There you go.
It's on now. Okay.
There
It
you
was
go.
red, so I thought it was off. Good morning, everybody. And my name is Pam Fields. I'm the CEO of Midstate ARC and our new company, Living Without Limits. At Midstate ARC, we provide a full scope of supports for people with intellectual disabilities. And at Living Without Limits, we provide assistive technologies to support people to gain their independence or remain independent and become less reliant on 24-hour care facilities. We also have a Meals on Wheels program. I want to thank you for the opportunity to testify in support of Senate Bill 1547. And since we are a human service agency, our biggest costs are salaries. The pool of applicants for these positions is finite. And every human service agency, including group homes, long-term care facilities, and hospitals, along with retail businesses such as Walmart and Amazon, are all in competition to attract these same employees. The difference is that human service agencies do not have products they can inflate to cover the rising costs. They only have services they provide to people that are funded at fixed rates set by the state. The skills that these staff must gain to work in our field are complex tasks. And while completing them, the staff must know each individual's need and diagnosis in order to interact with them in a way that promotes positive outcomes. That's a lot to learn, a lot to maintain, and a lot to do. When appropriate wages are not maintained and staff can flip a burger for more money than they receive to provide care for Connecticut's most vulnerable citizens, guess where they go? We need wages to keep up with inflation so that people want to work in this field. And while working in this field, they can earn a livable wage. It's important to note any one of us can end up in a situation where we are reliant on others for care. If we do end up in that situation, we want someone to be there. And we want someone who has the skills and abilities to offer us the care we need. Each year when I come to Hartford to talk about staffing and wages, I remind everyone that there are not enough people born in the world today to provide the care needs for the future. This is a crisis, and we not only need to attract people to work in this field, but we also need to be innovative to help change the system to address the future needs of people we support. Nonprofits are innovative. We have provided new ways of support that are less reliant on 24-hour care and promote a higher quality of life. Please help us to continue to help the state meet the needs of our most vulnerable populations.
Thank you. Are there any comments or questions? Just want to say I love that where you say there's not enough people born that can take care of the future. I think that that's really interesting.
Thank you.
Thank you. Up next is Scott Langner. Go ahead. We can't hear you, Scott. Mr. Langner.
Good morning, everyone. I would like to thank the members of the Appropriations Committee for hearing my testimony. My name is Scott Laner. Horizons is still struggling of what year to start a fundraiser on the new gymnasium called the Arts and Wellness Center. In order for Horizons to start planning a fundraiser of the new gymnasium, the House of Democrats from the legislative office building in Hartford, with legislators, representatives, senators, Congressman Joe Courtney, and Governor Ned Lamont, need to start writing checks and sending them to Horizons in South Windham, Connecticut to get approved. This is the only way for Horizons to have a new gymnasium on display with features on the insides like portable air conditioners to keep the new gymnasium air conditioned so it's not too hot during evening activities and other things every year in the summer from June until August. Lots of banks in Connecticut don't have enough money, like the Credit Union in Stores, Connecticut, Berkshire Bank, Charter Oak Credit Union, Rockville Bank, Bank of America, and many other banks in Connecticut, since the budget is still too full. We need to find a way of how Horizons can receive lots of checks since it's not making any progress, or for that matter, a big success. Any questions?
I don't think so. You did a great job. Thank you, Scott. Appreciate it. Up next is Michael McGuire.
Oh, and
Thank
I
you.
forgot, I support Bill 15147 for nonprofits such as Horizons. I forgot I left out that part.
Oh, that's okay. Thank you, Scott. Appreciate it. Up next is Michael McGuire, number 69.
Thank you. Senator Austin, Representative Walker, and the members of the Appropriation Committee. My name is Mike McGuire. I am the Director of School Support for Domus Kids, an organization founded in 1972. Our work began as a group home for abused and/or neglected boys and has since grown to an agency that serves thousands of disconnected and disengaged youth aged 12 to 26 through a variety of sources. Our relational model, in combination with our program model, is designed to help young people make positive changes and, in effect, change their life trajectory. My primary responsibility with Domus is the oversight of our educational services, and specifically I manage the Hartford Juvenile Detention Center and the summer enrichment programs at both Hartford Juvenile Detention Center and Bridgeport Juvenile Detention Centers. I've also served as principal at our charter middle school and high schools, and was the principal at our cooperative with New Haven Public Schools a few years ago. And then lastly, I've served on Senator Walker's JPOC, the Juvenile Justice Policy Oversight Committee. I'm here today to express my strong support for Bill 7252. I'm hopeful that this bill will continue to foster the growing public and private partnership with agencies like Domus that stand ready and flexible to assist. Our programs have proven track records of success with disconnected young people. We're shovel ready and we can serve more people immediately, obviously with more funding. We believe that we are more efficient, flexible, and less expensive than other state solutions. And our collaborative would love to work with legislators to support the disconnected youth in any way we can. I think we've all seen the reports on disconnected and disengaged youth. We all have the data. What we now need is action provided by organizations like Domus, who have been and continue to be committed to helping young people. In short, it's simply all that we do. Thank you for your time, and I appreciate all of you, especially you legislators. And I've been on since 10 o'clock this morning as well, and I'm proud to be a citizen in the state of Connecticut, and most especially with good folks like you who have to make really difficult decisions. I mean, I thought all of the advocates this morning and this afternoon were pretty compelling, and I honestly don't know how you guys do it. I really don't. So thank you for your work. I
Thank you
appreciate it.
so much. Appreciate it. Are there any comments or questions? Seeing none, we're going to go back to number 66, Scott Dolch. Scott?
Hi, Senator. Can you guys hear me okay?
Yep, we can.
Hi, guys. First and foremost, I apologize. I'm pushing back. I'm actually down here in Senator Chris Murphy's office. Just got done a meeting down here with about 9 of our restaurant members. So he does say hi to everybody. But just here today, Scott Dolch, President and CEO of the Connecticut Restaurant Association. I appreciate the opportunity to come in and show my support for Senate Bill 1551, an act concerning the Department of Economic and Community Development's spending of arts and humanities, tourism, culture. I know the full list of the bill doesn't say that, but I commend this committee for bringing the bill forward, as we believe investing in the hospitality industry is critical to the future success of our state. Every $1 invested in the sector yields an $8 return. The CRA, we are proposing, obviously we could talk about pieces of this and everything else, but we're proposing the committee consider using the full 1% meals and beverage tax to create a Connecticut hospitality fund. This fund would direct those resources back to the state for tourism, arts, culture, hospitality, workforce development, and municipalities. Over the last few months, we have been up at the Capitol talking specifically about the meals and beverage tax, this 1% tax that started in 2019. Just so everyone is clear, that has gone to the general fund. That is the 6.35% our sales tax. If you go to a restaurant, it's 7.35. Since 2019, that 1% has generated over $415 million back to the state. Just last year alone, $107 million. The specific ask that we had from the CRA with this hospitality fund is to use a 50% of that 1% back to the towns that generated it, 30% to tourism. Can talk about the arts, culture, humanities as well, and what that number looks like, and then obviously a portion, 20%, about the workforce development side of making sure hospitality employees, where we have about 150,000 in our state, we're the second largest private sector workforce in the state. We're continuing to drive that. So it's a common sense approach in supporting state tourism, arts, humanity, culture, local economies, small businesses as a whole. We hope everyone on this appropriation committee, but all legislators and even the governor, look to support this initiative. We look forward to collaborating and even more. I appreciate you guys bringing continued attention to the hospitality sector and how much it means. I've listened at least a little bit today to others that have testified, but I appreciate you guys giving me some time, and I'm happy to answer any specific questions that you guys might have.
Thank you, Mr. Dilch. Any questions?
Where did you see Senator Chris Murphy this morning in this building? Where did you see him?
I'm actually in DC right now. So I am in his office in a conference room. So I just had a meeting with him. I'm down here for the restaurant industry, just talking to all. I actually have a meeting with Senator Blumenthal in about 5 minutes as well. So.
Oh, I thought you were. I thought you were with the other senator, but before Senator Blumenthal, since that's Chris Murphy. I thought you were with him first before you met Blumenthal in DC.
I was just with Senator Murphy and his chief of staff and team, and then I'm our next meeting will be with Senator Blumenthal here in just a little bit, just talking about the state of the restaurant industry and continue to make sure that our federal delegates understand how important hospitality is down here as well.
Thank you. I just have to share with everyone, questions are for legislators. So everybody else has to refrain from asking questions to the speakers. But that was a good question. So thank you very much. Our next speaker is going to be Thomas Fiorentino from ARC-CT.
Thank you, Representative Nolan, and members of the committee for this opportunity. I'm Tom Fiorentino, a member of the ARC Connecticut Board of Directors and a parent of an adult child with an intellectual disability who receives services from FAVAR. I support Senate Bill 1547 as I believe it's a recognition and an attempt to correct the damage inflicted on the nonprofit provider system by the state that once it outsourced these services, it almost immediately began to underfund it. So I truly appreciate this attempt to bring back some funding, hopefully, to the sector. You've heard from people like Pam Fields today on the effect of the what heretofore has been on them, and I'm not going to try and duplicate that. Instead of looking at things from a macro point of view, I wanted to share with you a personal story that I hope puts a personal face on this. A few weeks ago, I got a call from a staffer who works for FAVAR, who works with my son in his supported living in Bloomfield. And she said, hey, Mr. Fiorentino, your son and this other young woman in the program sort of indicated to me that they would maybe like to go out on a date. And my reaction as a longtime advocate and someone who views himself as progressive on this was, really? Really? She then proceeded to engage both sets of parents, kind of a shuttle diplomacy, reassuring us that our son would be fine, that he really wants to do it, calling the other set of parents and saying, your daughter will be fine, talking to her bosses, and ultimately arranging this date. And as she said, this is something they shouldn't miss out on just because they have disabilities. And eventually it happened, the date at Applebee's, and it might not seem significant to a lot of us, but for my son, his first date at age 34 is something he'll never forget, and it never would have happened but for the efforts of his staff person. I'm having a hard time conveying to you how important it is for my wife and me to have someone like that working with my son, someone who recognizes that he's more than a disability, that he and the other people she works with have the same capacity for, same desire, the same need for joy, for excitement, for affection as anyone else. And by the way, when I repeatedly offered to pay for her meal at the restaurant, she repeatedly refused. And I want to just quote from her text to me. It's fine. Don't worry about it. Just watching them was payment enough. Being able to experience it all with them made my day. She, like many others, works 2 jobs. And she's actively looking for a different job that will pay her enough so she can actually have some time with her family. So many dedicated workers are in that position. Senate Bill 1547 is a step to ensuring that we don't lose people like this. And I urge you to support it. Thank you.
Thank you, sir. Appreciate you coming before us. Any questions or comments? No? Our next speaker will be Dr. Guzzi, Dr. John Guzzi, Connecticut State Society of Anesthesiologists. No? All right. Our next speaker, number 72, Jennifer from SCAD.
And you don't have to say my last name because I know you know how to say it. I'm just, I'm bringing along a meeting here with me so they could listen. Good evening, oh, sorry, it's not evening yet. I'm sorry, good afternoon. Representative Nolan, acting chair, and all of our friendly members, especially Representative DiCaprio and Representative Nolan are such good friends to SCAD. I appreciate you. I'm Jennifer Chidukowicz, Chief Strategy Officer at SCAD, where we serve 5,000 individuals a year from throughout the state and employ 240 residents of Eastern Connecticut. I'm also a woman in long-term recovery. Thank you for the opportunity to testify in support of Senate Bill 1547, an act concerning funding for nonprofits. I'm grateful for the increases the legislature has been able to provide over the last few years, but it just hasn't been enough. And you've heard lots of my colleagues and friends and neighbors testify here today on a lot of the different reasons why. I'm going to focus on a different one. We're going to talk about eggs. Throughout our full continuum, we feed approximately 160 individuals, as of today, 3 meals a day plus snacks. So snacks at our Lebanon Pines facility for 110 men. I just want you to think about that, okay? Our flagship property, the Lebanon Pines campus, where some of you have even been there, has 110 clients and 40 staff at any given time. And some of you have seen the pristine, well-tended, world-famous chicken coop at Lebanon Pines. 2 of you might have even been in it. I'm not going to call you out. This long-standing tradition and the most coveted job by the clients is a highlight of our guest tours. The first question everyone asks, what is it? Can you eat the eggs? No, we cannot eat the eggs that our 24 chickens lay every single day because there's a conflict between our DEMIS license and DPH licensure. So I'm working on it, but if any of you want to weigh in on that in the back rooms, I'm glad to let that happen. But can you guess what we paid for eggs at Lebanon Pines in March? Anybody? Quick guess. $3,640.80 for eggs for the month of March. Guess what we paid for food all together throughout the entire continuum in March? $127,000. Our food costs for the fiscal year to date, 9 months, $866,404. If the rates that the state pays for our service had increased since 2007, we wouldn't need to be here every week, month, and year asking for an indexed increase. We also have capital improvements. We have flooding at the Lebanon Pines campus. We have bounty hunters, unruly bounty hunters that roll up on our property that we have to be responsive to. And our wages and benefits are also our highest cost. Food is right behind it. I hate to sound like a broken record, and I want to heed Representative Walker's caution. I have 1 paragraph left, but we're not fully staffed. Recruitment is difficult in Eastern Connecticut, and keeping in mind the commute, being able to offer a competitive wage would help bridge the gap for most applicants when it comes to compensation. Our biggest competitor for licensed clinical staff is the state of Connecticut. We can't even come close to what they're offering for an entry-level behavioral health person, never mind a licensed one. And we don't even come close to the benefit package, so we're not going to talk about it. I urge this committee to support Senate Bill 1547, an act concerning funding for nonprofits with the requested substitute language by the Alliance. Thank you for your time and consideration. I'm glad to answer any questions.
Thank you for coming before us. I think it was the shoes I wore that day when I got chased by the chicken.
Yes.
So I'm just saying that.
They're a little aggressive.
They are a little. Yep. And the facility is, as you said, it's beautiful. You do wonderful work there, and
Thank you.
it is so appreciated. Not only there, but in London with SCAD there. Work is just amazing.
Thank you.
Appreciate it. Any questions? Yes, sir.
Thank you, Mr. Chair. Just a comment. It's good to see you, Jennifer.
Good to see you,
Thank you for the
Representative.
kind
Thank you.
words, and thank you for all that you do there for those individuals.
Thank you so much.
Thank you very much.
Listen, they're our sons and daughters and fathers and uncles and sisters and cousins. So yes, we'll keep doing the good work. Thank you.
Yes, sir.
Thank you, Mr. Chair, and thank you for your testimony. You've run a large-scale operation. It's impressive, and
you.
thank you for the work that you do. In terms of this bill, did you say you approve this, the substitute language, that is, rather than benchmarking nonprofit salaries to state employee salaries, you think an inflationary adjustment would be more suitable in this?
We
one?
think it's more appropriate, and here's why. While we love the idea of being included in this in an increase that's tied to the state employee increases, wage increases, that puts us at risk. And I hate to be this plain about it, but for an individual or two who are negotiating on behalf of a union, that kind of inflamed relationship or negotiation, to tie that to the work that we do, and eggs and laundry detergent and the electricity and all of that, it's just a little precarious. Our expenses in a residential program are directly tied to the cost of living increase. So I want to say both, and let's do both, right? We'd love to be able to pay the same amount of wages that the state of Connecticut is paying. And listen, I have some of my best friends work in the behavioral health programs at the state of Connecticut. They deserve every penny that they make. Absolutely. Because they can get mandated, right? So I kind of understand some of that, but so can we. And we're not able to pay those same wages. So we'd like to do that. And we'd like to have cost of living increase. Thank you.
Anyone else? Thank you again for coming before us. Let us
Thank
know how
you.
we can help you work on those eggs.
Yes.
Uh,
Hey, I have an idea, so I might be in touch.
All
Okay.
right.
All right. Thanks, everyone.
Thank you. Number 73, Chris McNabo online.
Yes, yes, thank you very much. I'm a little bit impaired, so I'm going to keep my camera off today. But I felt it was important to my testimony. You've got my written testimony. I've submitted it, and I only want to say that we are definitely in support of this bill. I'm the CEO and founder of Horizons, one of the nonprofit agency providing essential services to folks with developmental disabilities throughout Connecticut through contracts with DDS. We're in our 45th year, and we support over 1,600 people with developmental disabilities statewide. We employ 247 year-round staff and an additional 130 seasonal staff. And the most important part of what I want to say is, most of you have already heard this in my previous testimony for other bills this year, but we're working under 4 huge problems: chronic underfunding, which you've heard about today, a loss of ARPA support, stagnant Medicaid rates, which you've also heard about today, and the ongoing acute staffing shortage. Inflation on the cost of our services since 2017 is 45%. And the legislature has only been able to provide increases of about 15% in the last few years. Our staff cannot work remotely. You cannot take someone to a medical appointment, support their challenging behavior, cook dinner with them, or help them shower remotely. We need our staff. You've heard about that several times already today. We have had to close some of our services. We no longer provide 5 days a week to some of our folks, and we just don't have the staff. The private sector provides 92% of community-based services for people with IDD that used to be provided by the state. We urge this committee to support the indexing bill. Thank you very much.
Thank you, Chris. I appreciate you hanging in there and coming in to speak with us today. Any questions?
Thank you, Representative Nolan.
Next speaker is number 74, Suzanne Lagarde from Fairhaven Community Healthcare.
Good afternoon, members of the Appropriations Committee. My name is Dr. Suzanne Lagarde. I'm the CEO at Fairhaven Community Healthcare in New Haven. I'm testifying today in support of HB 7254, an act concerning DSS's implementation of changes resulting from the Medicaid rate study. Fairhaven Community Healthcare currently serves over 36,000 patients annually, providing full scope primary care services, including nurse midwifery, behavioral health, addiction services, dental, and integrated care coordination. While I wholeheartedly support this bill, I am urging you to consider some changes to the language. Most notably, the timelines need to change. As currently written, the bill calls for the first report by the Commission of DSS no later than July 1, 2027. I'm here to say today that Medicaid providers are struggling now with rates that are draconian by any standard. The state-sponsored Medicaid rate study demonstrated that despite being one of the wealthiest states in the country, Connecticut pays its Medicaid providers amongst the lowest rates in the nation. Changes to reimbursement are required now, with a report to follow in 1 year, not 2. Most importantly, we all know that federal cuts to Medicaid are imminent. We've been told that this is coming. We have no reason to doubt this. And in fact, DSS, in collaboration with the Tobin Center for Economic Policy at Yale University, has calculated the potential fiscal impacts that may soon befall our state. According to economists at the Tobin Center, anticipated changes, which are felt to be the most likely, such as elimination of the floor of the FMAP, which would decrease Connecticut's federal reimbursement from 50% to 25.8%. That's one of them. Together with cuts or even abolition of the Affordable Care Act. Remember, the Affordable Care Act is not a nice word in Washington, D.C. these days. So any cuts to that, which is what we refer to as expanded Medicaid or Husky-D, the total of those two sums could result in cuts of over $3 billion, that's with a B, to Medicaid revenue to the state of Connecticut. The impact would be devastating, with obviously the state could not make up that huge gap. And an estimate, and this is Tobin Center analysis, an estimate of up to 30 to 40% of current Medicaid recipients losing coverage. For Fairhaven Community Healthcare, that translates to 7,000 to 10,000 patients who could lose coverage. Let me be clear, we will never abandon these patients. We would continue to care for them to the best of our ability, despite this lack of significant revenue. We know that Connecticut has the funds to make Medicaid providers whole, i.e. cover approximately $74 million, which would cover all the cost. It would keep the health centers whole. It's of the utmost importance that the state implement these changes that we now are in now. So when we see this tsunami of changes coming out of Washington, we are prepared in a better position to handle them. While not a guarantee to be sufficient to withstand the tsunami we're facing, it will at a minimum give health centers like mine the ammunition needed to keep caring for all patients, regardless of what comes out of DC. In conclusion, HB 7254 is a good start, but we need more. We need meaningful rate increases, and we need them now. Thank you for your time.
Thank you, Dr. Lagarde. Any questions? Yes.
Thank you, Mr. Chairman. Thank you for your testimony. And I really appreciate that you cited the Tobin Center as a means of quantifying this for us. Do you have any sense from where you sit when your center specifically will be affected?
Never mind.
Is this a pre-federal budget thing? What is the timeline of all of this coming so we can plan our Connecticut budget accordingly?
I ask this question all the time. As many of you know, the continuing resolution was passed, and now the question is whether they will go to reconciliation. So in the continuing resolution, there was $880 billion that was to be cut from the Energy and Commerce Department, which has oversight of both Medicaid and Medicare. That $880 billion is to be cut over the next 10 years. Even though everybody has all these guesses, There is no way Energy and Commerce can cut $880 billion without significantly impacting Medicaid, current Medicaid reimbursement. What I'm talking about is largely speculation, but people who are in the know, who are watching this every day, who understand the intricacies of Washington, D.C. and the regulatory language behind Medicaid far better than I, feel that several, and this is, and I'd love for you to see, and I will submit what we were presented at MAPOC from the Tobin Center. The three biggest areas that they're seeing are cutting the floor, removing the floor of what they call the FMAP, which is the federal match. So the federal match is based on a calculation that's based on the per capita income of the state. There are 10 states that, but Congress also passed a law that said it'll never go below 50%. There are 10 states that are at 50%. Connecticut is one of them. Not surprisingly, we have one of the higher per capita incomes. If they remove that floor, we would drop from 50% to 25.8%. And oh, by the way, the 10 states that are at that floor, 9 of them are blue states. 1 of them is red. So there's a lot of belief that that is one area that will have a lot of attention in Washington. The other one is, as I mentioned in my testimony, the Husky D, which is what we all refer to as Medicaid expansion. Again, that's Obamacare. That's the Affordable Care Act. Those are not terms that the current administration is very favorable to. In addition, that expansion is 90%. The FMAP for that is 90%. Connecticut alone receives nearly $1 billion just for that segment, which is Husky D, which is our low-income adults, 138% of the federal poverty level. Over 300,000 Connecticut residents, nearly 3,000 of my patients, but over 300,000 Connecticut residents receive Husky D. It's at 90%. If they drop 90% to 50%, that impacted Connecticut is over, as I said, is about almost $1 billion, just shy. And they could go lower. The other areas that the current administration has openly stated they don't like. They want to penalize states like Connecticut that have used their own dollars to pay Medicaid for those who are in this country illegally. So that is another area. And then, of course, they're going to want to potentially put in workforce requirements. That's another issue. I'll be very honest. I was formerly very negative about block granting, but the Tobin analysis showed that block granting it's impactful to be sure, but it rises exponentially, so that by year 6 and 7, it's really in the stratosphere. But in the early years, it's not as bad. I mean, it's still a few billion, but I mean, but I'm wondering, I'm hoping for block granting, because I'm hoping that if it happens in the next few years, there'll be a change in administration and maybe we can change the tide. Sorry, that's the long answer, but
Thank you.
it's an area that we've not talked about, which is no one really knows. But I mean, I think everything we have seen thus far from this administration is as bad, if not worse, than we anticipated. And this is what the experts are telling us is most likely at this point in time.
I appreciate that. Through you, Mr. Chair, just one quick follow-up, and that is, so when we're trying to, the testimony, a lot of the testimony today has been state, you need to fill the hole created by the federal government. So the more we can get a handle on what that is, the better. The $3 billion in decreased Medicaid revenue to the state of Connecticut, is that in 1 year? Or is that over a period of time?
It assumes, it depends on how the government, how the feds play it out. If they cut it all at once, it would be all at once. It would be $3 billion.
Okay, so it could potentially be $3 billion in this fiscal year, for which we will have responsibility in this committee's, gaveling out on June 4th.
And that is why I'm saying, so you heard testimony earlier today that the community health centers at least serve over 440,000 residents of this state. you've also heard of how our rates are poor, are amongst they are the lowest in New England, they're the lowest in the Northeast, and they're in the lowest third of this country. Nevertheless, those rates are protected from federal impact, so they're not going to be impacted. The feds are not going to, can't change that. If you can, at a minimum, make us whole, that's $74 million in the first year to make community health centers whole, it'll at least shore us up for what we think is coming. I mean, it's what should be done in any event, because that's what CMS statute has been for the 20 years since the BIPIC law, the law was passed in 2001, in which we have not really been compliant with. So it's just really doing what we should have been doing for 20 years. But if we do it now, it will give us a little bit more backbone to face what appears to be coming.
Thank you very much.
You're welcome.
Thank you, Doctor.
Thank you very much.
Our next speaker is number 75, Justine Lavoie. Niantic Bay Playhouse.
All right. First of all, good afternoon to all of the esteemed members of the Appropriations Committee. I am here on behalf of 151, the bill, and in reference to the Niantic Bay Playhouse. Now, you've already heard a couple of voices for the Playhouse, so I'm just going to be brief. There are a couple of things I'd like to add, and it's important to me to be a voice for such an amazing institution. So I'm testifying on behalf of this Playhouse. I've had the amazing opportunity to actually perform in some of their plays. And it allowed me an opportunity to return to an outlet that I love, and one that continually provides opportunities for folks like me who love performing, directing, producing, creating sets, costumes, well, the list goes on. And let's just say that the entire experience of theater is one that touches and enhances a wide variety of communities. And for all the people who are impacted by the Niantic Bay Playhouse, it is important to understand that the Playhouse currently receives no financial support from the state of Connecticut, as so many other theaters similar to it receive. So the one piece that I'd really like to add is just to take a look at the people who are impacted by this wonderful place. First of all, we'll take a look at the audience, and each of the plays have a near to total sellout of its 186 seats. Our audiences consist of persons of all ages, cultures, and abilities. Performances are of the highest caliber, and it is common to hear laughter when humor occurs, tears when hearts are touched, as only theater can touch, and bows, and at the end of the play are met with thunderous applause and standing ovations. The plays are intentionally set at an affordable price so as to ensure the experience of live theater, that it become more accessible. But what is of equal importance are the school groups that come and do not have to pay for the tickets. They're welcome just to bring the kids to the school, especially depending on the plays that are there. And the neat thing about that is to have these youngsters looking up and saying, that's what I want to do someday. The actors, the singers, the dancers, and the choreographers, well, once again, the number of talents that are needed to produce a show is numerous. But the really neat thing is that it transforms everyday teachers, insurance workers, ambulance drivers, moms, dads, students of all ages, retired workers of all ages, into the stars, the chorus, the dancers, the backstage crew, the technicians of these amazing shows. Communities, we cannot overlook the impact that goes beyond the audience, the cast and crew. Niantic Bay Playhouse is surrounded by a wide variety of stores and eateries that gain greatly from the amount of people who come to Niantic to see the shows. Many will have a nice dinner at one of the restaurants or browse through the bookstore or check out some of the clothing stores. Niantic is a growing community, and there is no doubt that the importance of the Playhouse existence is an integral part of the growth of this amazing community. So lastly, in order to really support the Playhouse, each of us have to dig deep into the importance and validate the importance of arts and the impact it has on so many people, as well as the variety of communities it serves. Thank you.
Our next speaker will be number 76, Matthew Mitchell, Horizons Program.
Good afternoon, Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and members of the Appropriations Committee. My name is Matthew Mitchell, Associate Director of Supported Living at Horizons, a nonprofit in South Windham. I am testifying in support of SB 1547, an act concerning funding for nonprofits. We provide essential residential and daily services for individuals with developmental disabilities, helping them lead fulfilling lives. I've dedicated my career to this mission since I was 18 years old. Now at 31 years old, a husband and father of two, I've spent the past decade at Horizons ensuring we support quality care to the individuals that need it most. This work is more than just a job. It's who I am. It requires sacrifice, often pulling us away from our own families, yet we remain committed because we know the impact of what we do. Every day I strive to provide stability, compassion, and advocacy, as well as direct care to a vulnerable population. I want to thank you again for the opportunity to testify in support of SB 1547. While we appreciate recent funding increases, they have not kept pace with the rising costs. Inflation has outstripped these adjustments, making it difficult to maintain competitive wages, retain qualified staff, and to deliver high-quality services. This bill would index funding for nonprofit providers to state employee wage increases, ensuring that Connecticut residents continue to receive essential high-quality services. Nonprofit agencies like ours are in crisis due to stagnant reimbursement rates that fail to keep pace with inflation. Our greatest challenge is staffing. Low wages make it difficult to recruit and retain skilled direct support professionals. Many of our employees now earn wages comparable to state's minimum wage, making it financially unsustainable for them to remain in this field. They are passionate about the work that they do, but they're forced to leave for better paying jobs. This workforce crisis has direct consequences for those we serve. Staffing shortages have led to excessive overtime, increased burnout, and leadership teams stepping in to cover shifts, diverting them from critical responsibilities of their role. If this continues, we risk losing even more staff, impacting the stability and quality of care for the individuals who rely on our services most. The lack of adequate funding has caused significant challenges. These cuts don't just affect operations, they affect people and impact lives. Individuals who depend on us for a stable, supportive environment to live. If state funding had consistently increased at the rate of inflation, we wouldn't even be in this situation right now. We would have been able to provide competitive wages, retain experienced staff, and ensure continuity of care. Instead, we have been forced to make sacrifices, stretching resources thin, relying on exhausted staff, and operating under constant uncertainty. Passing SB 1547 would be a step toward correcting this inequity. Increased funding would allow us to pay for direct support professionals. Funding would allow us to pay for their quality care, reducing turnover, and helping us to maintain the level of care that our individuals with developmental disabilities deserve in Eastern Connecticut. This issue extends beyond Horizons. It affects nonprofits across the state. And our workers are just as essential as those in state-run agencies, and they deserve wages that reflect the critical role that they play in their community. I urge this committee to support SB 1547 with the requested substitute language by the Alliance, and thank you for your time and consideration.
No. All right, our next speaker is number 77, Dr. Frank Bessie from CCA. Remote? No. All right, we're going to move right on to number 78, Joe Pandolfo, Connecticut Society of Acupuncturists. He's also remote.
Good afternoon.
How you doing?
Can you hear me okay?
Yes.
Great. Good afternoon, Senator Austin and Representative Walker, Senator Summers, Representative Nuccio. I'm Joe Pandolfo. I'm the public member of the Board of Directors on the Connecticut Society of Acupuncturists. And first, we'd like to just thank you for all the work you're doing on budget matters. We really don't envy all the difficult decisions that you have to weigh each session. We're here today to speak in favor of House Bill 7254 regarding the Department of Social Services Medicaid rate study. We wholeheartedly support this bill. We think it would help ensure that Medicaid reimbursement rates over future years will follow a kind of a consistent pattern and the guidance of the extensive research and data that was used by the department and their consultants. We were struck when we read that research first, the consultants' review, how inconsistent the pattern of reimbursement rates were across the Medicaid programs in different professions. In the case of acupuncturists in particular, we saw that the reimbursement rates in our current state schedule ranged from 45% of Medicare rates to 96% of Medicare rates across the different codes, the treatment codes. And this kind of spiky inconsistency, along with just a generally low level of payments compared to Medicare and compared to benchmark states, is really discouraging participation in the program by our practitioners, most of whom are small businesses. So we're happy that the state has been smart to include acupuncture in the Medicaid program. The medical literature and studies from other state programs show that use of acupuncture reduces the use of prescription painkillers, including, of course, opioids, among other expensive treatments. And our practitioners who are in the Medicaid program participate enthusiastically, but it's a tough haul for them based on the low reimbursement rates. And they report that the Medicaid, the Husky patients are among their most conscientious payments and really appreciate the opportunity to get treatment for their pain without use of prescriptions. So, you know, the use of acupuncture in the program is something that's important to the patients, but it's also very beneficial to our Medicaid program overall. So we're in support of this bill, seeing that it would really, I think, help to increase participation by our members, by acupuncturists, so there's more access to the Medicaid population. And all the benefits, including especially the reduction of opioid use, is a benefit to the whole program, to the whole system. So once again, we thank you for the opportunity to testify. And we have some background data that we'd be happy to share with the committee along these lines, especially with regard to the use of expensive treatments and prescriptions being reduced by use of acupuncture. Thank you again.
Thank you, sir. Any questions or comments? Have a good day.
You as well. Thanks.
Here is Dan Hayden from the New England Civil War Museum and Research Center.
Hi, good afternoon.
Hi.
Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and esteemed members of the Appropriations Committee. I'm Dan Hayden. I'm the Executive Director of the New England Civil War Museum and Research Center. That's in Vernon. I also myself am a resident of Enfield. I'm submitting testimony supporting SB 1551, and that's specifically for the benefit of Connecticut Humanities, Connecticut Office of the Arts, and Connecticut Office of Tourism, the arts and humanities field here. So what I like to do is give you a sense of what that funding can do for us. And we've my colleagues have talked about the millions of dollars that will be shorted to be able to create the funding programs. But in particular, what that means is that money is going to be able to help a lot of different organizations. So our organization, the museum itself, it's 100% volunteer, nonprofit. We don't charge for admission. But what we do is when we open the museum, we're trying to tell a particular story. And we knew that we wanted to change from the traditional narrative of how we were telling the past story of things, in that we wanted to increase the voices and we wanted to increase the professionalism of it. And what Connecticut Humanities in particular, with the Connecticut League of Museums and support, has helped us for is they've been able to give us not only the guidance, but the funding to be able to make those changes happen. And we're talking two grants in particular that we've received over the past couple of years. One's $3,000, one's $4,000. And what we were able to do with that is completely turn over two parts of our facility. One is the storage area, the collections, where we actually keep a lot of these things, and in a professional way, preserve the integrity of those. And that's through our museum makeover program that is organized through those two entities. The other is for a grant called the Quick Grant System. It's all competitive, but you still apply to be able to put something into practice very quickly. And we were able to completely turn over our museum with these fundings and the guides from actually professional curators and museum industry people to help guide us along the way sustainably. So now we're able to tell the story of the American Civil War in a very personal way, changing out all of the interpretation, changing out all of the way that we present things and the facilities that we have there. We're a nonprofit. You know, my counterparts all across the state, all these small little museums, house museums, and historical societies and similar, are very good at being able to stretch a dollar to make it happen. So if you present these, if you give this funding, it's not just a chunk of money that goes one particular place. Connecticut Humanities actually spreads that out into a lot of different ways to be able to help. Ours in particular, it's a night and day organization. I'll just end by saying, one thing I love to do here. Our mission is to connect the people of today with the experiences, the memories, and humanity of the people of the past. And really, there's nothing more powerful for human connection and change than by giving someone the opportunity to, have another perspective and things for themselves. What if that were me? So thank you for that. And the quote about, humanities is the soul of our state here. I really think that this would help us quite a bit. Thank you.
Thank you, sir. Any questions or comments? Have a good day.
Thank you.
Our next speaker is Dane Ruff.
Hi, good afternoon. Can you hear me?
Yes, Dane. How do you say your last name?
Rue.
Rue. From the Slater Memorial Museum. Go ahead, sir.
Hi, good afternoon, Senator Austin and all of our representatives. My name is Dane Rue, Director of Slater Memorial Museum of Norwich Free Academy, the great city of Norwich, Connecticut. And I am here to voice support for Senate Bill 1551. My support for allocating resources to support the Arts and Culture Fund comes from my personal and professional roots. Having worked in the museum and history industry for the past 15 years, I've worked in organizations both large and small, and have worked with some of Eastern Connecticut's most unique and special historic assets. The arts and culture industry in Southeastern Connecticut alone outpaces that of other counties and entire states. It's living proof that our state's importance in this sector. But the reality is that many small and medium-sized museums, historical societies, and arts organizations are often at a disadvantage when it comes to federal, state, and local funding. Arts and humanities are integral parts of our community, whereas math, science, and engineering teach us about how things work in the world. The arts and humanities teach us about why those things are important. 5 years ago, when the COVID-19 pandemic shut down the world's commerce, thousands of organizations across our state and the region were poised to fold, but were saved thanks to access to funding streams via the CARES Act of 2020 and the American Rescue Plan of 2021. These funding streams and more directly impacted the ability of our industry to continue our work in the midst of an unprecedented state of the world. And it showed how small grants, anywhere from $500 to $5,000, could make a difference on a large scale. We are now faced with more unprecedented times and uncertainty, with the shuttering of federal agencies, including the Institute of Museum and Library Sciences and many more. I'm greatly concerned that with funding drying up in our sector, particularly with IMLS, which represents a grand total of 0.0046% of the federal government's budget, it will only harm our industry's ability to develop arts and humanities programming, preserve our historic assets, and make our communities vibrant hubs of activity and relevance. This year, we are in the process of celebrating the 250th anniversary of the American Revolution and the founding of the United States, culminating with the 250th anniversary of the signing of the Declaration of Independence in 2026. In my town of Norwich and throughout Connecticut, we are volunteering our time and energy to ensure that we properly celebrate and acknowledge this historic milestone in our nation's history. And I implore our state leaders to consider what it means to fund and support our arts and history. Connecticut is a revolutionary state in more ways than one. Let's show our residents and the nation that we are still revolutionary and that art and history still and always matter. Thank you very much.
Well, thank you for coming before us today. Just a quick question. What is ILMS?
The Institute of Museum and Library Services.
All right. Just wanted to be clear on that. Any questions or comments? Have a good day, sir.
Thank you.
Our next speaker, 81, is Naomi Libby, the Children's Center of Hamden.
Mr. Chair?
Yes.
So Ms. Libby had to leave us, but I've given permission for someone to speak on her behalf.
And who is that?
He actually spoke earlier, Jim Mifud.
Okay.
Hello, Mr. Chair and members of the committee. I thank you for letting me fill in for Dr. Libby. I'm Jim Matthew, the CEO here at the Children's Center of Hamden. I'll just read Dr. Libby's testimony. My name is Dr. Naomi Libby. I am the Chief Medical Officer at the Children's Center of Hamden. Our agency of over 200 employees provides behavioral health services across multiple levels of care, from outpatient mental health to subacute psychiatric residential treatment. We serve youth and families from across the state who are suffering from trauma and serious mental illness, as well as those with autism, intellectual disabilities, and substance use disorders. I'm testifying in support of Senate Bill 1547, an act concerning funding for nonprofits. This bill is critical to ensuring much-needed services to Connecticut's most vulnerable populations. Private nonprofit organizations such as the Children's Center of Hamden are an essential component of Connecticut's behavioral health service network. Take psychiatric residential treatment alone. This is a level of care intended to break the cycle of repeated emergency room visits and inpatient hospitalizations for our state's most psychiatrically and behaviorally complex children, many of whom have significant trauma histories, a level of care for which wait lists are often months long. 3 out of 5 of Connecticut's psychiatric residential treatment programs are run by private nonprofits. The state depends on us to provide these necessary services, and yet we cannot possibly keep up with the wages paid by state to its employees. I often say that the hardest job at our organization is that of a direct care worker. This high school or bachelor's level position is responsible for supervision of youth in a therapeutic milieu. These dedicated employees spend their time supervising youth through their educational, recreational, and daily living activities. This work is not glamorous because of the behavioral challenges the kids we serve experience. Direct care workers are often assaulted, spit on, or called racial slurs. They are working long hours in challenging jobs with wages that barely exceed minimum wage. They do so because they are committed to the work, but when they cannot pay to feed their families, many make the decisions to leave for higher paying jobs outside the social service sector. Because of this, it is very difficult to retain staff. Children who are already traumatized do not benefit from staff turnover. These employees are your constituents. These children are your constituents. Senate Bill 1547 would ensure equity between state agencies and the vital nonprofit sector in terms of wages and Medicaid rates. Children and their families should be able to rely on the highest quality services provided by any qualified provider in the state, whether public or private. I urge this committee in the strongest terms to support Senate Bill 1547, and I thank you for your time and consideration.
Thank you, sir, for stepping in for Libby. Any comments, questions? Have a nice day, sir.
Thank you all. Appreciate that.
And our next speaker is Lisa Baxter, and she is from Child and Family Agency of Southeastern Connecticut.
Thank you, and good afternoon, Acting Chair Nolan and members of the committee. Appreciate your time today. I know it's been a very long day. My name is Lisa Baxter. I am the Chief Financial Officer for Child and Family Agency of Southeastern Connecticut. Our organization plays a vital role in supporting the health and well-being of children, families, and adults across New London, Middlesex, and Windham counties. Each year, we serve over 10,000 individuals with the help of 270 dedicated staff members, providing a range of critical behavioral health, medical, and supportive services. We have an annual budget of $21 million, which is primarily funded through state and federal contracts, also Medicaid and childcare subsidies. So this bill that I'm testifying for in support of Bill 1547 is very crucial for our organization. We are very grateful for the increases the legislator has been able to provide over the last few years, but they just have not been enough to meet the needs of the people we serve. We continue to be hit by crippling increases in our costs, due in part to increases in inflation that far outpace the rate of increases the legislator has provided. Our organization faces significant financial challenges, primarily due to stagnant funding for our highest need programs over the past several decades. Despite rising costs, including a more than 40% increase in operating expenses over the last 10 years, funding levels have not nearly kept pace with inflation. This financial strain limits our ability to offer competitive wages and benefits, making it difficult to retain experienced staff and maintain the quality of care our communities depend on. The consequences of inadequate Medicaid reimbursement rates and other state funding have forced us to make very difficult decisions, just as the other organizations have that you've heard about today, including closing programs and reducing our experienced clinical staff. As an example, to mitigate some of these losses, we've had to rely more heavily on interns, which increases the need for supervision, and it reduces our overall client capacity in the long run. Additionally, while federal assistance such as PPP loans temporarily stabilized our budgets during the pandemic, we have since been forced to approve deficit budgets every year. We rely on short-term credit to get by and draw from our endowment, jeopardizing the financial stability we have built over the past 40 years. If our contracts had kept pace with inflation, we would not only maintain adequate staffing levels, but also expand services to meet growing community needs. Instead, we have had to consolidate office space, sell real estate, aggressively pursue other grants and fundraising, and have eroded our cash reserves. Yet, all of these measures still fall short. Passage of this bill would allow us to operate with more fiscally sustainable budgets, retain and fairly compensate our workforce, and ensure the long-term viability of programs that serve our most vulnerable populations. We urge you to support this legislation so that we can continue to provide these essential services without the constant risk of program closures and financial instability. I urge this committee to support Bill 1547 with the requested substitute language by the Alliance. Thank you for your time and consideration.
Thank you, Lisa. Anyone have comments or questions? Lisa, thank you, and we hope to see you soon over at the UCC.
Absolutely. Thank you.
Have a good day. Our next speaker will be Daniel Fries from CCEP. Yep. How you doing, Daniel? You're up.
Good. Sorry, they just upgraded me to a speaker. Thank you very much. My name is Dr. Daniel Fries. I'm an emergency physician in Hartford and a resident of West Hartford. I apologize. I'm actually still at work right now, so stepping away from patients for the moment to testify on Bill, I believe it's 7254. I thank you all the committee members for being here and sticking through this long day. I've heard that you've heard from many physicians and physician groups so far about the state of Medicaid in Connecticut. Obviously, it is inadequate based on that study that is referenced in both the testimony and the bill itself. As most people know on this committee, Medicaid rates have not been increased in 17 years. I know that just kind of sounds easy to say, but imagine in any profession, call it a restaurant, where the cost of food or the cost you can charge people and diners hasn't increased in 17 years. The result of this is a major health threat for the Medicaid population of Connecticut. The emergency department is basically a canary in a coal mine. We see when the health system is struggling, as we see the patients that can't get in to see primary care doctors, can't get in to see specialists, and even when we see them and stabilize them in the emergency department, they often have nowhere to go afterwards. Secondly, as much as we see everyone due to EMTALA in emergency department budgets are running tight. We've seen closures across the country of emergency departments, in great part due to Medicaid, below Medicaid payments and lowering insurance payments overall. We haven't seen any closures in Connecticut yet, but there are multiple emergency departments that are sort of on the brink right now. And we really need to increase Medicaid reimbursement, both in the emergency department and throughout medicine, in order to allow our Medicaid population to have access to care. Because just having insurance doesn't provide access to care. And the way Medicaid is going in Connecticut right now, there's very few physicians and very few clinics the Medicaid patients can go to. I'd be happy to answer some questions, but we hope you'll seriously consider the findings of the study referenced in the bill and take steps to increase Medicaid payments across the state.
Thank you, Doctor. Any comments or questions? Seeing none, you have a good day, sir. Don't work too hard.
Thank you.
And our next speaker is 84, Siobhan Annan from the ARC-CT.
Hi, good afternoon. Good afternoon, Senators Austin, Acting Chair, Representative Nolan, Representative Walker, Senator Berthel, Representative Nuccio, and all other esteemed members of the committee. I am Reverend Siobhan McCannon, the Executive Director of the ARC Connecticut, an organization with a 70-year history of serving individuals and families within the intellectual and developmental disability community. I think this very critical time in our state and nation's history brings to our awareness the necessity for support of Bill SB 1547. And I thank the committee's leadership for having this public hearing today. Improved Medicaid rates and sustained COLA adjustments requires an increase in funding to recruit and retain the workforce necessary to care for our most vulnerable population. Many human service providers are often met with the challenge of high turnover due to an inability to support staffing shortages. The staff at the ARC providers are deeply passionate about their roles, but often are in tension with the decision to fulfill personal passions and moving on to a career where one can earn a livable wage plus benefits for themselves and their families. In our recruitment and retention of a workforce, we are competing with Amazon and Walmart, and we frequently are the losers in this competition. If we who are committed to ensuring justice and equity for all, right, if we want to see the IDD population adequately served, then we must take a stand today to ensure that nonprofits who do some of the most important work in our society are funded to support the continuity of that work. In many cases, this work provides life-saving services, as was mentioned here by other colleagues today. We are concerned that the indexing starts at the lowest of wages that are currently paid, and that perpetuates inequity. My humble ask is that when considering increases, that you remember the most vulnerable among us and the ones who, like me and countless others, who have dedicated their lives to the work of human services. Thank you for the opportunity to share today.
Thank you for coming before us to speak on the most vulnerable. As we know, we need to work harder to make sure we do enough for them. Any comments or questions? Thank you. Have a good evening.
Thank you. You too.
Our next speaker will be number 85, Mark Donald from Catalyst CT.
He has not accepted the promotion to panelist.
Mark, if you're listening, you have to accept the promotion to panelist on your computer. Going to the next person will be Alyssa Garuti from Children's League of Connecticut. Hi, in person. Hanging out.
Yeah, spending the day with all of you. Good afternoon, Representative Nolan and distinguished members of the Appropriations Committee. I'm Alicia Gaduti. I'm the proud president and CEO of Edelbrook Behavioral and Developmental Services. Edelbrook is a multi-service agency specializing in autism spectrum disorders, developmental, and behavioral services. We serve approximately 400 individuals with highly complex developmental and behavioral needs. We have special education schools in Bloomfield, in Manchester, in Cromwell, in Middletown, but our students represent nearly every community in the state of Connecticut. I also serve as the president of the Children's League of Connecticut, which is a coalition of 11 nonprofit providers focused on meeting the needs of kids and families throughout the state. At Edelbrook, we provide highly specialized education and support services to meet the unique needs of children who need comprehensive wraparound services. We serve the most complex students with autism in a comprehensive 12-month program. And we are an integral partner with school districts and a vital component of their continuum of service options for students with the most significant needs. In earlier testimony, there were some questions about why are we seeing the number of kids with special needs growing and the cost of special education services increasing. Well, autism is the fastest growing disability. There's now 1 in 36 children diagnosed with an autism spectrum disorder. And if you look at the ARC, it continues to rise. So it's an expectation that there's going to be more kids that need special education services. There's a bill before you today, an act concerning limits on special education expenditures, which we're really concerned about. There's been lots of talk about special education this session, and our concern is that there be a holistic approach to examining the cost of special education, that it not just include approved private nonprofit special ed programs like ours, but look at all of the provisions of services for special ed, including public school systems, RESCs, and also the cost of transportation, which you're hearing a bill about today as well. And then once we have all of that information, looking at where there can be efficiencies gleaned, and we're happy to be part of that process. But artificially and quickly capping rates on the nonprofit schools that we run only limits access to kids that need the most comprehensive care. And we've seen this in other states when that happens and kids end up having to go to other states for services. No one wants that. We certainly don't want that. We want to be able to continue to provide the amazing services we do in our schools, but a rate cap would make that really difficult. I also want to speak today about Senate Bill 1547, an act concerning funding for nonprofits. There was talk already today about Connecticut being a great place to live. I know you haven't heard much of that today, but I will tell you, in our programs every single day, you will see amazing things happening. You will see the quiet heroes that are running our group homes. You will see the paraprofessionals helping a child manage something they thought they could never do. And if you pass this bill, you will be among those heroes supporting our staff who are working tirelessly day in and day out. And I know you heard a lot of incredible stories today, but we're really asking you to step up and be the heroes for the nonprofit human service system this session. Thank you so much.
Thank you. Any questions or comments? Well, I thank you for recognizing Connecticut as an amazing state, because it is. And our next speaker is going to be David Ismail. And you are online, I think. No. Or... How you doing, Mark Donald? Are you there?
I am here, Representative Nolan. Thank you. Apologize for missing the invite a minute ago, but
we'll talk
here.
about it later. Go right ahead.
All right, great. Thank you, Representative Nolan, members of the committee. Mark Donald, President and CEO of Catalyst Connecticut down here in Bridgeport, Connecticut. And I'm here to speak on two bills. Bill SB 1547, funding for nonprofit, as well as 7252, raise bill 7252 in regards to the reporting by the executive director of the court-supported services division. So, quite frankly, quite simply, don't want to read my testimony, but as a nonprofit faced with many funding issues, including, some unexpected ones that have come across our desk recently. I'm having to think about choosing between programs that I can offer to support some of the neediest in our communities and some that are indispensable to the communities. So that clearly is a challenge. But on the reporting from the executive director of CSSD, I'd like to go out and offer to support him in this, because Catalyst CT, we have a range of programs that are working with young people that are struggling in the community, facing ramifications of their choices, which are often rooted in trauma, neighborhoods, group decisions, and overall mistakes that many of us in the past were able to avoid because we had supports in place. So in addition to those services that we at Catalyst, there's a group of us who are working closely together in the community that really have the expertise that would help Mr. Roberts, the executive director, with a report. And I think importantly, with the report, it will then educate others around the state who may could learn from our programming and further impact those in our community. So with that in mind, I just want to keep it brief, very much in support of 1547 to increase funding for nonprofits who are doing the work in critical communities, as well as 7252 requiring the executive director of CSSD to report on community programs, which are vital to the disconnected youth in Connecticut. Thank you very much. Rep. Nolan, I can't see if you're speaking to me because you're muted, or I can't hear you on my end.
Oh, thank you, Mark. No further questions or comments for you.
Thank you for the opportunity.
And Mr. Ford?
Yes, thank you.
Good afternoon, members of the Appropriations Committee. I am Terry Ford, COO for Horizons. Horizons is one of the private nonprofit agencies providing essential services to our citizens with intellectual and developmental disabilities where they live, where they work, play, and learn through contracts with DDS. We're in our 45th year and serve over 1,600 people with developmental disabilities statewide. We employ 24/7 year-round staff and also about additional 130 seasonal staff. Thank you for the opportunity to testify in support of SB 1547, an act concerning funding for nonprofits. You have my written testimony, and I'm going to use some of that in this testimony. I am grateful for the increases that the legislature has been able to provide us for the last few years, but they haven't been enough to meet the needs of the people we serve. We continue to be hit by crippling increases in our costs, due in part to increases in inflation that far outpace the rate of increases the legislature has provided. Community nonprofits are funded about 32% less than we were in 2007. And because of these issues, we face 4 huge problems. The first one, chronic underfunding. 2, the loss of ARPA support. 3, stagnant Medicaid rates. And because of those 3, the fourth one, an acute staffing shortage. At Horizons, we face dire challenges that put staff, the agency, and the individuals we serve in jeopardy. Most of the challenges are directly related to the lack of funding. Due to staffing shortages and the limited number of quality applicants, we have ended services in our employment, residential, and day services. We have ended services for individuals with complex needs. One individual with complex needs and a long history of aggression is now at home with his elderly parents, putting all 3 of them at risk. You can imagine how heart-wrenching it was for us to make that decision. The limited number of quality applicants prevents us from restarting services for those with complex needs. Another danger is that staff work too many hours per week. Staff work too many hours for 2 main reasons. One reason, they can't afford to work solely for us as full-time staff, as the cost of living exceeds our ability to pay them a living wage for 40 hours of work. Some of our staff also have to work up to 80 hours per week for us because of mandated services, overtime. And we know that causes burnout, errors, puts service recipients at risk, and is unsustainable. Many in our community need these vital services, but they also receive denials from Horizons. I personally receive 1 to 3 calls per month requesting new services, and all of them have been denied because we can't even sustain our previous commitments. Sadly, all these issues are worse than last year. Without adequate funding, the issues will get worse next year, continuing the multi-year trend from going from bad to worse to even worse. Due to low wages, Horizons receives an inadequate number of applicants for open positions. We are losing qualified, trained staff more quickly than we replace them, and describing our staffing situation as a crisis is an understatement. Tearfully, during some resignation meetings, some experienced staff have mentioned that they wish to keep working for us, but they can't afford it any longer. You know, without adequate funding, more services are going to get cut. Programs are ending. Earlier today, Representative Bolinski correctly identified a looming concern as well: the disappearance of cost-effective, high-quality nonprofit providers. The cost to replace us is incalculable. If the rates the state pays for our services had increased with the inflation since 2007, we wouldn't be here today asking you for hundreds of millions of dollars to keep pace. So you can understand the SB 1547 with substitute language would stop the nearly 2 decades of erosion of critical services to people with disabilities. It would allow providers to provide for more meaningful future, more thoughtful planning. And in my opinion, it would provide future legislative bodies with better tools to manage the state's finances, as the current system is unsustainable and is leading to a path of significant higher cost, as other states, Connecticut's not alone in this, have recognized. I want to again thank you very much for your opportunity to testify in support of SB 1547 with the substitute language suggested in my written testimony.
Thank you, Mr. Ford. I don't see any questions or comments. Have a nice day, sir.
Thank you.
Our next speaker is Barry Simon from Oak Hill and Easter Seals. He's not able to join us, so we'll go to number 90, Janet Evelyn from Norwalk International Cultural Exchange.
Yes. Good afternoon. Can you hear me?
Yes, we can.
Very good, very good. Dear members of the Appropriations Committee, my name is Janet Evelyn, and I am a resident of Norwalk and the founder and executive director of the Norwalk International Cultural Exchange, also known as NICE, and better known as the NICE Festival, a grantee from the Connecticut Humanities and the Connecticut Office of the Arts. I am submitting testimony in support of SB 1551 today with respect to the need for increased investment in statewide arts, culture, and tourism infrastructure. Specifically, at least we're asking for $5 million to the Connecticut Humanities, $5 million to the Connecticut Office of the Arts, and $12 million to the Connecticut Office of Tourism. The Norwalk International Cultural Exchange was established in 2015 with the idea of celebrating all cultures to bring about a day of community building, sharing traditions and customs. Thus, the NICE Festival was born in 2016, a very important year for us. In the 10 years since NICE has created a platform of learning and sharing by engaging all the people of our community, we are making a profound impact on our local economic development. We provide opportunities for local artists, artisans, vendors, and suppliers to pursue their passions and to preserve their cultural heritage. Since 2016, Norwalk has gained national recognition in the top 100 best places to live in the USA because of this work to elevate its best attribute, and that is being a place where everyone is welcome. In 2024, designated an arts and cultural district because of the work to support its cultural heritage arts. Norwalk cultural vibrancy is front and center and always at the core of everything NICE does. We are intentional in our collaborations and partnerships with cultural groups and artists representing all ethnicities. The annual NICE Festival attracts 5,000 plus attendees each year to Norwalk from Stanford, Hartford, New Haven, New York, New Jersey, Massachusetts, and many other states. The day-long event is free to the public and is run by a volunteer organization. We are honored to be in this position to do this work, but without the acknowledgement and support from the Connecticut Humanities and the Connecticut Office of the Arts, it absolutely would not be possible. Because of the funding through the COA and Connecticut Humanities, NICE has been able to grow and expand to optimize our network of cultural heritage artists in providing education enrichment programs to our schools and other organizations in the community. We, in fact, our little grassroots organization provided over 30 programs last year, reaching as many as 20,000 school-aged children and adults for Norwalk Public Schools, New Canaan Public Schools. We have reached as far as Allington Public School District, Wilton School District, and other organizations, including museums like Stepping Stones Museum for Children. Connecticut Humanities provides support and guidance to nonprofit cultural organizations and accountability on behalf of Connecticut residents. During the past 10 years, in partnership with the Development of Economic and Community Development, the DECD, Connecticut Humanities administered nearly $60 million in state grants to support cultural investment, us being part of that. So through the Connecticut Humanities, Connecticut Cultural Fund, Connecticut Summer at the Museum, and other programs like Good to Great 2.0. I'm really honored and thank you for the opportunity to provide this testimony. And again, without funding for SB 1551, we just simply would not be able to continue to engage all of our community as we have been doing.
Thank you for coming before us today. And I don't see any questions, hands raised. So have a nice evening.
Thank you very much.
Okay. I just want to give a reminder to everyone. The amount of time is 3 minutes. You'll hear a little bell go off. Please try and summarize right as you hear that little bell go off. I'd hate to get yelled at by our chairs that might be watching me. I keep looking around to see if there's a, but just remember, we have 3 minutes for speakers, and then we have to slow it down. Our next speaker is going to be, we're going to go back one to Mr. Simon. Are you on?
I am.
Okay.
So hi, Representative Nolan, and thank you, members of the committee. I'm here to testify on SB 1547 concerning the nonprofit funding. We know that you can't make these investments in vital services without updating the state's budget controls, and the state can afford to save for a rainy day, pay down debt, and fund essential services for Connecticut's residents. Please update the guardrails to fund us. I am proud to lead Oak Hill, which is a specialty healthcare and special education agency. We are, when fully staffed, have about 1,600 talented and dedicated staff and almost 150 programs serving over 3,500 individuals and their families throughout Connecticut. Chronic underfunding has forced us to close 20 programs in 10 years. I repeat, 20 programs in 10 years have been closed. Group homes and day programs that are no longer there. 200 jobs no longer there. Beds in group homes sit empty and classrooms remain underutilized because we cannot staff. Scores of adults and children are desperate need of services, and yet they are stuck at home or on wait lists because we are not funded properly. This has been an issue that has gone on for 30 plus years of being in this position. We employ RNs, OTs, PTs, behaviorists, teachers, paras, direct support professionals, social workers, managers. Many positions need 20 to 30% increases just to stay at the low end of market rates. We currently have nearly 300 job vacancies. Please remember, we are not able to raise taxes. We cannot raise our rates. The state sets our rates. The state pays us for our unionized staff $17.25 an hour. Although this past year we were provided one-time funding, it still was not a COLA. I would venture to say that the state is probably the largest low-wage payer in the state. Our staff and equipment are tired. We are long past the point of doing more with less. Being a nonprofit community provider in Connecticut has meant that we've been ignored, regardless of what we say. Our stagnant rates have cemented poverty for much of our workforce. Past budgets have displayed discrimination, prejudice, and injustice as ordinary and acceptable for the people that we employ. We are a unionized agency. Without fair wages, strike actions will continue to be a tactic born out of frustration. This is not just a labor issue. It's a crisis of care issue. It's an access to care issue. We know how to do this work. Our staff are amazing at doing this work. Connecticut has the money for these essential services to pay livable wages for services it wants and needs. We could be opening programs back up. We could be creating jobs, and we could getting people access to services rather than planning for more closures and a likely strike. The time of inaction and kicking the can has long passed. Our elected officials know just what needs to be done. So please support the increased funding by indexing our rates. Thank you.
Thank you, sir, for coming before us. And we have a fabulous question for you.
Thank you, Mr. Simon, for being here today. I had posed, I don't know if you've been with us all day, but I had posed a similar question earlier today regarding our homelessness providers. And my question is, it really struck me when you said we are the largest low wage payer in the state. That is, wow. So my question to you is, in addition to the fact that we are the largest low rate payer, would you also say that your employees are utilizing state services like SNAP, like, whether it be Husky, all of the things that they have to, that here they're providing services, but then also still have to do that for themselves and their families?
Yes, I will say that, sitting at many of our meetings for the nonprofit trade association, we hear all the time how many of our members, staff have to utilize that. So yes, I would say that that's an accurate statement.
So would you say that if we were actually providing a living wage as opposed to being the largest low wage payer in the state, then they would probably not have to utilize those services, which would shift the cost burden from the state providing those services to paying them what they're worth?
Yeah, yes, absolutely.
Okay, thank you so much. Thank you, Mr. Chair.
Thank you for that question. Anyone else? Thank you, sir.
Thank you. You too.
And I believe our next speaker is 91, Judith Stein from Center of Medicare Advocacy.
Yes, good afternoon. Thank you very much. Representative Nolan and members of the committee, as well as chairs Austin and Walker. I've been watching and listening all day, and I too want to add my gratitude for your services and the care that you all have for the people of Connecticut. I am Judy Stein, founder and advisor and senior advisor of the Center for Medicare Advocacy. The center is a nonprofit, nonpartisan law organization that works to advance access to comprehensive Medicare, health equity, and quality health care for older people and people with disabilities. I'm providing testimony today for myself as well as for Scott Perkins, our co-director, so he won't be number 93 today. For almost 40 years, the Center for Medicare Advocacy has provided free legal assistance for Connecticut's older people, people with disabilities, and their families to open doors to Medicare coverage so that they can receive quality health care. I offer this testimony today regarding Senate Bill 1547, an act concerning funding for nonprofits. And I want to tip my hat to my colleagues in the nonprofit world who have spoken so eloquently today about the work they provide for the people in need in this state. I particularly want to talk to how the bill relates to providers that contract with the state to provide human services for people with disabilities. The Center for Medicare Advocacy, a Connecticut nonprofit organization, provides such services under contracts with the Department of Aging, Disability Services, and the Department of Social Services. We urge you to support this bill and to recognize that the Center for Medicare Advocacy contracts with both state agencies pursuant to which we provide human services for people with disabilities qualify for the indexed increases anticipated by the bill. The first contract regarding that with Department of Social Services. Since 1990, the center has pursued Medicare coverage on behalf of Connecticut residents who are duly eligible for Medicare and Medicaid and who were denied Medicare coverage for necessary care. Although often unknown, approximately 15% of all Medicare beneficiaries are in fact under age 65 and qualify for Medicare as a result of having been identified as having significant disabilities by the Social Security Administration. These people with disabilities have lower incomes, more chronic conditions, require more medications, and are more likely to consider themselves unwell than people who qualify for Medicare based on turning age 65. Our work under contract with the Department of Social Services includes appeals to secure Medicare coverage for necessary nursing home and home health care for duly eligible patients, including those with both mental, cognitive, and physical disabilities. This allows this population to receive Medicare-covered long-term services and supports. and nursing homes and home care, and reduce their indebtedness to the state as a result of otherwise having received Medicaid. Further, during the life of the project, the center has reported recoveries of over $470 million to the state of Connecticut in Medicare recoveries. This is a return of 5-1 for the state. The center its contracted work with DSF meet the definitions enunciated in SB 1547, Section 1, which says that it will be provided to a nonprofit organization that contracts with the state to provide human services for people with disabilities. It describes the people. Again, approximately 15% of Medicare beneficiaries are under age 65 and have significant disabilities. Further, the Center for Medicare Advocacy has not received a cost of living increase for this work for DSS since 2017. SB 5747 should be passed to alleviate this financial crunch and should be applied to CMA, allow it and other nonprofits to continue effectively providing human services for people with disabilities. Just quickly, we also provide services under contract with the Department of Aging and Disability Services. CMA provides free assistance on behalf of Connecticut residents who rely on Medicare to finance their health care. In conclusion, we live in precarious times that leave Connecticut's vulnerable, aging, and disabled populations in jeopardy. They and their families need cost-effective, valuable help, which is provided by the Center for Medicare Advocacy and our other beloved nonprofit organizations. We urge you to support SB 1547 and include the Center for Medicare Advocacy, all of our work for both the Department of Social Services and Aging and Disability Services among the state contracted providers that provide human services, including for those living with disabilities who may be both under and above age 65. Thank you for your extraordinary work. Thank you.
Very much. And not seeing questions. Have a good evening, please.
Thank you. You too.
And number 92, Johnny Reddick from Stanford High. How are you?
I'm good. How are you?
Good.
Good afternoon, Appropriations Committee members. My name is Johnny Reddick, and I'm a senior at Stanford High School. Thank you for allowing me to testify in support of Raise Bill 7252 today. I'm here because I know that there are many young people like me across the state of Connecticut that need extra support, and I wanted to provide my recommendations on the type of programs that can expand community support for young people. I'm in a program in my high school called Domus Nights that is a local nonprofit called Domus. Yeah, they run it. And this program helps students who struggle with attendance and or behavior by providing us with a family advocate who helps remove all the obstacles that get in the way of being successful in school. I think the committee should provide more resources for programs like this. And these are some of the ways that the Domus Nights program has helped me. Since I don't get a bus and my walk to school takes about 25 minutes, my advocate has provided easier transportation, especially during bad weather like snow and rain. I live with my parents and 4 siblings, 2 of whom have disabilities. My sister has cerebral palsy and my baby brother has Down syndrome and requires 24/7 care. He's constantly monitored. I often take on significant responsibilities at home, which makes it difficult to prioritize school sometimes. So they help with taking off the load of being in class and speaking with, like, getting me connected to counselors and stuff like that. During my sophomore year, my grandmother passed away, which made it even harder for me to attend school. And my advocate helped me with attendance recovery so I could earn my credits and stay on track to graduating. And my final way that they helped me is my advocate just helps me stay on track throughout high school. As a senior, I never thought college was an option for me, but my advocate has encouraged me to apply. And now I've been accepted into 3 different schools, so I have to just make a decision. But yeah, thank you for listening to my testimony, and thank you for your advocacy on behalf of young people in Connecticut. I hope more young people across the state are able to have support like I've had throughout high school.
Thank you, sir, for coming to advocate. And I thought we saw you here earlier today.
Yeah.
And I just want to commend you on getting accepted to 3 different colleges.
Thank you.
Senior year, you're almost there. Hang in there. We look forward to hearing about your success. So keep us a little updated if you can.
All right. Take care.
Any other questions, comments? No. All right. Have a nice evening.
Sure.
Our next speaker is going to be Scott Perkins. Oh, nope. She said she spoke for him, right? Number 94, Beth Chudnow from Oak Hill.
Evening. Can you hear me?
Yes.
Okay, great. I should say good afternoon. We're not at evening yet. Representative Nolan and members of the committee. I want to thank you so much for this opportunity to speak and to testify in support of the SB 1547 bill. I come before you yet again as a parent of a son who lives in a community nonprofit, Oak Hill. Our son has received services from Oak Hill for 37 years. I want to just tell you a tiny bit about him so you have an idea of his needs. He is nonverbal and confined to a wheelchair. He receives 24-hour care comprised both of his physical, medical, and social needs. His direct staff give him showers, dress him, make his meals, prepare them so that he's able to safely eat them. They provide his medication, they entertain him, they check in with him to see how he is feeling, and they read and quote, read him by his responses to them, which can be a shake of his head to no or a yeah for his approval. They take time to make him a cup of tea because they know he loves his tea time. They offer him a variety of artistic performances because he lives for his music. So they go above and beyond his basic care needs. It's an enormous responsibility. And for all of these years, the staffing crisis that we're in right now in community nonprofits is absolutely the hugest challenge that we faced. As a family, we have never been this affected by the lack of staffing. We are critically short-staffed at our son's home. Specific objectives are not addressed due to a lack of staff. A direct care staff member who is bathing, dressing, giving medicines, preparing meals, etc., receives $17.25 an hour based on the state funding levels. That same individual can go to a state direct care position and have perform the exact same responsibilities and receive $25 an hour. Therefore, we are constantly losing staff. We had another direct care staff member who was fantastic quit last Monday. It's just a constant. The house never has enough individuals to care for those living there. Many, many years ago, the Department of Developmental Services put out a bid for us in our interest to allow for a home to be developed for our son and those with similar needs. Oak Hill was awarded that contract. We had no say in who was going to be given the contract, and yet DDS felt that Oak Hill was an excellent provider, and we agreed that we had gotten the best care that we could have. In the same turn, though, Oak Hill individuals do not get paid in the same way. And so, although our son is safe at this point and healthy and extremely well cared for, we absolutely are in critical need of the funding that we need for the state to provide to our home and to Oak Hill and to all nonprofits. I thank you very much for your time and your attention. I appreciate all that you've done, which I know has been a lot of hard work, and it's greatly appreciated. Thank you very much.
Thank you for coming before us this late afternoon. Any questions or comments? No? Okay, we'll go to 95. Andrew Sellinger. There, he's in person.
Good afternoon. I'm Representative Nolan and dedicated members of the committee. I am pleased to be able to testify today, and thank you for hearing it. And I am Andrew Sellinger, and I live at 20 Mohegan Drive in West Hartford, Connecticut. I have two children, adult children, with a developmental disability called Fragile X syndrome. It's on the autism spectrum disorders, and part of Fragile X syndrome is autism, hence the autism spectrum name. And in my experience with Fragile X syndrome, my children are on the more affected range of Fragile X. So I wear a few hats here. I've been on the board of directors for a small group home agency called Jewish Association for Community Living in West Hartford. And my son has been placed with JCL for 7 years, rescuing him from a abuse and neglect situation in a previous agency. They were kind enough to take on a very challenging fellow, and who was receiving restraints regularly, just about every week, constant abrasion and damage and black eyes and all kinds of bad stuff. 7 years, no restraints, no abuse, no neglect, because of the caring, thoughtful staff at this small but very, very caring agency. Their existence has been over about 40 years. And, I'm here today testifying to support SB 1547 because I want to see JCL continue their work for another 40 years, serving our community. Brian's needs are quite significant. As a person with Fragile X syndrome, one of the conditions is called hyperarousal. So he can get de-escalated, escalated in a matter of a second. And one of the big triggers is watching videos on his iPod and his computer. And it's kind of hard to avoid it because he has very limited opportunities for entertainment and enjoyment. Hence, one of the issues with low staff. It's probably been 3 months since he's been out on a weekend. And he has a day program where he basically goes to parks or malls to walk, or he's not capable of working. He has medical issues that are far beyond normal. At the age of 21, all his teeth were ground down, so he has bruxism. He has self-injurious behavior, skin picks. So he has very significant needs. His staff attend to many issues well beyond the pay that they receive for those services. And I am here to expand the salaries for those individuals doing this so important work for my family and many others.
Thank you so much for coming before us and advocating for not only your family, but for those that do the work. It is a very important, it's going to take some very important decision making for many of us. We're so glad that people come out and speak as you have, because this is what we need to hear in regards to some of the decisions that we have.
Well, I feel it's, at a level of that it really is going to become a real huge safety issue.
Yeah. Well,
thank you.
Yes.
Thank you, Mr. Chairman. If you don't mind my asking, is your son a one-on-one? Is he two-on? How is it
So
classified?
Brian is a two in one out in public. He's about 5'8", 5'8.5", 5'9", 220 pounds. And when he wants to, when he is overstimulated or has anxiety over it's usually a fright and flight situation. I can just describe one situation. He was with staff in a mall parking lot, got out of the van, and he was very fearful of animals. He saw a woman with Uggs boots and thought they were dogs, two small dogs, and escalated to the point where a window in the van was blown out from him hitting it, from being over escalated from a simple situation like that. Very, very difficult to manage at times.
Well, and I'm just grateful that you have found a safe space for him and that you can feel comfortable knowing that he is with people who care about him deeply. And obviously, it's as my good representative said, it's up to us to make these decisions, but we have to be thinking about these stories when we are making those decisions, because we have to care as much about the people caring for your loved one as they care for your loved one.
And think of all the people that don't have the fortune that I do, having their loved one in a home that is caring and supportive like mine is.
Absolutely. And I did grow up with a friend whose brother had Fragile X. So when my ears perked up when you said it, because it is so rare, but I do happen to have a friend who's
very underdiagnosed, in my opinion. The epidemiology is, needs to be done.
Yeah. Thank you so much, Mr. Chair.
Thank you very much.
Animals. They really do. The fur and stuff that they have on them, you mistake them for things that they look like.
That's so true.
So high five them for us. All right. Thank you very much. And our next speaker will be, let's see, where was he? 96? Michelle. I can't even say that last name.
Mahalko.
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 All right. How you doing?
I'm awesome. How are you today?
Good. You're up.
Thank you. Good afternoon, esteemed members. Thank you for the opportunity to testify in support of SB 1547. I'm Michelle Mahalko, Senior Director of Communications at Oak Hill. Our CEO, Barry, just spoke a few minutes ago about who we are, our numbers, and what we do. So I'll just share a little bit of a different Oak Hill story. I joined Oak Hill 8 months ago, and before that, I spent 20 years working across real estate, startups, tech from San Francisco to New York. I've worked with companies big and small, public and private, thriving and barely surviving, and none of that prepared me for what I found at Oak Hill in the last 8 months. So at Oak Hill, currently, I chair our Staffing Crisis Task Force, and I'm using air quotes around crisis, but it's not a nickname. That's literally the official title, because we are truly in a staffing crisis. Every week, our senior leaders who would much rather be innovating about improving care anguish over staffing issues like employee vacancy rates over 60% in some programs. Or this one, last year we hired 500 employees, and last year we lost 500 employees. We are grateful for the increases that the legislature has provided over the last few years, but we're fighting an uphill battle because the $17.25 an hour you provide isn't enough. Inflation since 2007 is 45%, but legislative increases have only covered about 15%. Despite all that, we do have a lot of heroes at Oak Hill, people who are skilled at doing more with less. We have our direct care staff, who are some of the most passionate and dedicated people I've ever worked with, ever. The individuals we serve who do amazing things with us, like talk for the first time. And our founder, Emily Wells Foster, she established Oak Hill 130 years ago because she believed people with disabilities deserve dignity and opportunity when society was content to shut them away. But we're talking about stories and heroes, and stories with heroes also have villains. And When Emily founded Oak Hill, the villain was society's indifference. And today, the villain is still indifference, just a different flavor of it. Every year that our staff doesn't receive a meaningful, predictable increase, our employees fall further behind. Barry talked about that. We hire and lose 500 employees because $17.25 an hour is not enough. And we close programs, another one we're announcing this week, instead of meeting the needs of the individuals and families who count on us. But stories can change, and you guys can help change this story. So I do urge you to support SB 1547 with the requested substitute language by the Alliance. And I really, truly thank you for your time and support. Thank you.
Thank you for coming before us this afternoon. Any questions or comments? Please have a good evening.
Thank you.
And our next speaker will be Darcy Lowell. How you doing, Darcy?
Hi, thank you so much. And thank you for all the incredible work that you guys are doing here. I'm really honored to be able to speak to you today and have the Appropriations Committee here for so many hours. We so appreciate your time and effort. So my name is Dr. Darcy Lowell. I'm a developmental and behavioral pediatrician with special expertise in early childhood mental and relational health. I'm a member of the board of the Connecticut Association of Infant Mental Health, the American Academy of Pediatrics, and I work at the Yale School of Medicine and Pediatrics. I'm here today in support of HB 7263, an act concerning transforming children's behavioral health Policy and Planning Committee. I have seen the excellent work that they have accomplished throughout the time that they've been in place. But I am concerned that early childhood mental health has been almost absent over the past year. I am here not for any money, but to request 2 additions to the composition of TCB, an expert in early childhood mental health and a developmental and behavioral pediatrician. Now, it's clear that we're in a mental health crisis. The numbers of children experiencing mental health disturbances absolutely exceed our capacity to serve them. So why is it so important to address early childhood mental health? Well, the overall prevalence of diagnosable mental health disorders in children under 5 years is 16 to 20%. And if children live in poverty, it's even higher. Many of these families have experienced chronic stress and trauma. We know that this is toxic to the developing brains and bodies of young children. Left untreated, these children go on to need much more intensive services like residential treatment, hospitalization, DCF involvement, foster care. There are effective early interventions. We have scientific research that has shown that early responsive nurturing relationships between young children and their caregivers serve as powerful protective buffers to chronic stress and trauma early in life. These relationships are a source of healing and resilience, and this is the key to lifelong physical health, learning, and success. So I believe that we need an expert in early childhood mental health as part of the TCB conversation. But why do we need a pediatrician? Well, pediatrics is undergoing a huge transformation. The American Academy of Pediatrics is centering the critical importance of safe, stable, responsive, nurturing relationships between young children and caregivers as the most fundamental driver of child well-being. Screening tools are not enough. What does one do with a positive screen when there are so few clinicians who are trained to work with very young children and their caregivers? But there is another way forward. With the new imperative from the American Academy of Pediatrics, we have an opportunity to train, support, and transform the role of pediatricians so that they can build safe, trusting, respectful partnerships with caregivers. Listen closely to caregivers' concerns, fears, and trauma. Build on strengths, problem solve together, and address the social drivers of health. But more. When there is trust, pediatricians can actually intervene very early and effectively to build early relational health, the critical buffer to stress and trauma. In this way, they can help fill the huge gap in availability of early childhood mental health service providers. By beginning way upstream, pediatricians have an opportunity to help the family heal and prevent children from developing later severe mental health disturbances. Intervening early is much easier and more effective and saves hundreds of thousands of dollars. We believe in the integration of physical and mental health for all children, as I believe most of you do. Please bring a developmental and behavioral pediatrician to the TCB table. Thank you so much for your attention.
Thank you. Thank you, Darcy. Questions, concerns? Have a nice evening.
Thank you so much, and thank you for all your hard work.
Appreciate it. Next speaker is Simon Wells.
Hi, how are you?
Good.
Good afternoon. So, first of all, thank you for your time today. I've been listening in as much as I can and appreciate the engaging conversation. I'm here in support of SB 1547. I'm Simon Wells. I'm Chief of Staff at Horizons. We support people where they live, learn, work, and play. And we serve over 1,600 people with developmental disabilities statewide. We have around 250 year-round employees. I've been listening, and rather than just read my testimony, I think we wanted to kind of get into some details. I think a common theme has been that we're dealing with a staff crisis, and that's based on us not being able to keep up with competitive wages. At Horizons, our starting wage is $18.70. For employees who've been with us for 1 to 5 years, they're looking at about $19 to $19.50 an hour. For employees who've been with us for 10 plus years, they're looking at around $20 an hour. And we have a couple of great long-term employees who've been with us for 25 years. They work as support coaches, and they earn $22.20 an hour. So a 25-year vet is making about $4 more than, $3.50 more than someone who's walking off the street as a brand new hire with no experience. Some stories I wanted to share, but maybe I'll stick on the theme of wages first. So this may have already been discussed today, but we like to compare apples to apples, and there are developmental service workers that work for the state. That entry-level position is $23.30. So that exceeds our 25-year vet by over $1. I'll just leave you with that because I think that tells it all. There is a DDS custodian position. They start at $19.50. No disrespect to anyone who is a custodian. I've been a custodian through my life. It's meaningful, important work, but you don't need to have the same training and requirements to support people with complex needs. And they are making more than a 5-year vet here. So this is the situation we're in. We can't compete with that. And this is challenging work. It's meaningful work, but it's challenging. And you need to be able to have folks who want to be here and want to be here for the long term, because having a strong relationship with those we support is what makes the magic happen. And when it is a revolving door, when people leave because they don't want to deal with some of the challenges that some of the folks that we support present, and they say it's not worth it for this money, we start over again and we bring in a new person and we get them up to speed and we try and build that relationship. We're lucky that we have some people who've been here a long time, but when you do have that ongoing turnover, you lose a lot of talent and you lose a lot of knowledge. And that's really detrimental to the success of those we try to support. We are having a training this afternoon, and it's because many of our employees are just feeling burnt out, mentally stressed, mentally drained, and they don't do their documentation on time. And this was a meeting to really look at the barriers that they have to try and have them do some of the work requirements that they have. And, you know, so we were looking at barriers, and many were, I have to pick up my kids, or I'm mentally drained. I just need to get home and clear my head, and then I forget. And, you know, one person said that I have to leave straight away to go to my second job to work until midnight. and that's why I don't get it done. So the state has essentially used nonprofits to do the lion's share of the state's critical work, yet the state has created this body of working poor, and it's just not right. And I don't know how many more times we have to come here and say the same thing. So I'm urging you to please index funding, make the adjustments that were shared by the Alliance, and nonprofits always figure out a way to do it. And I think that's been exploited for many years because we
Summarized there, sir.
I'm getting to my punchline. So we were testifying for the governor's budget, and my colleague was talking about an individual who has not received support for 4 years. And he had a very sad story and had to tell the parent that he can no longer support, cannot provide support for her son. Since then, the very same person who said we can no longer do it has himself put himself on the schedule to support this individual for 1 day a week. This is what I mean. Nonprofits figure out a way to get it done. We need you to figure out a way to get it done and get us paid properly. Thank you for your time and support today.
Thank you for coming before us, sir. Wishing you a good evening. And
You as well.
questions. Have a nice. Our next speaker will be Heather Latora from Marrakech. Not here. So that was Heather. How about Mark Hedrick? Mark Hedrick. In person. Hanging out.
Lucky number 100.
Good afternoon, Representative DeGraw, Representative Nolan, and members of the Appropriations Committee. My name is indeed Mark Hedrick. I represent Oak Hill. More specifically, I'm the Senior Director of Education for Oak Hill. I'm testifying in urgent support of Senate Bill 1547, an act that would index nonprofit rates to the CBAC contract. As a little side note, I am also on the Staffing Crisis Committee with Michelle, who you just heard from a few minutes ago. As you've been made keenly aware, the staffing crisis across Connecticut's nonprofit sector is not just a challenge, it's an emergency. It's the most severe I've seen in my 30+ years in education and my nearly 8 years at Oak Hill School. Our school currently employs over 150 direct support professionals, assistant teachers, and paraprofessionals, and currently has about a 35% vacancy rate among our direct care positions. This has led to us not being able to serve our communities and most vulnerable population. At any given time, we have over 50 students on a waiting list. Last year, we had about 30 students on that waiting list, so there's a pretty significant increase. This is the direct result of chronic underfunding, which has made us unable to remain competitive in today's job market. We are competing with businesses such as department stores and fast food chains that offer the same wages, but with far less responsibility. At Oak Hill, a direct care worker starts at $17.25 an hour under current state funding. In contrast, a state-employed direct care worker begins at $25 an hour, with guaranteed cost of living increases and step increases built in as well. This wage gap, combined with skyrocketing costs, is unsustainable. Over the past few years, our operating expenses have increased dramatically. I don't need to tell you about food costs. Fuel costs have risen significantly. Insurance premiums have skyrocketed. Our transportation costs have almost doubled. A $45,000 Lyft van is now running about $80,000. Private special education schools like ours save districts substantial money. If we cannot serve students with significant needs, many of these students will be sent out of state, leading to unforeseen costs for public school districts. What we are asking for is reasonable and fair. Our frontline workers need and deserve an adjustment to our rates to keep pace with inflation. Indexing these rates to the CBAC contract is a common sense approach that would provide the necessary funding to continue serving Connecticut's most vulnerable population. You've been listening to our testimony about these longstanding funding disparities facing nonprofits. Now do the right thing and make a decisive, positive change. This is your moment to do what is right for the people of Connecticut. We need your support now more than ever. Thank you for this opportunity to testify, and we look forward to your support. I'm happy to take any questions with the 20 seconds I have left.
Any 20-second questions left? Looks like you're all set. So
All right. Thank you so much.
And do we have Aaron Stanley? No. How about Lucia Shen? Did I say that right? Right. Welcome, and thanks for waiting as long as you have.
Good evening, Senator Olson, Representative Walker, Representative Nolan, and esteemed members of the Appropriations Committee. My name is Lucia Shen, and I live in New Haven. As a Master of Public Health candidate at the Yale School of Public Health, I research behavioral health equity and policy. I also bring professional experience working with youth mental health initiatives. Thank you for the opportunity to testify in support of HB 7263, which proposes critical additions to the Transforming Children's Behavioral Health Policy and Planning Committee, 2 substance use treatment providers for young adults, and a behavioral health advocate. These voices are essential to strengthening Connecticut's behavioral health system. Like much of the country, Connecticut faces a youth behavioral health crisis. According to the 2023 Youth Risk Behavior Survey, 1 in 4 high school students reported poor mental health. Over 35% reported persistent feelings of sadness or hopelessness, higher among female students and Hispanic Latino youth. Long wait lists, provider shortages, and culturally unresponsive care continue to worsen disparities, particularly for youth of color and low-income families. The inclusion of 2 providers of substance abuse treatment services to young adults is a crucial step toward integrated and age-appropriate care. Substance use disorders often emerge during adolescence and early adulthood and are closely tied to mental health conditions such as depression and anxiety. Yet, substance use services are too often siloed from broader care, leading to fragmented support and worse outcomes. In 2023, 27.3% of high school students reported ever having used marijuana. 9.6 reported misusing prescription pain medications, 21.6 reported current alcohol use, and over 14% of students reported being offered or sold drugs on school property. These numbers underscore the urgency of bringing in providers who understand these challenges firsthand and who can help shape strategies rooted in prevention, early intervention, and recovery. I also encourage you to consider restoring the proposed budget cut by the Governor's Office to the Department of Mental Health and Addiction Services Prevention Unit. The addition of a behavioral health advocate brings a critical independent voice focused on accountability and client-centered care. Despite federal and state parity laws, disparities in access and coverage remain widespread. In 2017, patients in Connecticut were at least 10 times more likely to receive out-of-network care for behavioral health office visits than for primary care, double that of the national likelihood, and ranking Connecticut as the 4th highest state with disparities in provider network use and contracted reimbursement rates. The behavioral health advocate is uniquely positioned to elevate these concerns, especially for families navigating denials, long delays, or culturally unresponsive care. As a student of public health, someone who's worked closely with youth serving systems, and a young person with behavioral health needs, I've seen how fragmentation, inequitable access, and lack of representation cause lasting harms. HB 7263 helps address these issues at the policy level by ensuring that the people who know the system's gaps best are at the table. I urge you to support HB 7263 and continue building a behavioral health system that reflects the full spectrum of challenges faced by Connecticut children and youth, including those impacted by substance use. Thank you for the opportunity to testify.
Thank you for coming before us this evening. Any questions or comments? Have a nice evening.
Thank you.
Thank you. And our next speaker is Michael Hanna from Oak Hill.
Yes, good afternoon.
How you doing, sir?
I'm doing well, thank you. Pleasure to be here with you all. I appreciate the time. My name is Michael Hanna. I reside in Glastonbury, work in Hartford, and go to church in Newington. So I invest my time, energy, and resources into a few different places in the state. I'm here today representing two nonprofit agencies. One is Gilead Community Services in Middletown, which provides mental health and substance abuse services. I've been on the board of directors for 7 years. I'm also representing Oak Hill and have served on that board for 11 years, and this year was elected as the board chair. You've heard from many representatives of Oak Hill already, so I will try to be very concise. Oak Hill has been a definitive leader in the disability space for the state for more than 130 years. We have a strong track record of quality and innovation. We've been able to transform and evolve as the needs of our participants and the community at large have changed, as well as the environment in which we work and operate has changed. And we're proud of our legacy, but the legacy is at risk. And we're now at a point when our ability to continue to innovate and transform, as we have in the past, is severely diminished and challenged. So we're funded primarily by the state, yet the state is also our competitor. So our competitor determines our funding. We cannot pay a competitive wage to our direct service professionals. We cannot hire and retain an appropriately skilled workforce. We cannot fill beds in programs. We cannot increase rates or fees or generate revenues as many other organizations are able to do. So we've done all that we can on our end to address our funding challenges and everything that comes with insufficient funding. In fact, we've done significantly more than what could have reasonably been expected, but we just can't do it any longer. There is no more for us to squeeze out. And so we need and are asking the state to step up and do more. And when you do, we will then be able to meet the needs of so many more Connecticut residents. I, for 35 years, have worked for one of the oldest and largest corporations in the state. So I bring that background, those experiences, that business knowledge into my board service. And I have to say that I am frankly baffled by the way that the state works with the nonprofit community in Connecticut and how things are currently functioning. So we desperately need to revamp and revitalize the funding structure for nonprofits. So I'm here today in support of the fundamental concept of SB 1547. We have a huge funding gap to cover in order to reach parity, but then indexing future rate increases is something that we absolutely support. My understanding is that state workers are indexed, even our legislators are indexed. So indexing is not a foreign concept. It should be easier than not to say yes to indexing for nonprofits. So please do what makes sense and do what's right. Thank you for listening and thank you for your consideration.
Thank you so much for coming before us this evening and hanging in there to speak before us. Any questions or concerns? Have a good evening, sir.
Thank you.
And Patricia Voorhees from Bethel Arts. You have to unmute yourself, Patricia.
All right, can you guys hear me now?
Yes, we can. How are you?
Yes, I apologize for that. And thank you to the committee for hearing my testimony this evening, and thank you for your endurance. I am here today in support of Senate Bill 1551. My name is Patricia Voorhees. I am a resident of Bethel, Connecticut, and a business owner there, and I sit on the board of Bethel Arts. I'm here this evening to give you to discuss Bethel Arts and to provide an illustration of how funding for the arts was really able to ignite a small and burgeoning arts organization and create incredible vibrancy and enhance the economic health of our community and encourage you to continue to do so. So prior to 2020, Bethel Arts was an organization that was operating under the auspices of the Western Connecticut Cultural Alliance. during 2020, we took the time to obtain our own nonprofit. During that same time, our community changed substantially. We had many new residents, and all of us were changed by the pandemic. So as we had this newly given nonprofit status and in a community that was experiencing significant change, our question was, what should Bethel Arts be to the community? What resources and artists do we have in the community, and how could we enhance access to the arts and create more vibrancy and economic vitality in the community? So we applied for and were given a grant from the Connecticut Humanities, and from that, we were able to embark on putting a strategic plan together. What we did is we actually brought together some community advocacy. So we created an advocacy group of about a dozen diverse folks from our community. We created a community survey and sent that out so we could, from both those things, really get some input in terms of what Bethel Arts could best do to serve the community. We had the guidance of an experienced nonprofit strategy consultant help guide us through this process. And so through 2022, we were able to complete that, putting the strategic plan, and began to roll it out in 2023. And if you can roll forward to where we are in 2025, we're really experiencing the benefits of being able to fuel our organization through putting that strategy together. We've enhanced our board. We've added 4 new members. We've added 5 new members, 4 of whom are business owners within the town, including myself. We also have experienced artists on the board, and it is chaired by Bethel's Director of Economic Development. We've rolled out some really exciting programs. The first is our Arts and View program, which actually leverages the space and some of our local businesses to do art shows and exhibits. And between 2024 and 2025, we've had over a dozen successful shows. I am chairing a committee wherein we're currently in the midst of a large-scale sculpture exhibit. And we were able to get 17 artists submit 38 sculpture for consideration for 7 spots. That is launching on Earth Day this year. It has created a tremendous amount of excitement in the community, and we know that it will bring people, residents and non-residents, to the town to enjoy that and to really help enhance the economic health of our businesses. So we have seen firsthand the value of funding for the arts and encourage you to pass Senate Bill 1551 and continue to do that. Thank you.
Thank you for coming before us and holding on to speak. Any questions? Questions? Have a good evening.
Thank you.
And we are now on 105. Chris Pankratz from Masters in Home Care, LLC.
Good evening, chairpersons, ranking members, and members of the committee. Thank you for sticking with all of us today. Being 105th out of 106 has its perks, but I'll keep this brief and focused. My name is Chris Pankratz, and I'm the CEO and co-owner of Masters in Home Care. We're a Medicare certified, ACHC accredited home health care agency providing skilled medical services across Connecticut. I also serve as chair of the Government Relations Committee for the Connecticut Association for Healthcare at Home. I'm here today in support of House Bill 7254. While this bill lays an important foundation for reviewing Medicaid rates, I want to emphasize that reporting alone isn't enough. Without meaningful funding and stronger timelines, we will continue to see a crumbling system that serves some of our most vulnerable residents. Connecticut's home and community-based services are the most cost-effective part of the Medicaid program. We reduce hospitalizations and support aging in place. But after decades of underfunding, agencies are losing staff and patients are being turned away. 3 key areas of concern. First, 5-year review cycles are too slow. A lot can change in 1 year, never mind 5. We need annual or at least biennial reviews to keep pace with inflation, workforce costs, and rising demand. This isn't just about provider survival, it's about sound fiscal planning. Second, the Medicaid rate study is incomplete. It left out a critical code, the Medication Administration Rate Code, which accounts for over half of all Medicaid home health expenditures. Without it, the study lacks the accuracy needed for future funding decisions. And last, the subsequent visit rate penalty must go. Providers are paid half to see a second patient in the same home, even though the full clinical work is still required. This penalty punishes efficient care and contributes to access issues. In closing, HB 7254 is a step in the right direction, but it must go further. It must correct omissions like the medication administration visit code, shorten the review timeline, and begin stabilizing the system now. With potential changes at the federal level looming, stabilizing home and community-based services is the best defense. We're talking about the most cost-effective care delivery system we have. So if we wait until 2030, it will be too late. Thank you for your time and your ongoing commitment to Medicaid reform. And I welcome any questions and encourage you to review my written testimony for more detail.
Thank you, sir, for coming before us. Any questions? No questions to the left and no one to the right. So thank you. Have a nice evening.
Thank you, Tim.
And we are at number 106. Deidre?
Yes, Deirdre Flannery.
Thank you for holding on and being our last speaker. From Quest
It's an honor. Thank you. All right, thank you very much. So good evening, Representative Nolan and distinguished members of the committee. Thank you for allowing me to the last testimony today. I am Deirdre Flannery with Quest Diagnostics, and I'm providing a comment on HB 7254. Quest Diagnostics is among the world's leading provider of lab services with a purpose to create a healthier world, one life at a time. We serve 1 in 3 adult Americans and half of the providers in hospitals in the U.S. annually. While we're a national lab, we have long-standing Connecticut roots. We've been a Husky provider for more than 30 years. We billed more than 6 million service codes to Husky in 2024. Over 1,100 of our employees are Connecticut residents. We operate 6 labs and more than 100 patient service centers across the state, and we partner closely with nearly every FQHC, and then we share all of the clinical results that we perform with CHN so that the Husky program has a full clinical picture of diagnostic trends. Respectfully, the rate study does not fully reflect the Husky reimbursement for independent labs. Medicaid payment policy for independent labs is based on a 1999 law that directed DSS to ensure that the state received most favorable rates on select medical services. DSS applied the directive to independent labs, but exempted hospitals and physicians for the lab testing that they performed. In the 26 years since that lab payment regulation, the Husky program transitioned fully from managed care to managed fee-for-service in 2012. Most favored rate requirements became banned in 2011, but again, that was selectively applied to hospitals and physicians and did not include independent labs. Husky covered services expanded to include advanced genetic testing for cancer and prenatal services. High complexity diagnostic testing is now used in precision medicine. And most notably, the place of service and the delivery model for lab testing changed. Cost pressures led hospitals to offload complex and gene-based testing to independent labs. And physicians who needed more than CLIA wave test results for evidence-based care have been sending their patients to independent laboratories. The changes in the landscape merit a more thorough, thoughtful DSS recommendation for a sustainable payment methodology for lab services. Also concerning, from a regulatory perspective, DSS does not define most favorable rates. The lack of guidance creates burdensome post-payment audit reviews and the potential for inconsistent application. There is good news, since I'm the last person. There can be a sustainable and evidence-based lab service addressed within the rate study recommendations. We urge the committee to align the payment policies for lab testing across provider types, remove the most favorable rate requirement for independent labs. By doing so, Connecticut will be consistent with Medicare and the 3 peer states in the report, New York, Maine, and Oregon.
With an equal playing field, DSS could then consider rebasing the lab rate schedule at a lower percentage of Medicare and still ensure sustainability. So thank you.
Thank you so much for coming before us. Is there any final questions or comments? Thank you very much, and we wish you a good evening.
You as well. Thank you so much. Be well.
I'd also like to thank our administrators for hanging in there with us all day. Something you tend to do longer than us. It's just appreciated. To my colleagues both here and online, thank you, and I wish you all a nice evening also.